Buenos días a todos y todas.
Good morning, everyone. We have a quorum. It's past 9, so the President is going to kick off today's session. Thank you. How does it work? Nicholas. What's going on there? Oh.
Good morning.
Good morning.
Good morning.
Okay. Trying to get everyone's attention. I can see that you had good rest and you were able to do your homework that we gave yesterday afternoon. And I'm sure you're now ready so that we can get through the next items as quickly as possible. So this morning, before we start, yesterday when we broke off, one of the things that we wanted to do was to bring the resolutions that were pending, and we wanted to give people time for consultation. I have had some engagements with some of the member states. I think it is very optimistic that we might find the right language so that we can move this forward. However, I think we'll need to give them some more time, and I'll propose that we take those resolutions after the lunch break to allow for a little bit more time so that we can all have some agreement. So we wouldn't take those resolutions now, but after the lunch break, which allows us now to go straight into the program of today's agenda. So I'd like to start with item 5.1, Financial Report of the Director and Report of the External Auditor for 2024. I would like to bring the official document 372 to the attention of the committee and invite Mr. Christos Casapantonio, Director of Financial Resources and Management of the Pan American Sanitary Bureau, to come to the head table. I'll now yield the floor first to the President of the Subcommittee on Program, Budget, and Administration for her report on this item.
Thank you, Mr. President. Muchísimas gracias. El subcomité.
The Subcommittee examined an overview of the financial report of the Director for 2024. The full report was not available at the time of the Subcommittee's 19th session in March, as the accounts were still being audited by the organization's external auditor. The Subcommittee was informed that preliminary unaudited figures showed a 1.8% increase in total income for 2024 over 2023, primarily due to an increase in revenue from procurement on behalf of member states. The Subcommittee was also informed that the collection of assessed contributions was substantially lower in 2024 in comparison with 2023, and that the unpaid balance at the end of 2024 rose to $50.6 million. In the Subcommittee's discussion of the report, the decrease in the collection of assessed contributions was noted, and member states were encouraged to fulfill their financial commitments to the organization in order to ensure the continuity of essential activities and programs that have a direct impact on health in the region. Thank you, Mr. President. That concludes my report.
Thank you very much. And we now we yield the floor to Mr. Christos.
Thank you, Mr. President. Mr. President, Director, members of the Executive Committee, thank you for the opportunity to provide some highlights of the financial report of the Director and report of the external auditors. I'm going to provide the highlights of the financial report of the Director, and we have the external auditors to delve more into the details of the external audit. So starting, the accounts were presented according to the International Public Sector Accounting Standards as approved by the governing bodies, and PAHO received an unmodified audit opinion. You would hear from NAO before, unmodified, unqualified. It means, in effect, that the statements were presented fairly in all material respects, and the financial situation for the financial period ended December 31st, 2024. Now, starting with the highlights of the total revenue, on this slide we see the amount of the organization's total revenue for 2024 was $1,302,000,000, which is 1.7% more than 2023. This is the line that you see on top. So we have a slight improvement. And as we can see from the bars, which compose the different streams, we can see from the total revenue of $1,302 million, $813.7 million, or 62%, was generated from the procurement of public health supplies, $199.7 million, or 15%, from voluntary contributions, $107 million, or 8%, was from WHO allocations, and $104 million, or 8%, again, from assessed contributions. And the remaining 77, the dark blue bar that you see there, it's from various other sources. Now, the main component of the various other sources is $66.4 million from investment revenue, $11.1 million from in-kind contributions. For first time, we tried to capture in the financial statements, get information of the in-kind contributions, which is something very important. Many member states and donors support PAHO, and this is reflected in the statements now. And of course, we have the same amount on the expense side. Now, coming to the assessed contributions, this slide, you've seen it on Monday. We see that the collections for 2024 were down significantly versus previous year. We see the dark blue, it's collections from previous years, and the light blue is the collections of the current year. So the collections of the current year really put us behind in 2025. We ended up the unpaid balance at the end of the year to be from 30 to 50. So again, as the director mentioned, and thank the member states that provided the contributions, we appreciate that the members pay their dues so that we proceed with the technical cooperation as you approve already during these days. Now, going to the next slide, we see the procurement, revenue from procurement on behalf of member states. In 2024, the total value for procurement from the regional revolving funds was $813.7 million, marking a 9% increase from 2023 and a 4% decrease from the baseline year of 2019. But this is really, we're picking up on this one. In this year, 2024 indicates a stabilization trend at pre-pandemic levels, reflecting the region's commitment to continue routine immunization efforts and restore the gains made by public health programs and the strategic work with the countries on access to safe medicine at affordable prices. On this slide, we see the revenue from the voluntary contributions. The PAHO non-emergency voluntary contributions revenue was $75 million in 2024, the blue bar that you see there, a decrease of 6% from 2023. PAHO emergency preparedness and disaster relief revenue was $25 million, a decrease of 28% from 2023, as expected. But if you compare it with the pre-pandemic level, it's still double. So that's something to note. The national voluntary contributions are earmarked funds from member states for projects specifically benefiting their own countries. In 2024, the national voluntary contributions revenue was $99 million, a 6% increase from 2023. So, as the director made note in the first day, you see that there is an increase versus the pre-pandemic levels, and that's important to note. Both in the voluntary contributions and at all the an emergency, actually, and national voluntary contributions. It's an attempt to diversify the sources of funding, which is very important. Now, coming to this slide, we see the different expenses, and we notice a slight increase in the revenue, but you see a decrease in the expenses, which shows the effort of improved efficiency across the spectrum. And of course, this had resulted in the surplus that we documented this year. And because we have the supplies as part of the expense, which is the big line below, the blue line, which is highlighted there. We remove this in order to isolate and see the supplies and see how the expenses are without the supplies. And actually here you see a reduction across the different lines. So if we can see for the staff cost year over year, which is the first bar that we see, accounts for 12.2% of the PAHO expenses at 149.2 million. This represents a decrease from the previous year. This is a net effect of increasing salaries, and the decrease comes from the actuarial impact of the credit that we received that passed through the profit and loss. The contractual services constitute the second largest expense category in PAHO, and there is, that you see here, year over year, a 34.4 million variance from the previous year, and this attributed to decrease in meeting facilities, professional services, and technical writing, perhaps due to also to unwinding of emergency voluntary contributions. We see also a decrease in the travel expenses to 41 million from 56 of the previous year. And this decrease is attributed to a reduction in the two most significant categories: 2.9 million from travel from PAHO personnel and 11.3 million decrease in travel in events from different participants. And the other general expenses, you see an increase of 10 million, which is the cost of the contributions in kind. So in effect, the general expenses remained the same. On this slide, we see it's important, and we decided to show this slide the last couple of years because it's one of the biggest liabilities of PAHO. The PAHO Staff Health Insurance manages a health insurance program for active and retired staff, and this program carries a liability for the cost of future health care, which is calculated from actuarial projections. This fund is part of the Staff Health Insurance Fund of the World Health Organization, administered by the Global Oversight Committee, which advises the Director General of WHO. In 2024, as you can see, the defined benefit obligation, which is the gray bar, for ASI experienced a decrease, moving from 265 million to 244. The decrease can be attributed to several factors, and primarily is the discount rate, which increased from 5.1 to 5.9. And other notable characteristic that you should see is that the assets increased also. And so this is attributed to investment income and additional contributions of the organizations in order to increase and have a steady improvement in the funded liability, which is the line that you see there, which goes over time from 12% to 42%. So this is important to note. So as a summary, PAHO has received an unmodified audit opinion for the financial statements, which means that they were presented fairly in all material respects of the financial situation for the period ending 2024. And with this, I would like to thank our new auditors, the Controller's Office of Chile, which it was the first year that they audited the financial statements. And I would like particularly to thank the Controller, Dorothy Perez, and Ricardo Provoste, who is the Director of the Audit, Macarena Andrea Martinez Rivera, who is the Lead Auditor, for the cooperation and for the review. The auditors reviewed 2 offices and the headquarters. They reviewed the internal controls of the organizations, and we are very open to their recommendations. Management of PAHO is responsible for the internal control framework, and we are open always to constructive feedback, which we had from the Controller's Office of Chile, and you are going to listen afterwards to some of the recommendations for which we have action plans on how to remedy whatever the auditors have found in a factual way. So, continuing with the summary, consolidated total revenue increased by 1.8% to $1,302 million in 2024. Unpaid balances of assessed contributions at $50 million at the end of 2024. Again, looking forward to your payments of those states that are behind. Voluntary contributions are at $200 million in 2024, with national VC higher than 2023 and baseline year in 2019. Emergency VC lower than 2023 as expected, but still higher than the baseline year. Procurement on behalf of member states increased by 9% in 2024, reflecting the commitment to the region to continue routine immunization and access to safe medicine at affordable prices. And the expenses, as you noticed, they were reduced across different lines. Basically an effort of efficiency across the fronts. And with this, I conclude my presentation, and I'm open to any questions that you might have.
Thank you very much. I now open the floor for any discussions you might have. We start with Canada.
Thank you, Mr. President. Canada notes the Director and External Auditor for their respective reports. We are pleased to note PAHO's continued attainment of an unmodified audit opinion in 2024, and that no significant internal control weaknesses were identified. We applaud PAHO's technical achievements over the last year, including continued efforts to leverage its unique position to provide technical guidance and support to member states. We are particularly pleased to see that the Americas celebrated 30 years without wild poliovirus in 2024, illustrating the value of collective efforts in health and PAHO's role in helping advance those efforts in the region. We were encouraged to note that PAHO reported a surplus in 2024 with decreased costs in several areas, including travel. Recognizing the financial instability being experienced globally, we continue to encourage PAHO to focus its resources in the most cost-efficient manner. Regarding internal controls, we are encouraged to learn that PAHO has initiated efforts to better align its internal control system with international best practices by updating the internal control framework, and that it is undertaking a fraud and corruption risk assessment aimed at mapping significant risks to the organization. We welcome any updates that the Secretariat can provide on these efforts. We also want to commend PAHO for starting to report in-kind contributions in the financial statements to enhance transparency, which the external auditor views as a positive step forward. Turning to the external auditor's report and recognizing that this is the first under its mandate, Canada appreciates the comprehensive review of various important financial aspects. Noting the audit identified several key areas requiring improvement, we want to express our full support for the external auditor's recommendations, including those regarding PAHO's financial statement preparation process, program support costs, and review of voluntary contributions. We urge PAHO to implement them in a timely manner. Thank you.
Thank you very much. We go to the United States.
Thank you, Chair, and thank you for the presentation. We would also like to thank the external auditor for reviewing these financial statements, and we support their many recommendations. As a question for the external auditor, would they be able to advise member states whether there were any recommendations of particular importance? We would also ask that if feasible, future audit reports include an indication of the priority level for new recommendations to help identify which items to focus on. Turning to PAHO's actions, could the Bureau please provide a timeline for implementing the recommendations? We would welcome a general answer now, as well as a more fulsome timeline presented during the directing council. And we would emphasize in particular the audit recommendations on the program support cost policies and request the Bureau create a single comprehensive reference document with a standardized form for considering exceptions. And we would request the Bureau's explanation of when this might be able to be completed. Finally, the United States urges concrete actions to strengthen payment controls, such as improving the corporate review process for agreements and updating the PMIS system to restrict payments to the approved contractual amounts. Thank you.
Thank you very much. We go to Brazil.
Thank you. We're very grateful for the report we've just received. The report of the director provides detailed information about PAHO's activities in keeping with this mandate for public health. This is the best way to ensure for accountability, transparency, and efficiency in the work we do. Brazil recognizes the improvements in efficiency under the current leadership of PAHO, given the complexity, the greater complexities in the cost and the innovative approaches, technological tools, for example, to fully achieve the public health goals based on the existing revenues without having to cut into technical cooperation. We see this as very positive, and even though we have fallen short of what would be ideal, we take note of the reduction in obligatory contributions. In 2024, we would ask all members to fulfill their financial obligations so that PAHO can continue to fulfill its goals that have a direct impact on the health of the region. Taking into account the financial challenges that we've just learned about and that other international organizations are going through, we also recognize an increase in the use of regional revolving funds compared to prior years. This reflects the region's trust in the mechanism and the effort by PAHO to make this increasingly attractive and cost-effective in the promotion of regional productive chains, as well as funds available for meeting our obligations in 2025, and there being necessary flexibility. We also think it would be important for us to talk about strategies to reduce the reliance on this fund so that we would have a sustainable and sound financial footing. Brazil is committed to PAHO and the health of the Americas, and we continue engaged in seeking out solutions that would strengthen our financial wherewithal. Thank you.
Thank you very much. Any other comments? If there are none, I go to Mr. Christos.
Thank you, Mr. President. I would like to thank Canada, United States, and Brazil for the comments. Regarding indeed, so the organization has already action plan for the audit recommendations, and the objective is we already have implemented partially some of them, and the objective is before we have the finalization of the audit of 2025 to have completed all of them. Now, regarding the internal control framework from Canada on the question, we have already a draft which is circulated internally, and it's in progress to be completed within this year. So it's significant progress has been made there. Again, on the issue of the internal controls on the different, let's say, weaknesses that the auditors found in the ERP, in the different systems, we try to be pragmatic as well, because often the controls of a small office that doesn't have a lot of staff are not the same like a bigger office. So we try to adjust our procedure and the process to take into account what happens in smaller offices without sacrificing the control, having compensating safeguards. And I would like, again, also to thank, again, from the United States, the program support policy already is in progress. Just to note on the program support policy, it's not that there was not any documentation. the auditors are asking that everything must be in one document. So there was not really any breach of control, just that the documentation in one place, which is something that the organization is working at. Thanks again for the comments from Brazil on the petition for the payments primarily of the dues to the organization. Thank you very much, Mr. President.
Thank you very much. We now invite Ms. Dorothy Perez Gutierrez, the Controller General of the Office of the Controller General of the Republic of Chile, to present the report of the external audit for 2024.
Muchas gracias. Muy buenos días.
Good morning. Thank you very much to the officials of the Pan American Health Organization. I'm the Controller General of the Republic of Chile and external auditor of this organization, in keeping with the election that took place some time ago. Mr. President, distinguished Secretary, distinguished Director, and all those present, thank you very much for your attention. We will submit the report of the external auditor of PAHO for 2024. The content of this presentation includes the definition of the audit process, with some elements defining the context, the summary of the audit process that we perform on the financial statements of PAHO for 2024. Also, the report on the recommendations that we submitted as an external auditor to the organization, and last but not least, the annual audit planning for 2025. On item 1 that has to do with the definition of the audit process, by way of a context, I wish to point out that the Controllers General of the Republic of Chile is just starting with its mandate as external auditor with PAHO. Our institution was established in 1927. It will celebrate close to 100 years of experience in monitoring, and among its many jobs, it performs audits on the bodies and organs of the state administration in the country. We've played an important role in corruption prevention, and for that we promote different lines of work, including collaborative actions at an international level. It is within that framework that since July 2018, we've performed audits on the financial statements of the United Nations agencies as members of the audit board, and we did that for a period of 6 years. I point out, just to give you the context regarding the experience that we have as external auditor of the institution. Our control and audits have as a main purpose to ensure compliance with the legal and financial provision, to safeguard public goods or the organizations audited, to protect the probity and the administrative integrity in the operation of the institutions. Our audit methodology considers the following: to assess internal control systems, to verify the implementation of the relevant financial provisions that are applied to each organization, in particular everything that has to do with preparing the financial statements, to confirm the authenticity of the support documentation for the various operations, to ensure compliance with the applicable norms that are applicable to the officials and the officers working for the organization in question, to develop recommendations in order to deal with any detected irregularities in the approach of our compliance audits, attempt to verify that the actions and the operations, the systems, and the different integrity aspects will abide by the normative framework that regulates this matter. We also perform financial audits in order to assess the accuracy and the how reasonable the financial institution is in the financial environment. Moving on to the second element that has to do with a summary of the audit process of the financial statements of PAHO for 2024. I would like to point out that as part of this mandate that we begun in 2024 and which is completed in 2027, we check the annual accounts of PAHO corresponding to 2024. And for this, we abide by international audit standards, also international public accounting standards, IPSAS, the SI Code of Ethics 130, and Quality Control SI 140. These are the highest international standards for this matter. The documents or the deliverables after our work are our annual audit opinion, the extended audit report, that is to say the detailed report, the letters and reports of findings to the administration, and the purpose of our audit was to issue a professional opinion on the responsiveness of financial statements in order to report to the Executive Committee and to PAHO's Audit Committee. The stages through which we develop our work included first planning, then the review of the internal controls, the substantive procedures. With this, we mean the evidence itself and the report. From the planning stage, we develop an audit strategy and a preliminary plan, that is to say, a preliminary control plan. Then we define the audit team and the official timetable for visits for headquarters and for offices in the different countries. We identify the risk, the materiality, and the key audit areas. And then we move on to the second stage that has to do with internal controls, where we perform assessment and test of internal controls that were operating in the organization and those that were relevant for financial management. We also identify some steps for improvement or weaknesses that might have an impact on financial statements, and then we move on to substantive tests or procedures through which we carry out a detailed review of the balances and the most outstanding transactions. We also verify directly how responsive the financial information presented by the organization is in order to conclude with the report stage, where we prepare and we deliver, we submit the audit opinion, the reports, and the findings letters. And at this meeting, the one that we're currently having here, we're communicating the results to the Executive Committee as well as to PAHO's Audit Committee. The summary of the process followed in our work includes that in the visits paid, we verify the internal controls here in Washington, D.C. between October and November 2024. We also review the internal controls of the organization. Specifically, we concentrate on the office in Trinidad and Tobago in January 2025 and then in Honduras in February 2025. And we perform some substantive tests in Washington in March of 2025. And the matters audited in connection with internal control at headquarters included the following: budget management, voluntary contributions, supplies, treasury, human resources and remunerations, and also the accounting PMIS system. Likewise, in the internal control offices and in the country offices, we review the budget management, supplies, also human resources and remunerations, payroll, the delegation of authority, and the governance in said country offices. Thirdly, in connection specifically with the report on recommendations, ours as external auditor, we obtain as a result the audit report for headquarters in Washington, D.C., visited from 29th October to November 21st, which included the following: the approval process of the files, the daily entries in the logbook, and the entries in the diary of different sources, the PSC, and the exceptions, as well as the review of voluntary contributions agreement by the Legal Advice Office, voluntary contributions awards open for more than 2 years, and the corporate review process for voluntary contributions and agreements, and also the standard procedure for cash management. After this, in connection with the Trinidad and Tobago office that was visited between January 6th and 24th of 2025, specifically in connection with the country office, we detected some room for improvement, such as the need for additional official documents in executing consulting contracts. Also, some spaces and opportunities for improvement in the budget and the procurement procedures for PAHO. Likewise, the need for further strengthening cooperation between PAHO and the Ministry of Health in that country for monitoring of the staff. Some inconsistencies in the report of banking reconciliations of the PMIS system, specifically in this system as a fifth element or recommendation. We detected the need for improvement in some situations, such as a payment to a consultant that was greater than the amount stipulated in the contract. So this was a problem of control with the system itself. Likewise, it was also necessary to have additional segregation of functions in the procurement that is done with credit cards for amounts under $5,000. Now moving on to the office in Honduras that was visited from February 3rd to the 21st, 2025. In the country office, we detected as room for improvement the declarations of conflict of interest for the procurement process of goods and services. It is necessary for the people working there to declare their possible conflict of interest with additional detail. Also, in the country office, we detected as room for improvement additional guidelines for hiring people through the employment agency and additional evidence that would justify some of the budgetary modifications that are taking place. Likewise, approvals are required for the budget when it is only a draft budget for additional certainty. In the PMIS system, when we performed this activity in Honduras, we saw that additional administrative supervision is needed in the approval of payments in order to have better controls. It is also important to submit the following in connection with the internal controls of the Pan American Health Organization, that we reviewed all these aspects because this helps us understand how PAHO deals with its processes and how it looks after its financial information. This also enables us to identify where we could find greater risks of possible errors or frauds. And with this information, internal control information, we can better plan our audit and to better decide what tests to perform in order to verify the reliability of financial statements. Now, in connection with internal controls, we do want to state that even though during the audit we identify some opportunities for improvement in connection with internal control, this is typical in any organization, our responsibility as external auditor has nothing to do with issuing an opinion about the internal control of the effectiveness of PAHO. This is a responsibility of PAHO, particularly those that have the roles of supervision of the organization. And we see with very good eyes that the measures are being taken in order to beef up the internal controls in PAHO. In those matters audited, we review the financial statements and what we found according to IPSAS. We also see what's available and what are the investments, the accounts payable, the property, the asset, the equipment, the accounts receivable, the benefits delivered to the employees, the revenues, in particular contributions, the expenses in remunerations or payroll, and then inputs. Now, moving on to the final visit in Washington, the visits paid between March 17th and April 3rd, 2025, we also see some room for improvement in the processes to prepare the financial statements and in the need for improvement in the manual that we have for the accounts plan. It is out of date and we need to further strengthen that manual, also to improve the reports on contributions that are made in kind. Without affecting any rooms for improvement that we detected in the internal controls that we have described, our audit opinion has been issued without any modified audit opinions, and no significant material adjustments are needed, and the financial statements are considered to be reasonable in keeping with the international public sector accounting standards and according to the highest standards on this score. After this, I'd like to move on to the next thing in order to come to an end and talk about the recommendations that were left in abeyance from previous years that had been raised by the auditor's team of the UK office. They had left behind 8 recommendations. We reviewed these 8, and 7 of these were implemented by PAHO and its leaders successfully during the 2024 audit process. And one of these observations was not operable. Out of those that were reviewed, we find the improvement in the continuity of operations and preparedness when dealing with emergencies such as what happened during the pandemic. Also, the inclusion of the responses to the continuity plan for the evaluation of risks of local offices, the strengthening of procurement funds and management of PAHO, and the reception of the different reports. Also, something that was implemented and followed was promoting the participation of member states in shared services and holding a comprehensive evaluation of the needs of the real estate in order to comply with the mandate. We had to optimize the use of some of the properties, and this is also being considered by the organization, and also to improve the operational planning on the use of these properties. Also, the creation of some mechanisms that would better suit for the submission of reports to member states. So these are the 7 recommendations that were left in abeyance by the UK office that was taken, reviewed by our team, and were implemented, or some of them are underway in the process of implementation by PAHO. As regards the observation that was not followed, that has to do with a recommendation by the UK to the effect of considering the modification of the accounting and budget functions in the organic structure of PAHO. This was reviewed by the organization, and it was also reviewed by us as external auditor, and we came to the conclusion that it is reasonable for the organization not to follow this one because we needed sufficient evidence that would enable us to support that it was essential to perform this change in the structure of the organization. That is why it was not followed. In order to conclude with the annual audit planning for 2025, we have planned visits to Washington, D.C. to review the internal control and preliminary reviews between September 29th and October 27th this year, then submission to the Audit Committee on the 29th and 30th of October 2025, the final reviews between March 9th and April 3rd of 2026, and after that, in connection with the dates and the country offices that will be visited, we are assessing which ones specifically in the Caribbean for the second semester 2025. We're working on the date to be defined together with the teams because we have to find the best time in order to pay that visit. And in the office in Peru, we've transferred our planning for February 2026 since in January, perhaps many people will be away on vacation, so February seemed to be a better date, and we have to define specifically the dates for the visit. Thank you very much for your attention, and we are ready to answer whatever queries you might have.
Thank you very much. We now open the floor for plenary discussion. United States.
Thank you, Chair, and thank you very much to the External Auditor for the presentation, and my apologies for asking these questions earlier to the Director. But we very much support the report and the recommendations. Would you please advise the Member States if there are any recommendations of particular importance? And as you're now beginning the mandate of the next 3 years of audit reports, we would please ask, if feasible, that the future audit reports include any indication of the priority level of any new recommendations to help identify which items to focus on. Thank you.
Any other questions, comments? No? All right, if there are none, I turn the mic over to you to answer the United States. Go ahead.
Muchas gracias.
Thank you very much, Mr. President. And through you, to get back to the query raised by the U.S., we take note of the need for indicated the order of priority of each one of our recommendations so that these can be implemented in greater speed, those that are more relevant in terms of impact or those dealing with risks. Thank you very much for the support provided in connection with our work, and we take the firm commitment of delivering the largest number of recommendations to the office as well as to member states. I'd like to thank you for your time, Mr. President, for our presentation, and I will be ready to answer whatever other comment or query might come up. Thank you.
All right, thank you very much. I think you were very clear. So we go to Dr. Barbosa.
Thank you, Mr. President. Déjeme empezar por el final.
Please allow me to begin by the end. This is the first time that we have the participation of Mrs. Perez Gutierrez from the Controller General of Chile, and she's the Controller General of Chile. So this is the first report that is presented by her for the consideration of this executive committee. I would like to thank you for all the detail with which you have submitted this report with very clear and specific recommendations on what can be improved both at headquarters as well as in the country offices. So it seems to me that no doubt you did live up to the role assigned to the external auditor so that the organization can be increasingly more effective, efficient, and transparent, and to abide by all international standards in terms of financial management of the organization. So thank you very much for the report. As we always do, we take very seriously all these recommendations, and we will implement these as speedily and expeditiously as possible, and at the same time to get concrete evidence in order to complete the implementation of all recommendations.
To English, I want to thank Canada, the US, Brazil for their comments about the financial report. Canada, just to remind that this is the report for 2024. In 2025, since January, I implemented the cost-saving measure package, including a reduction, very important reduction in travels. Travels, I always ask our team to try to break it down because most of the travels are not PAHO staff travels. They are indeed the people from the Ministry of Health that are coming or going to regional meetings, workshops, to have technical discussions. I think that in name of transparency, it could be important to have this breakdown to present to member states what is the proportion of these travels that are related to PAHO staff travel and to what are travels that are part of the technical cooperation that we are providing to the point. But this is a very important point that you have raised. This year, we will see a very important reduction because we are only authorizing travels that are supported by voluntary contributions related to the several grants that we have that we need to implement them. And sometimes to implement, we need to have a workshop, to have a travel to a location. But during these times that we still have some uncertainties, all the travels that are funded by flexible funds, as we call that, is the part of our funding that comes from access contribution are suspended. And I'm only authorizing in very exceptional moments. Second, the US, thank you for your comment. I think that when the auditor presented, she presented a table about the recommendations, but just let me tell you that we have regular meetings. When we receive the recommendations, I convey a meeting with all the managers in the organization. We go one by one, we identify the department that is responsible for that, we establish a timeline, and we follow up. And I think that in name of transparency, I think that it's important that we could see a way to provide a summary of this process to member states. I think that this will be really helpful for the overseeing mandate that you have, and it is important that you receive all the information. Brazil, thank you for your comments. Indeed, we are trying to be more efficient, and you can see that in the year 2024, it was let's say, so a good financial year, but even in 2024, I adopted a very prudent approach managing the finances of the organization, because it was expected that the grants that we received to respond to the pandemic could decrease. So we didn't expand the structure of the organization, we didn't create the new structures, we didn't increase the number of fixed-term positions, and this is reflecting the situation that we have now. That is a situation that we have some uncertainties, but that we are moving forward and we are provide technical cooperation. Finally, I just want to highlight again that it's very important that we made an effort to increase the number of partners that are providing voluntary contributions to PAHO. Yesterday or the day before yesterday, I mentioned some of them, but my team told you forgot one. So I will thank again all of them, including the ones that I forgot. So I want to, for the year 2024, it was very important to have the grants to advance the elimination initiative that is aiming to eliminate 30 plus diseases in the region, from malaria to TB, HIV, cervical cancer and other diseases, to advance the strengthening of primary health care, to advance the digital transformation of the health sector, telehealth, telemedicine, to advance the strengthening of primary health care in several other areas and specific projects in different countries. So I want to thank again the United States of America, Canada, Spain, the UK, the European Union, Japan made a donation of $5 million to this joint initiative between the Inter-American Development Bank and PAHO to advance digital transformation in the region. I also want to thank Korea that is supporting some relevant projects like responding to the dengue outbreak in Honduras and in other countries. The India South-South Cooperation Fund, I think that's the name, that is also providing support to Caribbean countries and to Paraguay, as I mentioned yesterday. And CAF is a bank, but made a contribution, a donation, a small one, but I think that's important because banks in general, they like to collect and to offer loans. But in this case, I think that recognizing the relevance to advance the elimination of malaria, CAF provided support to a pilot project in some municipalities with high burden of malaria on the borders of Brazil, Bolivia, Peru, and Colombia. I hope that I haven't forgotten any of the 4 countries. So we really appreciate this donation from CAF. And also some private foundations that are still in the negotiation process, but that also have increased the voluntary contributions to PAHO. I think that this is very important for us to recognize, to acknowledge, and to share with our partners. They are not donors from our perspective, they are partners. They are participating in the process. I forgot one, GSK, German, that provides support for a project in Peru to provide the electronic records for vaccination in remote areas that don't have access to internet. And this will be really helpful to be used in the Amazon basin and all the remote areas. The project is already completed. So I really want to thank them. And finally, again, to also invite all the countries to pay the access contribution. Just to remind you that with no increase since 2012, we have a real decrease for the countries in the value of the access contribution. So receiving this assessed contribution is crucial to keep the organization running, to keep the organization able to provide the technical cooperation in each one of the countries and territories that we have in this organization. Thank you, Mr. President.
Thank you very much, Dr. Barbosa. I think we accept the report, but more importantly, the discussion that arose from the report shows that there have been very prudent management of the financial resources. And given the challenges that the organization has in terms of its ambition with what you want to do and the resources that you have, I think listening to the comments, I think members are pretty satisfied with the direction we are going in terms of management. So I want to thank you and want to say to the committee that the discussions would be reflected in the final report. Thank you very much. We move on to the next item. We go now to item 5.3, report of the Office of the Internal Audit for 2024. I'll now like to bring document CE 176/20 to the attention of the committee and invite Ms. Nuria Fajaro, the Internal Auditor of the Pan American Sanitary Bureau, to come to the head table and present the report. The floor is all yours.
Thank you. Muchas gracias.
Thank you very much. Good morning, Mr. President, Director, distinguished delegates, observers, colleagues, and anyone listening to us through our broadcast. It's not for me to present this document CE 176/20 regarding the internal audit for 2024. The report addresses, carried out, or presents the main conclusions for 2024 by the internal audit and the implementation of corrective measures by management and the general opinion of the OIA about the internal controls of this organization. I would like to underscore a few aspects of this report. First of all, as we always underscore, the OIA is an office that provides advice. It's advisory. It does not take part in decision-making regarding norms, standards, policies, procedures. This enables us to be impartial in carrying out our function and in presenting reports. We're very pleased to tell the Executive Committee that the OIA found no obstacles in the performance of its functions in 2024, nor in the presentation of any of its reports. I also confirm that we did have sufficient resources to conclude our work in 2024. In 2024, the Internal Audit Office stressed audits of the country offices, including audits of documents and those conducted remotely. This is done virtually without country visits, and it is reserved mostly for the smallest country offices or those that we consider low risk. As you can see in the annex to the report, in 2024, we carried out 7 country offices and 4 thematic areas. These included the analysis of the root causes of the findings of the most frequent audits, the environmental sustainable practices within the organization, the hiring process for staff, and digital transformation. We present the main conclusions from all of these different areas. Finally, as regards the internal controls of the organization or oversight, the general opinion of the OIA is that it continues to offer reasonable guarantees regarding the accuracy and the timely recording of incidences and assets in 2024, just as in prior years. None of the audits were graded as unsatisfactory. So I would ask the Executive Committee to take a note of this report and to offer any comments you deem necessary. Thank you very much for your attention. I stand by to answer any questions about any aspect of the report.
Thank you very much. I now invite the Executive Committee to take note of the report and to provide any comments that it deems pertinent. I'd now like to open the floor to the plenary for a discussion. Canada.
Thank you, Mr. President. Canada would like to thank the Office of Internal Audit for this report. We are pleased to see the continued absence of unsatisfactory ratings for any of the internal audits, reflecting a continued maintenance of adequate internal controls across the organization, with the understanding that there is still opportunities for improvement. We welcome OIA's root cause analysis of recurring internal audit findings, which we consider to be a critical step in helping to understand and effectively address recurring noncompliance. We were concerned to learn from the findings that the most frequently identified root cause is a culture of weak accountability. In this regard, we strongly urge PAHO to use OIA's findings from this analysis to help inform the development of its accountability framework, including taking steps to strengthen the organization's accountability culture, for which we welcome an update from the Secretariat on this work. We also note that OIA continues to draw attention to ongoing weaknesses in the second line, for which Canada would like to seek more information from the Secretariat on actions being taken to address these ongoing concerns. Finally, Canada views risk management as key in protecting the organization from reputational, legal, and financial risks, and so we strongly support the recommendations put forward by OIA and encourage PAHO to act on them in a timely manner. Thank you.
Thank you very much. We go to the United States.
Thank you, Chair, and we would like to thank the OIA for the report and for monitoring risks and internal controls at PAHO. We note that OIA did not identify any significant weaknesses in PAHO's internal controls during 2024 that would compromise the achievement of the organization's strategic and operational objectives. We also note that none of the 4 country-level audits performed last year received an overall rating of unsatisfactory, making this the 8th consecutive year that OIA found all country-level internal controls reviewed as satisfactory. However, we noted that the report noted that WHO's internal audit function has, quote, continued to rely on the work of OIA and has therefore not performed internal audit assignments in the region of the Americas. Can PAHO please clarify whether the WHO provides PAHO with any support, financial or otherwise, for the work PAHO does auditing those activities in the Americas region, since it would mean that the WHO is benefiting from PAHO's efforts and work products? Next, we were also concerned by some findings in the analysis the OIA performed to identify root causes on recurring audit issues. We find it unacceptable that OIA found a culture of weak accountability and has been failing to provide an effective deterrent to repeated policy noncompliance. We're also troubled to see the finding that low levels of familiarity with PAHO's rules and regulations are further undermining accountability, since both of those should be entirely preventable issues for the organization. Similarly, and other issues identified, such as repeated noncompliance with PAHO's consultant hiring policy and gaps in procurement transition documentation, are likewise unacceptable. Could the Secretariat please advise Member States what steps it is taking to address these worrisome shortcomings? Next, PAHO should immediately address those concerns and all causes that OIA has identified in the report. PAHO should also swiftly complete the organization's accountability framework in support of these efforts. Finally, the United States is deeply concerned by the indication in one of the country audits that the most senior country official in a country office was found to have been overriding internal controls in a manner that led to thousands of inappropriately handled financial transactions for several years. How did management allow this to occur? Was this individual investigated? And what disciplinary actions has the Bureau carried out against this gross act of noncompliance? What is being done to prevent similar instances in other offices right now? Thank you.
Thank you very much. We go to Brazil.
Thank you, Mr. President. Brazil is grateful for the report and the presentation of it made by the internal audit officer covering the operational aspect of this organization, compliance with its objective of being impartial and objective. We underscore the importance that for the seventh year going, there were no unsatisfactory audits. Also, the fact that for the 8th year in a row, there was no such unsatisfactory classification. Among the main causes, root causes of incidents, is a low level of knowledge about the policies and internal controls specific to each area. On that, without taking into account all the different positive points that were mentioned by the report, we would also like to ask what measures could be put in place to bring about a change in that diagnosis of low awareness. Also, regarding corrective measures rolled out, we see that there has been a good rate of compliance with recommendations made in prior audits, 98%. So we're very grateful for the presentation of this report. Thank you.
Thank you very much. We go to Chile.
Thank you, Mr. President. We take note of this report, and we're very pleased to see the commitment that PAHO has for accountability, transparency, and ongoing improvements in its management. We're also grateful to see the changes made to ensure the independence of its recommendations. We do think that the findings, such as a low culture of accountability, a lack of knowledge of the policies, norms, rules, and regulations, and some internal policies, does not meet the interests of the office of the Bureau, and that leads to some human errors in carrying out certain policies, all of which warrant further attention and are of concern. That's why we celebrate those actions that have been taken already to address that. The excess of bureaucracy in the procurement process and a lack of compliance with the diversity criteria is also a source of concern for Chile. We are not very representative of this organization, so I thank the Secretariat for its interest in overcoming this and correcting this. We thank the Internal Audit Office for the points raised, especially as regards improvements in the implementation of recommendations made and the consolidation of the three-line model as an oversight model and adherence to international auditing standards. All of this strengthens the technical independence and trustworthiness or reliability of the audit. This shows a mature organizational culture which appreciates accountability as a pillar of good governance. We reiterate our thanks to the office for this report, and we urge the Secretariat to forge ahead in this process of ongoing improvements in management. You can count on Chile as an ally and partner in this process. Thank you.
Thank you. We go to El Salvador.
I just have one question. At the end of your presentation, you mentioned that the result was no unsatisfactory ones. And so what is the scale of this result compared to that which was obtained, and what does that actually entail?
Thank you. Since there are no other comments, I'll now turn the floor over to you to respond.
Thank you to Canada, USA, Brazil, Chile, and El Salvador. Thank you for paying close attention to the report. For us, it's very important to know which are the topics that are of your worry. If you allow me, let me start with the last one, with El Salvador.
Our reports are classified. There are 4 levels of classification. From unsatisfactory to satisfactory. So of the 11 audits we've carried out, there was none that was classified as unsatisfactory. We don't issue an opinion for the whole year, just those opinions on each report. In this case, this summary can be found in annex document, and most of the audits can be found in the two intermediate ranges, partially satisfactory with some recommendations that we offer. And we had one audit that was
In the case of
unsatisfactory with El Salvador. Now, in the case of the United States, you meant
the second line of defense, as we have it in the House right now, it was created pretty recently, and they have been focusing on developing the internal control framework. I know that there are works now with the accountability framework and accountability policy, and we expect to see results from that very soon. You mentioned what is the relation that we have with WHO. I think that since this internal audit office was created like 15 years ago, what we do is that we send all our reports to Geneva for their knowledge, but that's it. I mean, they don't conduct any audit in our region, and they don't validate or approve our reports. It's just for informational purposes. We noted that you asked about the top senior official in one of our offices that was overriding controls. From internal audit, what we can say is that that practice stopped immediately during the audit conduct. If there was any follow-up disciplinary measures, this goes beyond the mandate of internal audit, and we don't have a reference for that. And we noted your concerns about some inconsistencies in the administration of consultants and procurement. We try to be vigilant on that, as they are recurrent in our reports. To Brazil, yes, we agree that the low level of knowledge of some policies was one of the problems. We're going to leave the resolution to that administration. Sometimes it's more about some small updates done to the policies that maybe they are not communicated on time, or they don't reach the administrators or final user of those policies. Also want to say that the work that we did on root cause analysis was about perception. So we asked people what was the perception, why they thought that some inconsistencies in the implementation of policies happen. So there might always be a perception that something is going on. Administration may have a different perception, but I agree with you that some communication needs to improve in that area. Yes, you mentioned our the implementation rate. It's high. It's comparable with other organizations, sister organizations in the UN, and we are proud of that. As Dr. Barbosa mentioned before, we do follow up of our recommendations pretty often. We have a formal exercise from our side, but also we have the support of the meetings that he chairs once or twice a year. And as he said, we go one by one through all the recommendations, and we try not to have recommendations that are longer than 2 years. That's our aim, and that's how we work with administration. At Chile, yes, muchas gracias por sus.
So I thank you for your remarks, Chile. We do try to increase the transparency of this organization.
Those are all my comments. I hope I have responded or commented on your interpretation. Thank you.
Thank you very much. I now yield the floor to Dr. Barbosa.
Thank you, Mr. President. I want to thank the comments from our member states. Just to maybe to summarize the process, I think that Núria Fajardo has already addressed some very, very important questions that you have made. When we have the report from the internal audit, immediately I share this report with the relevant office, and when there is a wrongdoing, it goes to investigation. We had one country office that was immediately sent to investigation office to perform an investigation. Just to first to recognize that we have increased the number of audits performed every year. We increased it by 50%. We used to have 80 per year. Now we have 11, 12 each year. And based on the risk assessment, we have in-person auditing process or desk audit, as Mrs. Ayardo mentioned. For some of and also, she also informed that for the internal audit reports, we go each one of them, of the recommendations to implement measures to prevent them. So the accountability framework, for instance, is now under development. That was also reported from the audit internal office, and will be published by until the end of this year. We also have the internal control framework that is under discussion to have a better definition of the different roles of each one of the participants of the system. So the roles and responsibilities will be better defined. Also, the PMIS system is currently being updated to prevent the issue that occurred in the country office that was appointed. So these are some examples. The consultancy policy, the consultancy hiring process that was identified in several country offices was subject of a new policy that was published 2 months ago, if I'm not mistaken. And I have already asked the internal auditor to include in the auditing plan for 2026 this topic as a topic to be audited across the organization. Of course, as a decentralized organization, it's 27 country offices and the 2 centers. We need to guarantee that the internal audit has all the resources that they need to oversee, to perform the auditing report. And I really think that indeed it is a very, very important process that you have in the organization. And just to remind all of you that since 2023, all the auditing reports are available to member states. If you want to know the results of these reports, they are available. You can consult, receive a copy to identify how we can be maybe better prepared to make the recommendation for the Secretariat. But thank you, very, very important suggestions and comments that you have made. Thank you, Mr. President.
Thank you very much, Dr. Barbosa. And with those comments and all the discussions that we've had, it would be reflected in the final report. So we're at that point where we can get a coffee booster. So we'll take a break and we'll come back, and we'll come back at 11 and we'll resume. Thank you very much.
My name is Sandra Francis, and I'm from Yarongpar village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it strange from being far from home. But now I'm comfortable, and as you can see, I find it like living with others and finding new friends, you know, and mixing around, and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death in like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department, because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works. So we input the information quicker, and you don't have to do multiple copies in order to share to the different wards.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness believes, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities. strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we're able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time, we are ensuring better care for NCDs through integration in primary healthcare.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers received important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then shared their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes souterrain comme ça a vraiment aidé parents yo, aider ti moun yo pour capable joindre vaccin dans localité côté que yo vivre là.
Parler des maladies évitables par la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse et nous en pleine activité réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome, rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout qui est moun qui a moins de 15 ans.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the HEARTS Initiative.
At the core of the HEARTS Initiative is the HEARTS Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of HEARTS has introduced a standardized approach to the way we manage high blood pressure patients.
The HEARTS protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the HEARTS program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The HEARTS protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well, and if they have any issues or concern that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice, and we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using as part of the HEARTS initiative, they're somewhat designed to be less burdensome on the patient because the number of pills that the patients would be required to use to control their conditions are reduced. because now we are making use of combination therapy. So one pill will contain maybe your 2 high blood pressure medications that you're taking at present.
Medication that are available through the Hearts Initiative are heavily subsidized, right? Patients that are less than 60 would pay a small fee. Those who are over 60 and over, it would actually be free as per protocol that already existed.
Following the introduction of the Hearts Initiative, we anticipate better compliance among our patients. We anticipate a reduction in the number of individuals who have uncontrolled high blood pressure. And at the end, we anticipate that in the long run, a reduction in the number of complications and the number of deaths that we are seeing as a result of high blood pressure and cardiovascular disease.
El cáncer infantil afecta a miles de familias en el mundo cada año, generando angustia y sufrimiento. En la región de las Américas, los gobiernos, la OPS y sus socios se han unido en la iniciativa Cure All para afrontar este desafío y devolver la esperanza.
Desde el año 2019, la Organización Panamericana de la Salud, en colaboración con el St. Jude Children's Research Hospital, trabaja incansablemente para mejorar la detección oportuna del cáncer en niños, niñas y adolescentes. En Latinoamérica y Caribe estamos logrando que más países prioricen el cáncer infantil y lo incluyan en políticas públicas que contemplen actividades para promover el diagnóstico oportuno. En los últimos 5 años, se ha incrementado por lo menos en 3 veces el número de países que cuentan con una guía nacional de detección precoz y sistemas de referencia. Ya estamos viendo los primeros resultados y se está logrando que más niños puedan llegar temprano a su diagnóstico, que más niños puedan tener estadios precoces de enfermedad y que amplíen la posibilidad de curarse.
En el Perú hemos logrado reducir el 50% del tiempo diagnóstico en un lapso de 5 años. Principalmente desde la Iniciativa Mundial de Cáncer Infantil. El tiempo en el que los profesionales de la salud, médicos y enfermeras demoraban para hacer el diagnóstico en niños desde la sospecha de cáncer se ha reducido de manera significativa. Actualmente, los niños y adolescentes llegan más rápido a los establecimientos de salud. Este logro es un trabajo conjunto desde el Ministerio de Salud a través de políticas públicas que impulsan la detección temprana de cáncer infantil, asimismo el fortalecimiento de las capacidades de los profesionales de la salud, la sensibilización de la comunidad para poder realizar un diagnóstico oportuno y, por supuesto, la participación de la sociedad civil organizada.
Hemos logrado disminuir en un 50% los casos de estadios avanzados de cáncer en los niños. Esto significa que más familias reciben un diagnóstico temprano y más niños tienen una oportunidad de vida, educando y sensibilizando al personal de salud y a la población.
La Organización Panamericana de la Salud pone a disposición de los países diversos recursos técnicos, como cursos virtuales, talleres y guías interactivas para fortalecer la capacitación de los profesionales de la salud, así como materiales para campañas de comunicación dirigidas a los padres y a la comunidad en general.
A través de Cure All Américas, también se está apoyando a los gobiernos en el monitoreo sostenible y uniforme de sus progresos, así como en la implementación de políticas de salud que fortalecen el acceso al diagnóstico temprano, tratamiento y cobertura financiera. Todo con un objetivo, un diagnóstico temprano que salve vidas y mejore el futuro de nuestras familias y comunidades.
Cada intervención en salud pública, cada acción coordinada y cada esfuerzo compartido son pasos hacia un futuro donde hay más niños que puedan superar el cáncer.
Un diagnóstico temprano salva vidas.
En 2019, los Estados miembros de la Organización Panamericana de la Salud, OPS, aprobaron la iniciativa para la eliminación de 30 enfermedades infecciosas en la región para el año 2030. En el marco de esta iniciativa, en 2023, se conformó una alianza con el gobierno de Canadá para un proyecto de eliminación del tracoma como problema de salud pública para el año 2028. Venezuela es uno de los 10 países que participa en esta iniciativa.
Tracoma es la primera causa de ceguera producto de infecciones, lo produce una bacteria y estamos ahorita aplicando la encuesta para ver de prevalencia, para ver si es un problema de salud pública para el Estado.
Durante 2 semanas, un equipo de evaluaciones rápidas de tracoma del Ministerio del Poder Popular para la Salud abordó 30 poblaciones indígenas en busca de tracoma, una enfermedad que afecta sobre todo a poblaciones en situaciones de mayor vulnerabilidad. La idea es estimar la prevalencia de esta enfermedad en el país y determinar si constituye un problema de salud pública.
Andamos un equipo de salud desplegado diagnosticando la enfermedad tracoma. Esta es una enfermedad que afecta el ojo, que posteriormente la persona queda ciega. Y como parte de prevención, le estamos orientando a las personas a tener una buena higiene personal, como el lavado de manos, la limpieza facial. También contamos con tratamientos y en el caso de que los pacientes lleguen a salir positivos a estas enfermedades.
La OPS acompañó y prestó apoyo logístico para el traslado de estos trabajadores sanitarios del ministerio hacia estas comunidades, 22 de acceso terrestre y 8 de acceso fluvial, aprovechando además para ofrecer distintos servicios de salud a las mismas.
On November 14th, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
En el Pacífico colombiano, las comunidades indígenas y afrodescendientes enfrentan grandes dificultades: el conflicto armado, la pobreza y el aislamiento. A través de un esfuerzo conjunto de las Naciones Unidas, diversas iniciativas están resolviendo estas emergencias, fortaleciendo la resiliencia comunitaria, creando nuevas oportunidades en medio de esta adversidad. Esta alianza de Naciones Unidas permitió a estas comunidades afectadas por el conflicto diversas estrategias complementarias: temas de seguridad para la población con ACNUR, escuelas seguras para niños, niñas y adolescentes con UNICEF, fortalecimiento de la salud sexual y reproductiva y violencia basada en género con UNFPA. Además, se promovió la sustitución de cultivos de coca por proyectos productivos como criaderos de pollos, lecciones de pesca, huertas caseras y medicinales. acciones realizadas por la FAO. La Organización Panamericana de la Salud logró dar acceso a salud a estas poblaciones de los departamentos de Nariño, Valle de Cauca y Chocó. Se lograron avanzar hasta 24 brigadas de salud y más de 8.200 atenciones en una atención integral de medicina general, ginecobstetricia, odontología o apoyo psicosocial, con un enfoque étnico-cultural. Esto acompañado con dotación de medicamentos y diferentes pruebas de diagnóstico rápidas para una mejor resolución de las temáticas.
Este trabajo que ha venido desarrollando la Organización Panamericana de la Salud ha permitido hacer unas transformaciones de fondo en cómo mejorar el modelo de salud, en infraestructura, en capacitaciones, en dotaciones, para que la comunidad tenga una salud digna, oportuna, con seguridad del paciente.
Pues de solo entrar, pues uno sentía la enfermedad más grave, por el calor, el aspecto, y ahora es un cambio extremo. Uno entra y siente que hay más frescura, más tranquilidad, el calor poco azota, ahora estamos mejor.
Se atendieron numerosos casos críticos de malaria, desnutrición aguda, ideación suicida. Además, se realizaron encuentros de parteras, médicos tradicionales y sabedores, que en un espacio de diálogo de saberes con médicos y enfermeras occidentales permitió el intercambio de conocimientos con el fin de salvar vidas y evitar muertes maternas. Además, nos reunimos con la institucionalidad local para identificar sus fortalezas, retos y desafíos.
Al tener una comunidad capacitada en primeros auxilios, en comunicación del riesgo, en salud mental, primeros auxilios psicológicos, en las emergencias, vamos a disminuir el impacto que una emergencia pueda tener en la comunidad, porque ellos van a saber cómo actuar en un momento adecuado, un protocolo adecuado, un procedimiento adecuado frente a las emergencias que ocurren en nuestro departamento.
A lo largo de esta trayectoria hemos aprendido cómo hacer un torniquete y, sobre todo en un accidente, mantener la calma, asegurar la escena.
Hemos realizado taller de primer respondiente comunitario, donde ellos lo que
Okay, good morning again. Good morning.
Good morning.
I see the coffee has done wonders. So we are starting back, and we want to start with item 3.7, report of the Audit Committee of PAHO for 2024. And I'd like to bring document CE 176-10 to the attention of the committee and invite Mr. Alan Srinfried, a member of the Audit Committee, to come to the head table and present the report. Please go ahead.
Okay, thank you, Mr. President, members of the Executive Committee, and PAHO management. Really appreciate the opportunity to be here to discuss the results of the Audit Committee's meetings during 2024. The Audit Committee is made up of 3 members who have extensive experience in governance, accountability, external audit, internal controls, risk management, financial management, and reporting, as well as monitoring, evaluation, planning, budgeting, ethics, and integrity. All 3 of the members of the Audit Committee have extensive senior level experience in the UN system and other international organizations, and they're fully impartial and independent of the organization and receive no remuneration beyond travel expenses. My particular background, I'm a former partner with Ernst & Young, one of the global Big 4 CPA firms, where I focused on risk advisory services that included internal audit, enterprise risk management, and organizational governance. Also, I was the Auditor General for the Inter-American Development Bank and served in that role for a 5-year non-renewable term. Additionally, the last 18 years, I've been teaching graduate school at the University of Maryland in the business school and teaching internal audit, ERM courses, and information systems audit courses. So other members have similar backgrounds, so I think we have had a pretty good audit committee over my terms. This is the end of my second 3-year term on the audit committee, and prior to that, I served 2 3-year terms on the UNICEF audit committee. So that's a little bit on my background and experience. So what we'd like to talk about today would be some of the things that the Audit Committee accomplished during 2024. And we'll go over the status of audit recommendations and some of the key items relative to the prior audits. Also, I would mention that in 2024, for the first time in 11 years, the Audit Committee actually did get out to visit 2 country offices, Belize and Peru, in late February of 2024, and this enabled them to gain a better understanding of PAHO's field operations. And again, this is a very good practice for audit committees and organizations like PAHO, and I would recommend that process continue every several years to make sure the audit committee members can actually see operations of the organization versus just having presentations in rooms like this. So again, it's a a very valuable process. The goal of the Audit Committee is to assist the Director and Executive Committee in fulfilling their oversight responsibilities, strengthening PAHO's governance, accountability, transparency, and stewardship. The committee is only advisory in nature, no authority to conduct investigations or perform external or internal audits. So during 2024, the Audit Committee met 2 days in the spring in May and 2 days in the fall in October. So this report covers the full calendar year from January through December. So the areas I wanted to go over, talking about some of the areas that we focused on. So one of the most important one was the financial situation of PAHO that included the current financial situation. Also, as related to that, as was mentioned in the financial accounting presentation earlier, the after-service health insurance was an item that we did have some comprehensive discussions on. Also, the program budget and evaluation areas, investigations and ethics, information security, cybersecurity. The information security area was one that we felt there have been very significant improvements made where the Chief Information Security Officer does present at the Audit Committee meetings good metrics, measurable key performance indicators for cybersecurity, and over the years we have seen a significant improvement there. So we commend management for investing in strong cybersecurity, because that, in the Audit Committee's opinion, is one of the top 3 risks to the organization. Relative to the internal audit function, we reviewed the 2024 internal audit risk assessment. At each meeting, we select several internal audit reports. We review those with the Auditor General and have discussions around those, including with management personnel who have responsibility for oversight in those areas. And I think overall we have been pleased with the results of those, the recommendations and the issues around that. The 2024 was the year that the National Audit Organization, the Supreme Audit Organization in the UK, finished their, I believe it was a 6-year term. And we worked with the Contraloría of Chile in that transition process, and we felt it's an important process when the external auditors change, and we think it was a pretty good process. There were several meetings before the formal turnover between the UK and Chile on the external audit. There were 8 open external audit recommendations that were handed over from the UK NAO to Chile, that Chile has taken responsibility for follow-up on those external audit matters to make sure they are being addressed, and several of them were already addressed in the spring meeting of 25 of the Audit Committee. Some of the items that I think are also important to mention for the audit committee would be that the audit committee was very involved in oversight and making advisory recommendations on improving and having good practices in organizational governance, including the internal audit function areas. And there's a good progress has been made on those items to this point. As far as future work of the audit committee, during 24 and actually the first meeting in 25, we did focus on looking at outstanding audit recommendations that were made either by the audit committee, internal audit, or the external auditors, and noted that management has made good progress in reducing the number of those open audit recommendations. And since this is my final year, after 6 years in the audit committee, I can very truthfully say that management should be commended for the good job that has been done in timeliness and accountability for audit and audit committee recommendations during that period. There's most of the management team is different today than it was 6 years ago, but the audit committee feels it was good, positive change in the in management. Some future priorities that the audit committee has will be including a focus on information system security, cybersecurity as a key risk, as I mentioned earlier, and also the fact that the audit committee spent some time on the looking at the terms of reference of the audit committee. The terms of reference for the audit committee were originally developed when the committee first came into being in 2009. So at this point, it's 16 years since the terms of reference have been updated. So the audit committee worked to make some updates that the committee felt would bring the terms of reference more into good practice compliance for other UN audit organizations, UN organizations, including their audit committees. So we're in the process of working with management and legal now to try to finalize some recommendations that the audit committee can share with the executive committee to get their feedback and make any additional changes so that the terms of reference can be updated and brought more in line with good practices. Some other areas for priority for going forward would be review of good practices from other UN audit committees. Once a year, generally in the fall, the chairs of the UN audit committees get together and discuss good practices, issues, and it's a very good 2-day meeting to share some of those practices, and I think that has been a very positive. This process started 8 years ago. I was the representative at UNICEF at the very first one of those audit committee chair meetings, and since then I've attended 2 others in that 8 years. And most of them are up in New York in the UN headquarters. So I would encourage the executive committee to support that process going forward, assuming that funding is available. So I think they're the main points I did want to cover. Also, the continued discussions around the shared services initiative. That's a high priority item for the audit committee as well, and oversight of how internal audit will implement the new Institute of Internal Auditors global standards for the professional practice of internal auditing, which came out, they were effective in January of 2025. So that concludes the formal part of my presentation, and I would be pleased to take any questions or comments from any of the executive committee members.
Thank you very much. You've heard the report, so I now open the floor for discussion. The United States.
Thank you, Chair, and thank you for the presentation. The United States takes note of the Audit Committee's report and underscores its valuable contribution to strengthening the organization's governance, accountability, transparency, and prudent stewardship. My delegation is pleased to see that nearly all outstanding recommendations were closed in 2024. We appreciate management's efforts in this regard and encourage management to continue to address any outstanding recommendations as early as possible. We welcome in particular the close collaboration between the Audit Committee and the Office of Internal Audit and the efforts OIA made to change some of its practices in order to facilitate the Audit Committee's work. Finally, we took note of the intention and the work already ongoing to update the Audit Committee's terms of reference, and we just wanted to ask if there's an estimated timeline for the work for the Executive Committee to be able to review those. Thank you.
Thank you. We go to Brazil.
Thank you.
We're very grateful for the report by the Audit Committee, and we are also grateful for all the services provided over the last 6 years by the Auditor. Brazil appreciates the work by the Audit Committee. We take note of the high level of implementation of the recommendations that have been made to PAHO since 91 recommendations since 2015. Only 3 are still open as of 2024. Underscored in the presentation is the leadership, the good relationship between the Audit Committee and the leadership of PAHO. We're grateful for that. Now, regarding technology information, we see that over the time period, the number of users of the accounts has dropped off considerably, in keeping with the a drop in staff members. And so we urge the organization to continue making efforts in training of all users.
Thank you very much. If there are no other comments, I'll ask for a response. Mr. Allen.
Thank you very much for the U.S. and the Brazilian comments. I will answer the one on the timeline for the Audit Committee terms of reference. So at the April meeting on 25, we did present the draft recommendations from the Audit Committee to management to review and have discussion around. So management now is going through those, and the goal will be at the fall meeting, which I believe is the last couple days of October in 25, the committee and management together will agree on what the final recommendations will be for the executive committee to update the terms of reference. So Dr. Barbosa could talk more about that. So I guess it would be next meeting that the executive committee has after that. And then on the training effort, continued training effort, Dr. Barbosa, do you want to say anything on that? Or okay. The audit committee will continue to monitor the training efforts in all areas, including the PMIS and the cybersecurity side too, because in cybersecurity, the weakest link are the people in the organization by far. So hopefully that answers both questions.
Thank you very much. We'll yield the floor now to Dr. Barbosa.
Thank you, Mr. President. I want to thank the United States, Brazil for their comments. Just to agree with Alan that it's very important to review the terms of reference. As he mentioned, it is 16 years old, so we need to review. And the audit committee, I think that provided a very good draft based on the best practices and the other international organizations. So we are in the final process to review, and in the next meeting of the audit committee, we will present, in October, we will present the proposal. I think that this will be a very important step. Also, I want also to fully agree that in some areas that were critical areas some years ago, like cybersecurity, the organization has made a very important progress. I want to commend the ITS department. Our director is there. We have a team that is dedicated to cybersecurity, that runs regular exercises trying to not only to make our staff aware, but accomplishing with all the security that we need to do in order to protect the organization, the data that we have here, administrative data, but also very important public health data. Finally, I want to thank Mr. Alan Siegfried, because this is the last meeting that he is participating. Unfortunately, he has served for 2 terms, and we cannot have a 3rd term. So the next point that you will discuss is exactly the appointment of the person who will replace Alan. But I could witness all the professionalism that Alan has provided during the meetings of the audit committee. He served also as the chair of the audit committee. And it's important because they are very experienced people that serve the organization as a voluntary basis. So they don't receive salaries for this work. I think that on behalf of the entire organization, I want to say thank you for the very good service that you have provided to the Pan American Health Organization.
Thank you. Very welcome.
So on that very high note, I too would like to thank Alan for his services, and I think you have set a high bar here. So your replacement will have big shoes to fill. I wanted to inform the committee that the discussions will be reflected in the final report. Thank you. We now move on to item 3.8. The appointment of 1 member to the Audit Committee. I would like to bring document CE 176-11 to the attention of the committee and invite Dr. Miguel Barnier da Silva, the legal counsel for the Pan American Sanitary Bureau, to come to the head table. But before we take you, we'll ask the President of the Subcommittee on Program, Budget, and Administration to report on this item.
Thank you very much, Mr. President.
Regarding the appointment of one member to the Audit Committee of PAHO, the subcommittee was informed that the mandate of one of the members would conclude in June 2025, and consequently would be important for the Executive Committee to appoint a member. Now, the subcommittee was entrusted with looking at a list of candidates and that a proposal be brought to the Executive Committee. The Undercommittee established a working group consisting of the delegates of Canada, Guyana, and Peru. The working group evaluated the proposed candidates on the basis of the criteria for membership set out in the terms of reference of the Audit Committee and decided to recommend that Ms. Maria Rios should be appointed to fill the vacancy on the Audit Committee. The subcommittee endorsed the recommendation of the working group and therefore recommends that the Executive Committee adopt the proposed resolution contained in Annex B of document CE 176/11, appointing Ms. Maria Rios to serve as a member of the PAHO Audit Committee for a term of 3 years, from June 2025 through June 2028. That is the end of my report, Mr. President. Thank you.
Thank you very much. We now invite Dr. Bornier to present the item.
Thank you, Mr. Chairperson, members of the Executive Committee, member states, director, distinguished colleagues. The Audit Committee provides the director and member states through the Executive Committee with independent expert advice on the organization's financials control, reporting structures, and related oversight mechanisms. The Audit Committee comprises 3 members appointed by the Executive Committee. Each Audit Committee member serves no more than 2 full terms of 3 years. The current members and their respective terms of office are as follows. Mr. Alan Siegfried, who just presented the previous agenda item, he's serving a second term of 3 years that ends this month, as the director explained. Ms. Asada Greenblatt, serving a first term of 3 years through June 2026, and Ms. Elizabeth Folsom, serving a first term of 3 years through June 2027. To address the upcoming vacancy, the PAHO director initiated a recruitment process earlier this year to update the roster of highly qualified candidates. The vacancy announcement was widely circulated, including through PAHO country offices. All applications were rigorously evaluated against the criteria set out in the Audit Committee's terms of reference, and the highest-ranking candidates were identified. Ahora paso para el español.
During the 19th session of the Subcommittee on Program Budget Administration that was held in March of this year, a working group was established to evaluate the candidates suggested by the director. As was pointed out by the subcommittee's chair, the working group recommended Ms. Maria Rios to join the Audit Committee, and the subcommittee supported that recommendation. The Executive Committee is encouraged to consider the candidate recommended by the subcommittee to cover that vacancy on the Audit Committee for the period going from June of this year to June of 2028, and to consider adopting the proposed resolution contained in Annex B of the document that you have before you. Thank you very much, Mr. President, and this concludes my presentation, and I am available to respond to any questions.
The Executive Committee is invited to take note of this document and provide any comments that it deems pertinent. The discussion on the proposed resolution presented in Annex B will take place once the rapporteur has read the proposed resolution. I now open the plenary for discussion on the document. There being none, I now ask the rapporteur to read the resolution.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. I will proceed to read the proposed resolution. Appointment of one member to the Audit Committee of the Pan American Health Organization. The 176th session of the Executive Committee, preambular paragraph 1, considering that the 49th Directing Council, through Resolution CD 49.R2 of 2009, established the Audit Committee of the Pan American Health Organization to function as an independent expert advisory body to the Director of the Pan American Sanitary Bureau and PAHO member states. PP2. Guided by the terms of reference of the Audit Committee, which established the process to be followed in the assessment and appointment by the Executive Committee of the members of the Audit Committee of PAHO. PP3, noting that the terms of reference of that committee stipulate that members shall serve no more than 2 full terms of 3 years each. And PP4, considering that a vacancy will exist in the Audit Committee of the Pan American Health Organization, resolves. Operative paragraph 1. To thank the Director of the Bureau and the Subcommittee on Program Budget Administration for their thorough work in identifying and nominating highly qualified candidates to serve on the Audit Committee of the Pan American Health Organization. Operative paragraph 2. To appoint Ms. Maria Rios to serve as a member of the Audit Committee of PAHO for a term of 3 years from June 2025 through June 2028. That concludes the reading of the proposed resolution, Mr. President.
There being none, I think we can safely declare the resolution adopted. We now move on to item 5.4. So item 5.4, report on the Master Capital Investment Fund on the Master Capital Investment Plan implementation. I would like to bring document CE 176-21 to the attention of the Executive Committee and invite Ms. Kristen Beck, Director of...
Kristen Beck has a health issue. You have it. Liliana Silva.
We'll invite Ms. Liliana Silva, Director of General Services, to present this report. To present this.
No. Subcommittee.
Oh. So thank you for your patience. So we first go to the President of the Subcommittee on Program, Budget, and Administration, after which we'll get Director Beck. Go ahead.
Muchas gracias, señor presidente.
Thank you very much. This is the report on the Master Capital Investment Fund and the Master Capital Investment Plan implementation. The subcommittee received an update in March on the status of the Master Capital Investment Fund and its 5 sub-funds. The Bureau reported that the Real Estate Maintenance and Improvement sub-fund was used primarily to cover expenses related to the renovations at the PAHO headquarters building, and provided an update on the progress of phases 1 and 2 of the renovations. It was noted that the implementation of further phases would be subject to availability of funding. Also, the subcommittee was informed that following the discovery of extensive mold in PAHO's building on Virginia Avenue in Washington, D.C., it had been decided to sell the property. The affected PAHO staff has been relocated to office space leased in a nearby office building. This concludes my report. Thank you very much, Mr. President.
Thank you very much. The Executive Committee is now invited to note the report and to provide any pertinent comments. I'll now open the floor. There being no comments, I would now like to inform the committee that the discussions would be reflected, and there being no discussions, but we'll have this in the final report. Thank you. Okay. You're moving so fast that, I can't keep up here. We go to item 5.5, PAHO Forward, Shared Services Initiative. I would like to bring document CE 176-22 to the attention of the committee and invite Mr. Dean Shablis, Director of the Department of Shared Services Initiative of the Pan American Sanitary Bureau, to come to the head table. He's here, so we'll ask him to present this item. Go ahead.
Thank you very much, Mr. President, and good morning. I think it still is. Member state representatives, director, PAHO colleagues, and others present. I will provide a short introduction to agenda item 5.5 regarding the PAHO Shared Services Initiative. I would note that this agenda item is for information with no associated resolution. Shared services are not new in PAHO. PAHO has performed centralized administrative services in its headquarters for many years. The PAHO Brazil office contains a pilot shared service center that was launched in 2019 and is functioning successfully today. Over the past few years, PAHO has laid the groundwork for a major expansion of the shared service concept, with the overarching objectives of improving efficiency and realizing significant cost savings for administrative functions. So why are we accelerating implementation of shared services now? First, during COVID, we learned that virtually all functions can be performed effectively from multiple locations. In the current funding environment, greater efficiency and cost savings are more important than ever. And finally, optimization of resources dedicated to administrative functions can lead to greater resources for delivering the health technical cooperation that our member states require. The business case for shared services is strong. We have a clear opportunity for improved administrative service quality, enhanced specialization and consolidation of functions, improve compliance and control in administrative services, an enhanced presence in Latin America and the Caribbean, and reduced costs, as well as staff time dedicated to administrative functions. Many of our sister organizations have implemented shared service projects over the past 2 decades, with several key lessons learned and best practices that PAHO is applying. We have had in-depth interactions with counterparts from multilateral agencies with successful shared service centers, including the Inter-American Development Bank UNICEF, and IOM, among others. Since the briefing given to the SPBA on this topic in March, we have advanced significantly as we wind up the development phase of the project and prepare for rollout. Main highlights include the establishment of internal governance mechanisms to oversee the project and help ensure achievement of milestones and targets. The cataloging and assessing of business processes to determine those in scope for the project. The development of costing simulations for different business models under consideration. Preliminary development of human resource plans and identification of associated corporate risks and mitigating actions. Regarding costing, our projections indicate that the required initial investment should be recouped within 3 years or less for the project. No financially onerous investment in infrastructure is anticipated. I look forward to providing more information on financial implications as we move into the detailed planning for the 26-27 biennium and begin rollout of the shared service hub. Further updates and reports will be provided to future governing bodies meetings. In the meantime, I remain available now and in the future to respond to any questions that member states may have as we advance with this important PAHO Forward initiative. Thank you very much, Mr. President.
Thank you. The Executive Committee is invited to take note of this information document and provide any comments it deems pertinent. I'll now like to open the floor to the plenary for a discussion on the document presented. Okay. Chile.
Gracias, señor.
Thank you, Mr. President. Chile welcomes this report and expresses its appreciation for the services included in this shared service initiative. Which of those would be outsourced, and what would the effect be on cost? What is the projected cost, the calculations of cost, as well as the criteria for use? What criteria would be used in terms of allocating the respective contracts? Of course, it is good to lower costs, especially in view of the uncertainty that surrounds this meeting. Therefore, it is important to make decisions that are evidence-based and to do so in a responsible manner. We are certain that we will proceed in that way. The audit report assures us that that will be the case. So we appreciate this report, and it is important that we be afforded the opportunity to make further comments. Thank you.
Thank you, Mr. President. Canada thanks the Secretariat for this report, providing an update on the Shared Services Initiative. Recognizing the drivers behind PAHO's efforts to find efficiencies and cost savings in its administrative processes, we also want to ensure that the impact on staff and PAHO's overall operations are being carefully considered and managed. Can the Secretariat provide an update on what efforts are being made to minimize negative impacts, including on staff? We note that there are several key decisions yet to be made, including around location and offshoring or outsourcing. Given that this initiative is already underway, can the Secretariat share the proposed timelines for these critical decisions, as these are surely to shape how these efforts move forward? We welcome more detailed updates on costing when available, as we consider this information to be fundamental in successfully implementing this initiative. Thank you.
Thank you. Mexico.
Thank you very much, Mr. President. Mexico realizes how important this type of measure is to make more efficient use of resources and also to take advantage of technological progress. We support what has been said by other countries regarding a request for additional information so that the implementation of this measure can be done in the best possible way so as to be able to oversee this exercise and perhaps replicate it in other areas? Thank you.
Any other comments? None? Mr. Chambliss, floor is yours.
Thank you very much, Mr. President, and thank you, member states, for the questions and the interventions. A few things I'll answer now, and others will have to come during subsequent updates, particularly the details, I think, on the financial side and the costing side. In terms of which services are included, essentially it's the spectrum of administrative services, so finance, human resources, ITS, procurement, as well as some general service functions as well, okay? Again, details on the costing we'll have to provide in a future update. I'm not able to share those at the moment. We are still very much in the initial phase of rolling this out. The procurement criteria for contracts as well, we haven't yet gotten to that phase in terms of the contracting. Definitely in terms of the impact on staff and ongoing operations and the importance of both minimizing the impact on staff as well as ensuring the correct and timely provision of administrative support to PAHO's ongoing operations. Most importantly, its technical cooperation, of course, with countries is foremost in our minds, and that was part of our risk analysis as well as part of the implementation plan, which we are looking forward to rolling out. I believe that that's all that I have to respond to at the moment. I don't know if there's further queries. Thank you.
Thank you very much. Dr. Barbosa.
Yes, thank you. Thank you, Mr. President. Thank you, Chile, Canada, and Mexico. Just to add, I think that the Chambliss has already provided some information, of course, that this is a process that's ongoing process. We are implementing this, I think that, as Dean mentioned at the beginning, based on the pilot project that was established in a country office that serves other country offices. And it's a very successful. Also, we had another initiative from the procurement that has a satellite office outside Washington that showed that it's totally possible to realize operations in a lower cost country. We are still discussing, of course, the alternatives, but maybe a general estimation is that this will reduce around 70% of the current cost that we have. So I think that this will be a significant saving for the organization without losing any capacity to provide these administrative functions. We are not talking about the technical cooperation. Of course, indeed, we already have some decentralized technical cooperation. PAHO Virtual Campus, that has more than 4 million users that are taking courses on relevant areas related to public health matters, is based in Panama. We also have an emergency hub with a warehouse to deploy more rapidly syringes, PPEs to countries, medicines to countries that are facing emergencies. This is based also in Panama because it's easier to get to countries in Latin America and Caribbean from there, and also reduce the cost of operation of the organization. But for the shared service hub, as Dean Chambliss mentioned, we are talking only about the administrative service. As part of the processes, all the directors of the departments are elaborating a contingency plan exactly to avoid any kind of disruptions during the process. And we are implementing all the measures that are possible to protect and to treat our staff with, in a respectful way. So even before the cost-saving measures, I suspended all selection processes for external candidates to administrative positions in order to allow people that work in this department that will be affected to have a choice to move to another department. This process is continuing, and now we are identifying the positions that will be directly affected, and these people will receive the information as soon as we have the decision made so they can explore the options that they have. I have already authorized to get some support to support them to look for other opportunities. So we are taking a package of measures to protect the staff that will be affected. But I do believe that this will be very important for the organization in order to provide savings for the organization. That is important, but also more efficiency. This is not the only closing position and open position, but we are talking about modernizing some administrative processes, getting some softwares and some systems that will provide a more clear management of the administrative tasks that we need to do these things manually. When it's possible, all of this will be automated and will be modernized. So it's not the only closing position and moving to another country, but also to modernize and providing more efficiency to administrative areas. Thank you.
Thank you very much. I would like to inform the committee that the discussions would be reflected in the final report. And since we've been doing so well, we want to continue being well. And I now move to item 6.1. And that is amendments to the Pan American Sanitary Bureau staff regulations and staff rules. I would like to bring your attention to document CE 176-23 to the attention of the committee and to invite Dr. Luz Mariana Barilas, Director of the Department of Human Resources and Management of the Pan American Sanitary Bureau, to come to the head table. And I would now like to yield the floor first to the President of the Subcommittee on Program, Budget, and Administration to report on this item.
Thank you very much, Mr. President. Concerning amendments to the Pan American Sanitary Bureau staff regulations and staff rules, the subcommittee expressed support for the proposed amendments to the staff rules and regulations. It was considered that the amendments would ensure consistency in the conditions of employment of PAHO's staff within the United Nations Common System, provide further clarity to staff members, and strengthen human resources management. The Bureau was commended for having established a unified parental leave policy aligned with the principles of gender equality and support for families. Appreciation was also expressed for the Bureau's efforts to strengthen the norms aimed at preventing conflicts of interest, thereby ensuring transparency and fairness in the hiring process. Thank you, Mr. President. That concludes my report on this item.
Thank you very much. We now go to Dr. Barilas to present the item.
Thank you very much, Mr. President, Mr. Director, distinguished members of the Executive Committee, good afternoon. I'm grateful for this opportunity to present the summary of the chief amendments to the rules and regulations for staff of the Pan American Organization. These recommend the recommendations of the International Public Administration Commission and are proposed not only to ensure there is uniformity in employment conditions for the Pan American Sanitary Bureau staff with the United Nations Common Regime, also in light of the experience acquired and for good practices in the management of human resources. This report can be summarized in three areas: the salaries of professional and higher staff, compliance with the new salary scale of the UN, the changes to improve staff accountability, transparency, and efficiency in application of the staff rules and regulations, and editorial changes or changes to update practices. With regards to the salaries of staff in higher levels, the UN General Assembly has accepted the recommendation of the International Public Administration Commission of the increase of the for professional and higher up level staff members. This was using the method of consolidation that consists in increasing the basic salary, but at the same time reduce in proportion the multiplier points of destination adjustment factor, which therefore does not modify the net salary. This is applying the principle of no gain, no loss. Let me underscore that PAHO is a member of the United Nations Common System. Therefore, all recommendations approved by the International Civil Service Commission must be completely respected in the staff rules and regulations by this organization, including implementation of the salary scale. The new salary scale can be seen in Annex C, Appendix 1, and the financial implications having to do with these amendments represent for the entire UN nation system 5.2 million a year. However, in the case of the Bureau, it is $34,000 a year, which results from the adjustment to end final benefits and annual leave. With regards to the amendments proposed to strengthen accountability, transparency, and efficiency in human resource management, let me point out that Articles 110.4, 110.5, and 110.7 relate to the standards of behavior for staff, allowing them to participate in certain external activities. The proposed changes aim to provide greater clarity regarding activities such as contributions to political parties, to be part of panels, public speaking, etc. This change adds clarity, improving and facilitating compliance. With regards to the standards for contracting persons with family relationships, Article 110.3 of the Staff Rules and Regulations provides parameters for the hiring and supervision of people who have a familial relationship due to consanguinity or marriage with another staff member. The proposed change includes people with a close personal relationship with an official. This change is based on the best practices and prior experience that other relations, in addition to family relationship due to consanguinity or marriage, could result in a conflict of interest. With regards to separation from service, there is an amendment to Article 9 having to do with this topic, and as a result of this update, there is adhesion to Rule 10.2. These changes specify that the contract of an official may be terminated should the person not provide relevant critical information during the hiring process, or if the organization offers a reasonable reassignment to another position and the individual refuses it. The incorporation of these reasons for separation increase accountability because they underscore the need to provide full and complete information, and adds or increases efficiency by limiting the time necessary for reassignment should the staff expectations not be reasonable.
Modifications proposed to strengthen efficiency. Regarding the medical exams and appointment, the proposed changes to Rules 430 and 440, which establish the requirement to obtain pre-employment medical clearance, will allow the use of different modalities of medical evaluation to determine fitness for employment, which may consist of a clinical examination or an evaluation using a medical questionnaire, depending on the individual's health status, the nature of the work to be performed, and the duty station. This modification will increase administrative efficiency by adapting medical evaluations or assessment to occupational health risks, thereby reducing both times to hire and no cost to the organization. Board of Appeal. The proposed amendment to Rule 1230 of the staff rules adds a requirement for the organization to appoint an external deputy chair to the Board of Appeal. This change will increase efficiency as the appointment of a deputy chair will reduce the risk of backlog and ensure continuity of the operations in the event of the absence of the external chair or if the post becomes vacant. Editorial changes or changes to formalize current practice. The proposed changes to Article 6, Rule 1083, and Annex N 510 of the staff regulations updates the language referencing to maternity leave to align with parental leave in accordance with the new parental leave policy approved in 2023. And finally, with the proposed amendment to Rule 495, the current practice is codified. The rule details the requirement for staff members to designate beneficiaries and clarify the procedure to be followed in the event that a designated beneficiary does not survive. With this, I conclude my presentation and I remain at your disposal for any questions or comments. Thank you very much.
Thank you. The Executive Committee is now invited to review the amendments to the PASB staff regulation and staff rules contained in this document and provide any comments it deems pertinent. The discussions on the proposed resolution presented in Annex D will take place once the rapporteur has read the proposed resolution. I'll now like to open the floor to the plenary for a discussion on the document presented. The United States.
Thank you, Mr. Chair. The United States thanks the Director for this report and for taking steps to ensure PAHO staff regulations and rules, as well as conditions of employment, remain aligned with those of the UN Common System. The United States strongly supports the proposed amendment to Staff Regulation 9.2, along with new related Staff Rule 1082, allowing for the termination of a staff member's appointment if the organization discovers facts that would have precluded the appointment. Notwithstanding our expectation that PAHO will continue to utilize all due diligence in the hiring of staff, including the performance of background checks and screening of candidates against the UN ClearCheck database, we believe this additional measure will help ensure the necessary integrity of PAHO's personnel. The United States can also accept the amendment to Staff Regulation 6.2, which replaces the term maternity leave with paternity leave, insofar as we understand that change to be necessary for regulatory consistency with existing PAHO staff rules. Nevertheless, my delegation wishes to use this opportunity to clarify the Trump administration's firm position that such parental leave policies should exclusively provide relevant parental leave benefits to biologically sexed women and men and should in no way inject harmful gender ideologies into such schemes. In particular, my delegation rejects any concept of self-assessed gender identity that would allow biologically sexed males to potentially receive the parental leave benefits suited for biologically sexed females. Such ideologies not only eradicate the biological reality of sex, but also fundamentally attack women by depriving them of their dignity and well-being. Thank you, Mr. Chair.
Thank you very much. Brazil.
Thank you very much, Mr. President. Muito obrigado.
Brazil is grateful for Dr. Barilas for presenting the amendments to the PASB staff regulations. We appreciate the proposals and the approval of the resolution to be presented. These give greater clarity with regards to the interaction between staff and the organization. The external elements have been made clear, given that there are social media that is always more present in activities. Other important improvements are the amendments having to do with parental leave and the family members being in relationships. This gives greater clarity and protection for the family. Lastly, I'd simply like to ask about the financial aspect and then how this is going to impact the relationship with staff. Thank you.
Thank you very much. Dr. Barelas, want to respond?
Muchísimas comments. We take note of the United States of America comments. Thank you very much. I would like just to mention in general that the organization aims at establishing and reviewing every time the policies and regulations to modernize our practices, but also to protect the organization in terms of attracting the most suitable staff to our organization, to incorporate good practices in our rules. But we do understand that we need to live within our times. And regarding the impact, the financial impact, the question from Brazil, could you please, if you don't mind, elaborate what information do you need?
If the proposed of the basis, of the salary basis, is this going to have an impact on the organization's finances?
Thank you very much. No, because the methodology used by the United Nations system is to the no gain, no loss. So basically, we adjust the base salary, but we at the same time adjust down the post adjustment. So it's basically no increase. And as I mentioned in my presentation, the impact for the organization in an annual basis is $34,000, which obviously is some money, but is not relevant to our finances. So that's, I hope that clarifies your, okay. So thank you very much for your comments and your support, and we take note.
Thank you. Dr. Barbosa, any comments? No comments. Oh, sorry. We have Uruguay.
Gracias, Presidente.
Thank you, President. I have a very specific question. I could maybe do it in writing, but meanwhile, let me take advantage that we're doing well on time. In the document in 410, the hiring of people who are in a situation of marriage or consanguinity. Given the text, I'm talking about 410.3.1. In the new wording, it says people that have close relationship with a staff member, and normally, and this is underlined, will not be appointed if the position they are requesting could be given to another person or candidate highlighted who is competing. I don't understand what it means by normally is going to happen. It will either happen or not, but what does the normally mean? And why was this added? Why was the word candidate put in after the word person? Is it based on a competition, or how is this going to be managed? Thank you.
¿Puedo responder? Sí. Muchísimas gracias por su...
Thank you very much for that question. Actually, the amendment to this rule aims to incorporate in the rule the possibility for the organization to decide whether or not there is a relationship of consanguinity or matrimony or marriage, or if there is a close relationship. For instance, an official who is living jointly with another person, that person does not have a blood or marriage relationship. However, it can still generate a conflict of interest. So basically, that is the spirit of this amendment. With regards to your specific question, the point here, what we're dealing with, is that it might be more a language issue, the language that we used in drafting these rules. And we use the word normally in English. And normally, well, it's the rule, it's the standard, the norm. And when we say that a person in a relationship, either by blood or marriage, with a staff member, an official who right now is serving at the organization, this person will only be selected through a competitive selection basis if that position cannot be filled by a person who has no relationship with the official. In other words, they have an opportunity to apply. Obviously, we cannot preclude that. However, the organization is extremely careful that under equal conditions, preference will be given to a person who has no such relationship or is not closely related by marriage or as explained here. I hope the answer I just provided does respond to your question.
Gracias. Sí, muy claro, pero...
Yes, that was very clear. But that is regardless of whether that person is going to actually serve, where the post is going to be. There can be a relationship with people working here in Washington, but there is still that impediment if the person is going to be posted elsewhere. They have this factor against them in the selection. It's a sort of taking points away from a person who is perhaps in a marriage, even if there is no relationship, hierarchical relationship between them. Yes, obviously, if there is hierarchy, well, what is important is for officials to communicate this relationship. And that's why I insist on the importance of this change, because it includes the relationship of staff not civilly validated. And that is important because we want to avoid any conflicts of interest or favoritism or anything, or nepotism or anything like that. If a person is in relationship with an individually, with an official, then they can absolutely not be under a single organizational unit, and even less if they are in a supervised position. In those cases that we have where we need to determine whether there is a conflict of interest or not are very, very few. Yes, obviously, we do have couples, married couples, who are officials, but they began their relationship and were married once they were already officials and staff members. But there are very, very few such cases. But nonetheless, we do consider that to be an important aspect.
Perdón.
I'd like clarification with regard to the point raised by Uruguay. Does that mean that if a couple and one of the members of that couple works here at PAHO headquarters in Washington, and the other individual perhaps works in the PAHO country office in Brazil, is that not permitted either? One of the two would have to quit their work at PAHO? No, not necessarily. In those instances, we have a very close coordination with the ethics office. So, once we receive information from the official or from the candidate in this kind of relationship, we present the case to the ethics office and they will assess all of the circumstances of the potential conflicts of interest, of any situation that this organization needs to be aware of in order to protect the organization's reputation, as well as the reputation of the officials themselves. And based on that evaluation, the organization then will come to a decision. These are isolated cases, and therefore the assessment or evaluation is on a case-by-case basis.
Okay. I think we have exhausted the discussion there. So I now invite the rapporteur to present the proposed resolution for consideration of the Executive Committee.
Muchas gracias, señor presidente. Procedo a la lectura.
Thank you very much, Mr. President. Let me read. Proposed resolution, amendments to the Pan American Sanitary Bureau staff regulations and staff rules, the 176th session of the Executive Committee, PP1. Having considered the amendments to the staff rules of the Pan American Sanitary Bureau submitted by the Director in Annex B to document CE 176/23. PP2. Acknowledging the recommendation of the International Civil Service Commission in its 2024 annual report to increase the base/floor salary scale for the professional and higher categories and pay protection points by 9.5% on a no-loss, no-gain basis, and PASB's implementation of that recommendation as of January 1, 2025. PP3, taking into consideration the actions of the 76th World Health Assembly regarding the remuneration of the regional directors, assistant directors general, and the Deputy Director General based on the United Nations General Assembly's approval of the amended base/floor salary scale for the professional and higher categories on a no-loss, no-gain basis. PP4. Bearing in mind the provisions of Staff Rule 020 of Staff Regulation 3.1 of the Pan American Sanitary Bureau. PP5. Recognizing the need for uniformity in the condition of employment of staff of the Pan American Sanitary Bureau and the United Nations Common System Agencies resolves. OP1. To confirm, in accordance with Staff Rule 020, the staff rule amendments that have been made by the Director effective 1 January 2025 concerning the remuneration of staff in the professional and higher categories, and the staff rule amendments that have been made by the Director effective 1 July 2025 regarding standards of conduct for staff members, recruitment policies, medical certification and inoculations, appointment procedures, obligations of staff members to provide information, staff member beneficiaries, facts coming to light that would have precluded appointment, notice of termination, and the Board of Appeal. OP2. To establish the annual salary of the Assistant Director of the Pan American Sanitary Bureau beginning on 1 January 2025 at $212,139 before staff assessment with a corresponding net base salary of $155,512. OP3, to establish the annual salary of the Deputy Director of the Pan American Sanitary Bureau beginning on 1 January 2025 at $213,655 before staff assessment, with a corresponding net base salary of $156,512. OP4, to establish the annual salary of the Director of the Pan American Sanitary Bureau beginning on 1 January 2025 at $235,064 before staff assessment, with a corresponding net base salary of $170,642. OP5, to recommend to the 62nd Directing Council that it approve the amendments to Staff Regulations 6.2 and 9.2 as presented in Annex A to document CE 176/23 by adopting a resolution in the following terms. Amendments to the Staff Regulations of the Pan American Sanitary Bureau. The 62nd Directing Council, PP1, having considered the amendments to the staff regulations of the Pan American Sanitary Bureau, the Bureau, submitted by the Director in Annex A to document CD 62/blank, resolves OP1 to approve the amendments to Staff Regulation 6.2, which replaces the reference to maternity leave with parental leave and is required to align it with Staff Rule 760, which establishes unified parental leave and was confirmed by the Executive Committee at its 172nd session in June 2023. OP2, to approve the amendments to Staff Regulation 9.2, which clarify that the Director has the authority to terminate an appointment if a staff member failed to reveal information that would have had otherwise precluded their appointment, or B, a staff member fails to take up a reasonable reassignment that is in the interest of the Bureau. In addition, the specific modifications or amendments to staff regulations or rules can be found in appendices A and B of the resolution. Thank you very much. This completes reading of the proposed resolution.
I now open the floor for any comments, discussions. None? Okay. If there are no objections, I now declare the resolution adopted. And on that note, I think you earn yourself some lunch. We'll take a break. But before that, we have some very important announcements. I'll ask the Deputy Director to give us those announcements.
Thank you, Mr. President. I'll be brief. I wish to inform the plenary that the working group on the PAHO Strategic Plan 2026-2031 will meet at 12:30 this afternoon in Room C. Interpretation will be available in English, Spanish, and Portuguese, and a light lunch will be provided for all participants. Thank you for joining. And secondly, I'd like to inform our member states that as we reconvene this afternoon, and before we proceed with the scheduled agenda items, the Director will have the pleasure of officially launching the country annual reports of the Pan American Health Organization. So thank you.
So thank you very much. We can now break for lunch, and we'd like to have you back here by 2:30. Good.
Para nosotros es importante, ¿no?, poder haber llegado acá. Esta visita responde a un proyecto que estamos ejecutando desde el punto de vista de la salud ocular. Estamos acompañando a todo el equipo evaluador que se va a encargar de hacer este trabajo para ver si tenemos alguna patología que tenga que ver con tracoma ocular.
Estamos en la comunidad de Las Flores.
Acabamos de tener una reunión con los comunarios.
Hemos venido a conversar, ¿no?, con las autoridades aquí del lugar
para organizar el pesquisaje que se va a realizar para el tracoma.
Vivir en Puerto Las Flores bien nomás, bonito nomás estar aquí del aire, recibimos, respiramos, ¿no? En Puerto Las Flores no existe la electricidad.
Han levantado ya hace más de un año un tanque, han puesto agua, han hecho pozos, pero el agua no es buena.
Cuando estamos mal de los ojos nos afecta, ¿no?
No solo en Las Flores, ¿no?, sino en distintas comunidades. Hay deficiencia, ¿no?, en el tema de lo que es salud y de educación más que todo, ¿no?
Nunca me hablaron del tracoma. No sabía de esta enfermedad.
Nunca
¿Qué pasa con la gripe, la COVID-19 y el virus respiratorio?
El tracoma es una enfermedad infecciosa que afecta principalmente a los párpados, posteriormente a la córnea y puede dejar invalidado a un paciente produciéndole una ceguera permanente e irreversible. Se contagia de forma directa, es decir, de persona a persona.
En especial los niñitos, digamos, se tocan y pueden estar dando la mano a otro niño y así se puede contagiar.
Cuando ya tienen triquiasis ya se van sacando las pestañas, sino depilando, le estorba ya.
Esta enfermedad se ve principalmente en zonas con poca o ninguna sistema sanitario.
Donde no haya agua segura.
Con dificultad en sistemas de alcantarillado.
Dentro del registro que nosotros manejamos como Ministerio de Salud, no tenemos incidencia, ¿no?, a nivel nacional, ¿no? Sin embargo, tenemos países vecinos en los cuales sí ha sido un problema de salud pública. Es por ello que estamos ejecutando este proyecto, que es una evaluación rápida para tracoma ocular en comunidades vulnerables, ¿no? Una vez termine este proyecto, nosotros vamos a tener la capacidad de poder determinar si tenemos o no y si realmente el tracoma ocular para nosotros es un problema en salud pública.
Estamos viniendo casa por casa a revisar una enfermedad que nosotros estamos buscando, que se llama tracoma. Con su permiso lo vamos a hacer el examen y a todos los miembros de la familia.
Sí, pasen nomás.
Muchas gracias. Va a mirar hacia abajo, mira hacia abajo. Mira hacia arriba. No, su ojito no sé. Ahora mira hacia abajo. No parpadea ya, si no, no voy a poder.
La detección del tracoma es importante, puesto que si nosotros lo detectamos a tiempo, vamos a garantizar la salud y la estabilidad ocular del paciente. Haciendo una detección, haciendo las campañas de prevención y promoción, evitamos la proliferación de esta enfermedad que como resultado final lleva a la ceguera. Entonces, si nosotros actuamos temprano, prevenimos a un paciente ciego en el futuro.
Doy la bienvenida a todo el equipo médico. Esta es nuestra comunidad de la Nación Yuki. Bienvenidos.
Para nosotros es por primera vez que han venido a ver los ojos de nosotros. Los comunarios hemos venido de las tres comunidades, Viarilloa, la comunidad Pachino y la comunidad de Villarecuate, donde estamos en este momento.
La brigada que viene es de mucha ayuda para nosotros porque, bueno, en Villarecuate la gente tiene muchos problemas sobre el ojo.
Es la primera vez que me revisan mis ojos.
Esta es la primera vez que me revisan ojos aquí en comunidad.
Nunca había escuchado esa enfermedad tracoma.
Nunca había escuchado de que se pueda contagiar la enfermedad tracoma así con la mano sucia.
En calidad de cacique mayor, yo le he dicho a toda la población de que tenemos que hacernos ver nuestros ojos a los médicos que han venido.
Venimos trabajando ya anteriormente en el Gran Chaco, en Santa Cruz, en el municipio de Camiri. Esta versión ya hemos visitado 3 comunidades aquí del trópico. En esta actividad también hemos diagnosticado otras patologías, además de tracoma. Y bueno, como Ministerio de Salud estamos programando ya actividades también para poder atender esta otra patología como son las cataratas y terrigio, que son de mayor relevancia en la población adulta o mayor. Vamos a llegar como Ministerio de Salud con cirugías de cataratas y terrigio de manera gratuita para la población que se haya encontrado con esta patología. Estaremos visitando el departamento de Pando, las comunidades indígenas, posteriormente el departamento de La Paz, el norte de La Paz específicamente, porque son las comunidades indígenas que estamos priorizando para poder ampliar la cobertura en la búsqueda de la patología denominada tracoma.
Esta enfermedad puede tratarse con una higiene adecuada. No se trata solamente de venir y curar, se trata de venir y enseñarles cómo cuidarse. Eso es más importante que pediría el mismo tratamiento por sí mismo.
Este es el segundo taller que realizamos en Colombia con el tema de vigilancia integrada de epizootias y vectores en el contexto de la respuesta a la fiebre amarilla.
Recordemos que hace un año se inició la transmisión en el departamento de Putumayo y actualmente vemos una afectación de 10 departamentos, 30 municipios, en los cuales ya se ha acumulado un número importante de casos y de ellos aproximadamente la mitad han fallecido.
En la región de las Américas, aquí en Colombia, solamente hemos encontrado casos asociados precisamente a ese ciclo selvático de la enfermedad, pero un trabajo muy importante de vigilancia significa precisamente evitar que eventualmente estos humanos infecten mosquitos urbanos y se inicie lo que se conoce como el brote, como una fiebre amarilla en ciclo urbano. Hasta el momento no se ha determinado ni se ha demostrado fiebre amarilla urbana en la región de las Américas en los últimos brotes, pero tenemos que estar atentos precisamente porque la urbanización podría ser devastadora en un escenario en el cual tenemos vectores urbanos que se encargan de transmitir otros virus como el dengue, los tenemos con una amplia distribución. Seguramente no habría una capacidad suficiente para controlarlo, ya que tenemos dosis limitadas de vacunas.
De allí la importancia de este taller, que nos permita generar las capacidades para la vigilancia de lo que denominamos las epizootias, es decir, la identificación oportuna en qué momento nuestros micos se están enfermando o están muriendo y que por ende ellos nos están informando de una forma muy natural por dónde puede estar circulando el virus para otros poder organizar las acciones de prevención y control y de ellas la más importante que es la vacunación.
Es importantísimo esta vigilancia integrada. No solo tienen que ser los equipos de vigilancia, donde la vigilancia base comunitaria es fundamental porque es la comunidad los que van a ser las primeros vigías que van a lograr identificar esto para poder llegar al sitio con los equipos de respuesta inmediata, con formación en epidemiología, hacer el estudio de investigación del primate, la colección de vectores y un estudio apropiado de cada caso.
El taller muy enriquecedor, las experiencias de los demás departamentos, de todos los profesionales de OPS, del ministerio, más que todo porque como referente de vigilancia basada en comunidad, aporta demasiado a mi conocimiento para yo poder transmitir a esas comunidades.
Considero que uno de los pilares principales para la atención a estas contingencias es el fortalecimiento de capacidades a todos esos profesionales que desarrollamos esas acciones en los entornos departamentales.
Este es un taller teórico-práctico, es una experiencia respecto a los mayores expertos que tenemos en la región. En el caso de este taller se ha invitado a personal técnico del Ministerio de Salud de Brasil, quienes están compartiendo sus experiencias de cómo hacer la toma de muestras en los cuerpos de los primates no humanos que se encuentran en la selva.
En Brasil hay una experiencia de más de 20 años con la vigilancia de epizootias. Esta estrategia, coordinada con los programas de inmunización, que ha sido la clave para el éxito del programa de prevención de fiebre amarilla.
Y me voy con unos grandes conocimientos para poder aplicarlos e implementarlos allá en el territorio.
Hemos aprendido mucho, sobre todo lo que nos interesa ahora es lo práctico, cómo recolectar las muestras de los primates no humanos en zonas alejadas.
Queremos es aunar esfuerzos como salud, como medio ambiente, para que todo sea de una manera integrada y poder evitar más muertes por fiebre amarilla y conservar la fauna, que en estos casos serían los primates no humanos.
Es importante que la gente, las comunidades locales reconozcan la importancia de estos primates no humanos que están en el territorio y cómo es esta relación con la fiebre amarilla. Se ve que de pronto este va a ser un agente contagioso, siendo una víctima más de la fiebre amarilla.
Sin las comunidades no podemos hacer una respuesta efectiva y tenemos que dar siempre información clara para orientar mejor a la salida de esta emergencia.
El tracoma es la principal causa de ceguera infecciosa en el mundo. Afecta especialmente a mujeres y niños en comunidades rurales y remotas donde el acceso a servicios de salud, agua y saneamiento es limitado. Pero hoy estamos cambiando esta realidad. Gracias a una alianza entre la Organización Panamericana de la Salud y el Gobierno de Canadá, se han implementado acciones para la eliminación del tracoma en los países de la región. La iniciativa para la eliminación del tracoma en las Américas no solo combate esta enfermedad, sino que también permite acercar atención integrada en salud a las poblaciones más vulnerables. Estos son algunos de los logros alcanzados en el segundo año de la iniciativa. Bolivia. En 21 comunidades indígenas remotas de Bolivia se realizaron evaluaciones rápidas de tracoma. Más de 4,000 personas fueron examinadas y más de 800 recibieron atención en salud, en servicios como salud visual, incluidas 17 cirugías de cataratas, salud bucal, pediatría, ginecología, salud materna, telemedicina, inmunización, medicina general y tradicional. También se promovió el lavado de manos y otras acciones de higiene y saneamiento. Brasil. En Brasil, la iniciativa visitó 750 hogares y examinó a 3,123 personas en búsqueda activa de tracoma. Se capacitó a 49 personas, incluyendo miembros de la comunidad, en salud, agua, higiene y saneamiento. Además, se formó a 22 comunicadores indígenas para promover la educación en salud en lenguas originarias, fortaleciendo la prevención del tracoma desde la diversidad cultural. Colombia. En Colombia, la iniciativa concentró sus esfuerzos en los 2 distritos con mayor prevalencia de tracoma, ubicados en el este y oeste del Vaupés. Se visitaron 256 comunidades pertenecientes a 29 grupos étnicos, con el apoyo de 11 equipos de trabajo en el terreno. Se capacitó al personal de salud y se ofrecieron servicios integrados que incluyeron atención en salud visual, diagnóstico y tratamiento de malaria, leishmaniasis, tungiasis y pediculosis, así como vacunación veterinaria y la desparasitación canina, fortaleciendo así el enfoque integral e intercultural de atención en salud en territorios indígenas. Ecuador. En Ecuador, 2 equipos de trabajo visitaron 8 comunidades en Taisha y Xuxufindi, donde se examinaron a 968 personas en busca de tracoma. Además, se brindaron servicios integrados de salud para malaria y chagas, aprovechando el acercamiento a las comunidades. México. México mantiene la eliminación del tracoma mediante vigilancia continua, prevención y atención de casos crónicos. En 5 municipios de Chiapas se realizaron acciones clave, incluyendo una jornada de cirugía para tratar la triquiasis tracomatosa que salvó la visión de 6 mujeres mayores. También se implementó un protocolo de vigilancia postvalidación y se promovieron hábitos de higiene como el lavado de cara y manos para prevenir la enfermedad. Guatemala. Guatemala es el país que está más cerca de eliminar el tracoma como problema de salud pública en la región. En Sololá se operó a 13 personas con triquiasis tracomatosa y se realizó seguimiento posquirúrgico. Además, se evaluaron 2.742 personas en 5 departamentos y se llevaron a cabo diálogos de saberes para intercambiar conocimientos entre comunidades y personal de salud. También se hizo un diagnóstico higiénico-sanitario en zonas prioritarias. Guatemala fue sede del entrenamiento de entrenadores, formando a profesionales de 6 países en encuestas de Tracoma Plus. El Salvador. En El Salvador se evaluaron 139 personas en la comunidad Cantón El Rodeo Aguachapán en busca de tracoma. Se capacitaron 12 profesionales para las evaluaciones rápidas de tracoma, formando 2 equipos de trabajo. Las actividades incluyeron pruebas de agudeza visual a mayores de 60 años y el monitoreo del Plan Nacional para la Prevención y Control de Enfermedades Tropicales Desatendidas 2024-2026. Perú. En Perú se realizaron actividades en los distritos Alto Amazonas, Mariscal Ramón Castilla, Requena y Putumayo del departamento de Loreto. Más de 200 profesionales de salud y líderes comunitarios fueron capacitados en la estrategia SAFE para eliminar el tracoma. 3 comunidades participaron en diálogos de saberes, fortaleciendo el enfoque comunitario. Además, más de 30 autoridades locales se comprometieron con la causa. Estas acciones se integraron con otras prioridades de salud como malaria, geogelmintiasis y dengue, ampliando su impacto en las comunidades. Venezuela. En Venezuela, la iniciativa avanzó en el estado Amazonas, donde se evaluaron 2.372 personas en busca de tracoma. Se realizaron talleres de prevención con 481 participantes, principalmente personal de salud. Se integraron servicios como salud ambiental, malaria, atención nutricional, salud materna y vacunación. Además, se reforzó la vigilancia de enfermedades como leishmaniasis, oncocercosis y tungiasis, y se desparasitaron a más de 2.000 personas. En total, las jornadas de salud integral beneficiaron a 4.642 personas en las comunidades atendidas. Estamos más cerca de eliminar el tracoma en las Américas, pero el esfuerzo debe continuar. Gracias al apoyo del Gobierno de Canadá y el compromiso de cada país, seguimos avanzando hacia un futuro sin tracoma. Juntos podemos lograr una América libre de tracoma.
Muchas gracias porque vinieron a nuestra casa a evaluar la vista de toda mi familia. Estamos muy agradecidos en nombre de toda la comunidad por la presencia de ustedes.
Dicen que hay lugares donde el camino se acaba, donde la carretera se convierte en mar y el viento en compañía. Pero también dicen que hasta allá llegan los compromisos más importantes, como el proteger la vida, para que nadie quede atrás. A la fecha, las coberturas vacunales sin influenza superan los 6 millones en población objetivo, colaborando esto con la disminución de casos graves y muertes por virus respiratorios. En el marco de la campaña de vacunación e inmunización 2025 del Ministerio de Salud de Chile y la Semana de Vacunación en las Américas, la OPS-OMS Chile, junto a un equipo del Programa Nacional de Inmunizaciones del Ministerio de Salud y autoridades regionales, emprendió una travesía hacia los rincones más australes del continente americano. 3 días, más de 4.500 kilómetros, un viaje impulsado por un propósito claro, una sola misión: llevar vacunas a quienes se encuentran en zonas aisladas o de difícil acceso en el país. Llevar vacunas a donde nadie más llega. Desde Santiago a Balmaceda, de Balmaceda a Coyhaique, nuestra primera parada. Allí reconocimos la clave del éxito de la vacunación en esa remota zona. Un equipo de salud altamente comprometido, que camina de la mano de líderes y lideresas comunitarias que convocan a mujeres y hombres, niños y adultos mayores para llegar a todas y todos. Además, cuentan con el apoyo intersectorial de las alcaldías, diferentes estamentos del Estado y la sociedad civil en general. La tradición de proteger a su pueblo a través de la vacunación es parte del ADN de Chile, desde las primeras campañas del siglo XVIII hasta la rápida y eficaz respuesta frente a la COVID-19. Nuestro país ha liderado con ejemplo, dejando una huella imborrable a nivel mundial. De Coyhaique partimos por tierra hasta Puerto Cisnes, y desde allí zarpamos iniciando la travesía que nos llevó al corazón de comunidades apartadas. El equipo bordó ambulanchas, botes adaptados como verdaderas clínicas flotantes, para llegar hasta Puerto Gaviota, una comunidad a la que solo se accede por mar. Ahí, entre rocas, cerros verdes y mar indómito, se vacunó a niños, niñas y adultos mayores. El segundo día el equipo zarpó hacia Isla Gala, rodeados de volcanes y fiordos. Nuevas distancias, nuevos desafíos, mismo objetivo, proteger a la población. Cada dosis aplicada fue un acto de cuidado, una promesa cumplida, una señal de que la salud pública no tiene fronteras. Finalmente el equipo regresó a Coyhaique. Misión cumplida, vocación intacta. La travesía terminó, pero el compromiso sigue. Porque llegar a los rincones más alejados no es solo una meta logística, es una declaración que nadie quede atrás, que la salud es un derecho y que en Chile se vacuna hasta el fin del mundo. Estamos seguros de que Chile logrará las metas establecidas por el país según las recomendaciones de OPS-OMS.
I have children at home. I have 4 of them, so that's the 5th one. And it's the first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarongpar village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it strange from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, you know, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had a face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department, because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works. So we input the information quicker and you don't have to do multiple copies in order to share to the different ward.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness Belize, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities, strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we were able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Me manejo mucho en este internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa,
lo puede hacer a cualquier hora. Yo que trabajo todo el día.
Donnie, where is the cable? Is this the cable?
Yeah, la telemedicina acerca a los profesionales
no the charger.
Yes, the charger. Just plug it in. Mejorando el manejo de su salud.
The HDMI cable is this one?
It doesn't have to be HDMI. Just plug in the charger to the laptop, and then it will display it.
The charger is here. Okay, hold on.
É como fosse realizar sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through Cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance nan ka routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun nan centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes sous terrain comme ça a vraiment aidé parents yo, aider ti moun yo pour capable joindre vaccin dans localité côté que yo vivent là.
Parler des maladies évitables à la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité de réponse, j'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gen moins que 15 ans.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the HEARTS initiative.
At the core of the HEARTS initiative is the HEARTS protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of HEARTS has introduced a standardized approach to the way we manage high blood pressure patients.
The HEARTS protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the HEARTS program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The HEARTS protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concerns that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice, and we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using as part of the HEARTS initiative, they're somewhat designed to be less burdensome on the patient because the number of pills that the patients would be required to use to control their conditions are reduced, because now we are making use of combination therapy. So one pill will contain maybe your 2 high blood pressure medication that you're taking at present.
Medication that are available through the HEARTS initiative are heavily subsidized, right? Patients that are less than 60 would pay a small fee. Those who are over 60 and over, it would actually be free as per protocol that already existed.
Following the introduction of the HEARTS initiative, we anticipate better compliance among our patients. We anticipate a reduction in the number of individuals who have uncontrolled high blood pressure. And at the end, we anticipate that in the long run, a reduction in the number of complications and the number of deaths that we are seeing as a result of high blood pressure and cardiovascular disease.
El cáncer infantil afecta a miles de familias en el mundo cada año, generando angustia y sufrimiento. En la región de las Américas, los gobiernos, la OPS y sus socios se han unido en la iniciativa Cure All para afrontar este desafío y devolver la esperanza.
Desde el año 2019, la Organización Panamericana de la Salud, en colaboración con el St. Jude Children's Research Hospital, trabaja incansablemente para mejorar la detección oportuna del cáncer en niños, niñas y adolescentes. En Latinoamérica y Caribe estamos logrando que más países prioricen el cáncer infantil y lo incluyan en políticas públicas que contemplen actividades para promover el diagnóstico oportuno. En los últimos 5 años, se ha incrementado por lo menos en 3 veces el número de países que cuentan con una guía nacional de detección precoz y sistemas de referencia. Ya estamos viendo los primeros resultados y se está logrando que más niños puedan llegar temprano a su diagnóstico, que más niños puedan tener estadios precoces de enfermedad y que amplíen la posibilidad de curarse.
En el Perú, hemos logrado reducir el 50% del tiempo diagnóstico en un lapso de 5 años. Principalmente desde la Iniciativa Mundial de Cáncer Infantil. El tiempo en el que los profesionales de la salud, médicos y enfermeras demoraban para hacer el diagnóstico en niños desde la sospecha de cáncer se ha reducido de manera significativa. Actualmente, los niños y adolescentes llegan más rápido a los establecimientos de salud. Este logro es un trabajo conjunto desde el Ministerio de Salud a través de políticas públicas que impulsan la detección temprana de cáncer infantil, asimismo el fortalecimiento de las capacidades de los profesionales de la salud, la sensibilización de la comunidad para poder realizar un diagnóstico oportuno y, por supuesto, la participación de la sociedad civil organizada.
Hemos logrado disminuir en un 50% los casos de estadios avanzados de cáncer en los niños. Esto significa que más familias reciben un diagnóstico temprano y más niños tienen una oportunidad de vida, educando y sensibilizando al personal de salud y a la población.
La Organización Panamericana de la Salud pone a disposición de los países diversos recursos técnicos, como cursos virtuales, talleres y guías interactivas para fortalecer la capacitación de los profesionales de la salud, así como materiales para campañas de comunicación dirigidas a los padres y a la comunidad en general.
A través de Cure All Americas, también se está apoyando a los gobiernos en el monitoreo sostenible y uniforme de sus progresos, así como en la implementación de políticas de salud que fortalecen el acceso al diagnóstico temprano, tratamiento y cobertura financiera. Todo con un objetivo, un diagnóstico temprano que salve vidas y mejore el futuro de nuestras familias y comunidades.
Cada intervención en salud pública, cada acción coordinada y cada esfuerzo compartido son pasos hacia un futuro donde hay más niños que puedan superar el cáncer.
Un diagnóstico temprano salva vidas.
En 2019, los Estados miembros de la Organización Panamericana de la Salud, OPS, aprobaron la iniciativa para la eliminación de 30 enfermedades infecciosas en la región para el año 2030. En el marco de esta iniciativa, en 2023, se conformó una alianza con el gobierno de Canadá para un proyecto de eliminación del tracoma como problema de salud pública para el año 2028. Venezuela es uno de los 10 países que participa en esta iniciativa.
Tracoma es la primera causa de ceguera producto de infecciones, lo produce una bacteria y estamos ahorita aplicando la encuesta para ver de prevalencia, para ver si es un problema de salud pública para el Estado.
Durante 2 semanas, un equipo de evaluaciones rápidas de tracoma del Ministerio del Poder Popular para la Salud abordó 30 poblaciones indígenas en busca de tracoma, una enfermedad que afecta sobre todo a poblaciones en situaciones de mayor vulnerabilidad. La idea es estimar la prevalencia de esta enfermedad en el país y determinar si constituye un problema de salud pública.
Andamos un equipo de salud desplegado diagnosticando la enfermedad tracoma. Esta es una enfermedad que afecta el ojo, que posteriormente la persona queda ciega. Y como parte de prevención, le estamos orientando a las personas a tener una buena higiene personal, como el lavado de manos, la limpieza facial. También contamos con tratamientos y en el caso de que los pacientes lleguen a salir positivos a estas enfermedades.
La OPS acompañó y prestó apoyo logístico para el traslado de estos trabajadores sanitarios del ministerio hacia estas comunidades, 22 de acceso terrestre y 8 de acceso fluvial, aprovechando además para ofrecer distintos servicios de salud a las mismas.
On November 14th, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
En el Pacífico colombiano, las comunidades indígenas y afrodescendientes enfrentan grandes dificultades: el conflicto armado, la pobreza y el aislamiento. A través de un esfuerzo conjunto de las Naciones Unidas, diversas iniciativas están resolviendo estas emergencias, fortaleciendo la resiliencia comunitaria, creando nuevas oportunidades en medio de esta adversidad. Esta alianza de Naciones Unidas permitió a estas comunidades afectadas por el conflicto diversas estrategias complementarias: temas de seguridad para la población con ACNUR, escuelas seguras para niños, niñas y adolescentes con UNICEF, fortalecimiento de la salud sexual y reproductiva y violencia basada en género con UNFPA. Además, se promovió la sustitución de cultivos de coca por proyectos productivos como criaderos de pollos, lecciones de pesca, huertas caseras y medicinales, acciones realizadas por la FAO. La Organización Panamericana de la Salud logró dar acceso a salud a estas poblaciones de los departamentos de Nariño, Valle de Cauca y Chocó. Se lograron avanzar hasta 24 brigadas de salud y más de 8.200 atenciones en una atención integral de medicina general, ginecobstetricia, odontología o apoyo psicosocial, con un enfoque étnico-cultural. Esto acompañado con dotación de medicamentos y diferentes pruebas de diagnóstico rápidas para una mejor resolución de las temáticas.
Este trabajo que ha venido desarrollando la Organización Panamericana de la Salud ha permitido hacer unas transformaciones de fondo en cómo mejorar el modelo de salud, en infraestructura, en capacitaciones, en dotaciones, para que la comunidad tenga una salud digna, oportuna, con seguridad del paciente.
Pues de solo entrar, pues uno sentía la enfermedad más grave, por el calor, el aspecto, y ahora es un cambio extremo. Uno entra y siente que hay más frescura, más tranquilidad, el calor poco azota, ahora estamos mejor.
Se atendieron numerosos casos críticos de malaria, desnutrición aguda, ideación suicida. Además, se realizaron encuentros de parteras, médicos tradicionales y sabedores que en un espacio de diálogo de saberes con médicos y enfermeras occidentales permitió el intercambio de conocimientos con el fin de salvar vidas y evitar muertes maternas. Además, nos reunimos con la institucionalidad local para identificar sus fortalezas, retos y desafíos.
Al tener una comunidad capacitada en primeros auxilios, en comunicación del riesgo, en salud mental, primeros auxilios psicológicos, en las emergencias, vamos a disminuir el impacto que una emergencia pueda tener en la comunidad, porque ellos van a saber cómo actuar en un momento adecuado, un protocolo adecuado, un procedimiento adecuado frente a las emergencias que ocurren en nuestro departamento.
A lo largo de esta trayectoria hemos aprendido cómo hacer un torniquete y, sobre todo en un accidente, mantener la calma, asegurar la escena.
Hemos realizado taller de primer respondiente comunitario, donde ellos lo que hacen es cómo dar esa primera ayuda comunitaria cuando se presenta una emergencia.
Adicionalmente, se estableció el sistema de alerta temprana en estas comunidades. Se trabajó mucho con esta Estrategia Nacional de la Vigilancia de Base Comunitaria.
Por eso dentro del proyecto SERF también incluimos el componente de comunicación del riesgo para que estos gestores comunitarios, para que estos primeros respondientes también puedan hacer uso de las comunicaciones en toda su labor de salvar vidas, de darle a la gente capacidades para que tenga un buen vivir.
Depois de décadas de esforços integrados e multissetoriais, a filariose linfática deixou de ser um problema de saúde pública no Brasil. O certificado de eliminação da doença foi entregue pelo diretor da OPAS e do Escritório Regional da OMS para as Américas, Jarbas Barbosa, à ministra da Saúde, Nízia Trindade. A cerimônia de entrega ocorreu no marco da reunião do Conselho Diretor da OPAS, nos Estados Unidos, que contou com a presença de autoridades de saúde de todos os países das Américas. A filariose linfática, mais conhecida como elefantíase, é uma doença parasitária transmitida por mosquitos. Ela afeta o sistema linfático e pode causar inchaços graves, especialmente nos membros inferiores e nos genitais, causando bastante dor e podendo resultar em deficiências permanentes. Para combater essa doença, o Ministério da Saúde do Brasil lançou em 1997 o Plano Nacional para a Eliminação da Filariose. A partir daí, várias medidas foram implementadas, como a distribuição em massa de medicamentos antiparasitários, controle de vetores e monitoramento constante nas áreas mais afetadas. Esses esforços se concentraram nas áreas onde a filariose era endêmica e resultaram 10 anos depois no fim da transmissão da doença. Desde 2017, não há mais casos confirmados de filariose no Brasil. A eliminação da doença é resultado do trabalho conjunto de trabalhadores de saúde, pesquisadores e gestores, bem como da criação de um sistema de saúde universal, com ações de vigilância bem estruturadas, uma rede de laboratórios públicos especializados e o lançamento do programa Brasil Saudável, que é uma ação multissetorial alinhada com a iniciativa regional da OPAS para a eliminação de doenças até 2030. Com essa certificação, o Brasil demonstra forte compromisso com a proteção da saúde, em especial das populações mais vulnerabilizadas.
Para nosotros es importante, ¿no?, poder haber llegado acá
Esta visita responde a un proyecto que estamos ejecutando desde el punto de vista de la salud ocular. Estamos acompañando a todo el equipo evaluador que se va a encargar de hacer este trabajo para ver si tenemos alguna patología que tenga que ver con tracoma ocular.
Estamos en la comunidad de Las Flores.
Acabamos de tener una reunión con los comunarios.
Hemos venido a conversar, ¿no?, con las autoridades aquí del lugar
para organizar el pesquisaje que se va a realizar para el tracoma.
Vivir en Puerto Las Flores bien nomás, bonito nomás estar aquí del aire, respiramos, ¿no? En Puerto Las Flores no existe la electricidad.
Han levantado ya hace más de un año un tanque, han puesto agua, han hecho pozos, pero el agua no es buena.
Cuando estamos mal de los ojos nos afecta, ¿no?
No solo en Las Flores, ¿no?, sino en distintas comunidades. Hay deficiencias, ¿no?, en el tema de lo que es salud y de educación más que todo, ¿no?
Nunca me hablaron del tracoma, no sabía de esta enfermedad.
Nunca había escuchado del tracoma.
El tracoma es una enfermedad infecciosa que afecta principalmente a los párpados, posteriormente a la córnea y puede dejar invalidado a un paciente produciéndole una ceguera permanente e irreversible. Se contagia de forma directa, es decir, de persona a persona.
En especial los niñitos, digamos, se tocan y pueden estar dando la mano a otro niño y así se puede contagiar.
Cuando ya tienen triquiasis ya se van sacando las pestañas, sino depilando, le estorba ya.
Esta enfermedad se ve principalmente en zonas con poca o ninguna sistema sanitario.
Donde no haya agua segura.
Con dificultad en sistemas de alcantarillado.
Dentro del registro que nosotros manejamos como Ministerio de Salud, no tenemos incidencia, ¿no?, a nivel nacional, ¿no? Sin embargo, tenemos países vecinos en los cuales sí ha sido un problema de salud pública. Es por ello que estamos ejecutando este proyecto, que es una evaluación rápida para tracoma ocular en comunidades vulnerables, ¿no? Una vez termine este proyecto, nosotros vamos a tener la capacidad de poder determinar si tenemos o no y si realmente el tracoma ocular para nosotros es un problema en salud pública.
Estamos viniendo casa por casa a revisar una enfermedad que nosotros estamos buscando, que se llama tracoma. Con su permiso lo vamos a hacer el examen y a todo el miembro de la familia.
Sí, pasen nomás.
Muchas gracias.
Va a mirar hacia abajo, mira hacia abajo. Mira hacia arriba. No, su ojito nomás, no hacia. Ahora mira hacia abajo. No parpadea ya, si no hay que
La detección del tracoma es importante, puesto que si nosotros lo detectamos a tiempo, vamos a garantizar la salud y la estabilidad ocular del paciente. Haciendo una detección, haciendo las campañas de prevención y promoción, evitamos la proliferación de esta enfermedad que como resultado final lleva a la ceguera. Entonces, si nosotros actuamos temprano, prevenimos a un paciente ciego en el futuro.
Doy la bienvenida a todo el equipo médicos. Esta es nuestra comunidad de la Nación Yuki. Bienvenidos.
Para nosotros es por primera vez que han venido a ver los ojos de nosotros. Los comunarios hemos venido de las tres comunidades, Viarilloa, la comunidad Pachino y la comunidad de Villarecuate, donde estamos en este momento.
La brigada que viene es de mucha ayuda para nosotros porque, bueno, en Villarecuate la gente tiene muchos problemas sobre el ojo.
Es la primera vez que me revisan mis ojos.
Esta es la primera vez que me revisan ojo aquí en comunidad.
Nunca había escuchado esa enfermedad tracoma.
Nunca había escuchado de que se pueda contagiar la enfermedad tracoma así con la mano sucia.
En calidad de cacique mayor, yo le he dicho a toda la población de que tenemos que hacernos ver nuestros ojos a los médicos que han venido.
Venimos trabajando ya anteriormente en el Gran Chaco, en Santa Cruz, en el municipio de Camiri. Esta versión ya hemos visitado 3 comunidades aquí del trópico. En esta actividad también hemos diagnosticado otras patologías, además de tracoma. Y bueno, como Ministerio de Salud estamos programando ya actividades también para poder atender esta otra patología, como son las cataratas y terrigio, que son de mayor relevancia en la población adulta o mayor. Vamos a llegar como Ministerio de Salud con cirugías de cataratas y terrigio de manera gratuita para la población que se haya encontrado con esta patología. Estaremos visitando el departamento de Pando, las comunidades indígenas, posteriormente el departamento de La Paz, el norte de La Paz específicamente, porque son las comunidades indígenas que estamos priorizando para poder ampliar la cobertura en la búsqueda de la patología denominada tracoma.
Esta enfermedad puede tratarse con una higiene adecuada. No se trata solamente de venir y curar, se trata de venir y enseñarles cómo cuidarse. Eso es más importante que, te diría, el mismo tratamiento por sí mismo.
Este es el segundo taller que realizamos en Colombia con el tema de vigilancia integrada de epizootias y vectores en el contexto de la respuesta a la fiebre amarilla.
Recordemos que hace un año se inició la transmisión en el departamento de Putumayo y actualmente tenemos una afectación de 10 departamentos, 30 municipios, en los cuales ya se ha acumulado un número importante de casos y de ellos aproximadamente la mitad han fallecido.
En la región de las Américas, aquí en Colombia, solamente hemos encontrado casos asociados precisamente a ese ciclo selvático de la enfermedad, pero un trabajo muy importante de vigilancia significa precisamente evitar que eventualmente estos humanos infecten mosquitos urbanos y se inicie lo que se conoce como el brote, como una fiebre amarilla en ciclo urbano. Hasta el momento no se ha determinado ni se ha demostrado fiebre amarilla urbana en la región de las Américas en los últimos brotes, pero tenemos que estar atentos precisamente porque la urbanización podría ser devastadora en un escenario en el cual tenemos vectores urbanos que se encargan de transmitir otros virus como el dengue, los tenemos con una amplia distribución. Seguramente no habría una capacidad suficiente para controlarlo, ya que tenemos dosis limitadas de vacunas.
De allí la importancia de este taller, que nos permita generar las capacidades para la vigilancia de lo que denominamos las epizootias, es decir, la identificación oportuna en qué momento nuestros micos se están enfermando o están muriendo y que por ende ellos nos están informando de una forma muy natural por dónde puede estar circulando el virus para otros poder organizar las acciones de prevención y control, y de ellas la más importante, que es la vacunación.
Es importantísimo esta vigilancia integrada. No solo tienen que ser los equipos de vigilancia, donde la vigilancia base comunitaria es fundamental porque es la comunidad los que van a ser las primeros vigías que van a lograr identificar esto para poder llegar al sitio con los equipos de respuesta inmediata, con formación en epidemiología, hacer el estudio de investigación del primate, la colección de vectores y un estudio apropiado de cada caso.
El taller muy enriquecedor, las experiencias de los demás departamentos, de todos los profesionales de OPS, del ministerio, más que todo porque como referente de vigilancia basada en comunidad, aporta demasiado a mi conocimiento para yo poder transmitir a esas comunidades.
Considero que uno de los pilares principales para la atención a estas contingencias es el fortalecimiento de capacidades a todos esos profesionales que desarrollamos esas acciones en los entornos departamentales.
Este es un taller teórico-práctico, es una experiencia respecto a los mayores expertos que tenemos en la región. En el caso de este taller se ha invitado a personal técnico del Ministerio de Salud de Brasil, quienes están compartiendo sus experiencias de cómo hacer la toma de muestras en los cuerpos de los primates no humanos que se encuentran en la selva.
En Brasil hay una experiencia de más de 20 años con la vigilancia de epizootias. Esta estrategia, coordinada con los programas de inmunización, que ha sido la clave para el éxito del programa de prevención de fiebre amarilla.
Y me voy con unos grandes conocimientos para poder aplicarlos e implementarlos allá en el territorio.
Hemos aprendido mucho, sobre todo lo que nos interesa ahora es lo práctico, cómo recolectar las muestras de los primates no humanos en zonas alejadas.
Queremos es aunar esfuerzos como salud, como medio ambiente, para que todo sea de una manera integrada y poder evitar más muertes por fiebre amarilla y conservar la fauna, que en estos casos serían los primates no humanos.
Es importante que la gente, las comunidades locales reconozcan la importancia de estos primates no humanos que están en el territorio y cómo es esta relación con la fiebre amarilla. Se ve que de pronto este va a ser un agente contagioso, siendo una víctima más de la fiebre amarilla.
En las comunidades no podemos hacer una respuesta efectiva y tenemos que dar siempre información clara para orientar mejor a la salida de esta emergencia.
El tracoma es la principal causa de ceguera infecciosa en el mundo. Afecta especialmente a mujeres y niños en comunidades rurales y remotas donde el acceso a servicios de salud, agua y saneamiento es limitado. Pero hoy estamos cambiando esta realidad. Gracias a una alianza entre la Organización Panamericana de la Salud y el Gobierno de Canadá, se han implementado acciones para la eliminación del tracoma en los países de la región. La iniciativa para la eliminación del tracoma en las Américas no solo combate esta enfermedad, sino que también permite acercar atención integrada en salud a las poblaciones más vulnerables. Estos son algunos de los logros alcanzados en el segundo año de la iniciativa. Bolivia. En 21 comunidades indígenas remotas de Bolivia se realizaron evaluaciones rápidas de tracoma. Más de 4.000 personas fueron examinadas y más de 800 recibieron atención en salud, en servicios como salud visual, incluidas 17 cirugías de cataratas, salud bucal, pediatría, ginecología, salud materna, telemedicina, inmunización, medicina general y tradicional. También se promovió el lavado de manos y otras acciones de higiene y saneamiento. Brasil. En Brasil, la iniciativa visitó 750 hogares y examinó a 3.123 personas en búsqueda activa de tracoma. Se capacitó a 49 personas, incluyendo miembros de la comunidad, en salud, agua, higiene y saneamiento. Además, se formó a 22 comunicadores indígenas para promover la educación en salud en lenguas originarias, fortaleciendo la prevención del tracoma desde la diversidad cultural. Colombia. En Colombia, la iniciativa concentró sus esfuerzos en los 2 distritos con mayor prevalencia de tracoma, ubicados en el este y oeste del Vaupés. Se visitaron 256 comunidades pertenecientes a 29 grupos étnicos, con el apoyo de 11 equipos de trabajo en el terreno. Se capacitó al personal de salud y se ofrecieron servicios integrados que incluyeron atención en salud visual, diagnóstico y tratamiento de malaria, leishmaniasis, tungiasis y pediculosis, así como vacunación veterinaria y la desparasitación canina, fortaleciendo así el enfoque integral e intercultural de atención en salud en territorios indígenas. Ecuador. En Ecuador, 2 equipos de trabajo visitaron 8 comunidades en Taisha y Xuxufindi, donde se examinaron a 968 personas en busca de tracoma. Además, se brindaron servicios integrados de salud para malaria y chagas, aprovechando el acercamiento a las comunidades. México. México mantiene la eliminación del tracoma mediante vigilancia continua, prevención y atención de casos crónicos. En 5 municipios de Chiapas se realizaron acciones clave, incluyendo una jornada de cirugía para tratar la triquiasis tracomatosa que salvó la visión de 6 mujeres mayores. También se implementó un protocolo de vigilancia postvalidación y se promovieron hábitos de higiene como el lavado de cara y manos para prevenir la enfermedad. Guatemala. Guatemala es el país que está más cerca de eliminar el tracoma como problema de salud pública en la región. En Sololá se operó a 13 personas con triquiasis tracomatosa y se realizó seguimiento posquirúrgico. Además, se evaluaron 2.742 personas en 5 departamentos y se llevaron a cabo diálogos de saberes para intercambiar conocimientos entre comunidades y personal de salud. También se hizo un diagnóstico higiénico-sanitario en zonas prioritarias. Guatemala fue sede del entrenamiento de entrenadores, formando a profesionales de 6 países en encuestas de Tracoma Plus. El Salvador. En El Salvador se evaluaron 139 personas en la comunidad Cantón El Rodeo Aguachapán en busca de tracoma. Se capacitaron 12 profesionales para las evaluaciones rápidas de tracoma, formando 2 equipos de trabajo. Las actividades incluyeron pruebas de agudeza visual a mayores de 60 años y el monitoreo del Plan Nacional para la Prevención y Control de Enfermedades Tropicales Desatendidas 2024-2026. Perú. En Perú se realizaron actividades en los distritos Alto Amazonas, Mariscal Ramón Castilla, Requena y Putumayo del departamento de Loreto. Más de 200 profesionales de salud y líderes comunitarios fueron capacitados en la estrategia SAFE para eliminar el tracoma. 3 comunidades participaron en diálogos de saberes, fortaleciendo el enfoque comunitario. Además, más de 30 autoridades locales se comprometieron con la causa. Estas acciones se integraron con otras prioridades de salud como malaria, geogelmintiasis y dengue, ampliando su impacto en las comunidades. Venezuela. En Venezuela, la iniciativa avanzó en el estado Amazonas, donde se evaluaron 2.372 personas en busca de tracoma. Se realizaron talleres de prevención con 481 participantes, principalmente personal de salud. Se integraron servicios como salud ambiental, malaria, atención nutricional, salud materna y vacunación. Además, se reforzó la vigilancia de enfermedades como leishmaniasis, oncocercosis y tungiasis, y se desparasitaron a más de 2.000 personas. En total, las jornadas de salud integral beneficiaron a 4.642 personas en las comunidades atendidas. Estamos más cerca de eliminar el tracoma en las Américas, pero el esfuerzo debe continuar. Gracias al apoyo del Gobierno de Canadá y el compromiso de cada país, seguimos avanzando hacia un futuro sin tracoma. Juntos podemos lograr una América libre de tracoma.
Bueno, muchas gracias porque vinieron a nuestra casa a evaluar la vista de toda mi familia. Estamos muy agradecidos en nombre de toda la comunidad por la presencia de ustedes.
Dicen que hay lugares donde el camino se acaba, donde la carretera se convierte en mar y el viento en compañía. Pero también dicen que hasta allá llegan los compromisos más importantes, como el proteger la vida, para que nadie quede atrás. A la fecha, las coberturas vacunales sin influenza superan los 6 millones en población objetivo, colaborando esto con la disminución de casos graves y muertes por virus respiratorios. En el marco de la campaña de vacunación e inmunización 2025 del Ministerio de Salud de Chile y la Semana de Vacunación en las Américas, la OPS-OMS Chile, junto a un equipo del Programa Nacional de Inmunizaciones del Ministerio de Salud y autoridades regionales, emprendió una travesía hacia los rincones más australes del continente americano. 3 días, más de 4.500 kilómetros, un viaje impulsado por un propósito claro, una sola misión: llevar vacunas a quienes se encuentran en zonas aisladas o de difícil acceso en el país. Llevar vacunas a donde nadie más llega. Desde Santiago a Balmaceda, de Balmaceda a Coyhaique, nuestra primera parada. Allí reconocimos la clave del éxito de la vacunación en esa remota zona. Un equipo de salud altamente comprometido, que camina de la mano de líderes y lideresas comunitarias que convocan a mujeres y hombres, niños y adultos mayores para llegar a todas y todos. Además, cuentan con el apoyo intersectorial de las alcaldías, diferentes estamentos del Estado y la sociedad civil en general. La tradición de proteger a su pueblo a través de la vacunación es parte del ADN de Chile, desde las primeras campañas del siglo XVIII hasta la rápida y eficaz respuesta frente a la COVID-19. Nuestro país ha liderado con ejemplo, dejando una huella imborrable a nivel mundial. De Coyhaique partimos por tierra hasta Puerto Cisnes y desde allí zarpamos iniciando la travesía que nos llevó al corazón de comunidades apartadas. El equipo bordó ambulanchas, botes adaptados como verdaderas clínicas flotantes, para llegar hasta Puerto Gaviota, una comunidad a la que solo se accede por mar. Ahí, entre rocas, cerros verdes y mar indómito, se vacunó a niños, niñas y adultos mayores. El segundo día el equipo zarpó hacia Isla Gala, rodeados de volcanes y fiordos. Nuevas distancias, nuevos desafíos, mismo objetivo, proteger a la población. Cada dosis aplicada fue un acto de cuidado, una promesa cumplida, una señal de que la salud pública no tiene fronteras. Finalmente el equipo regresó a Coyhaique. Misión cumplida, vocación intacta. La travesía terminó, pero el compromiso sigue. Porque llegar a los rincones más alejados no es solo una meta logística, es una declaración que nadie quede atrás, que la salud es un derecho y que en Chile se vacuna hasta el fin del mundo. Estamos seguros de que Chile logrará las metas establecidas por el país según las recomendaciones de OPS-OMS.
I have children at home. I have 4 of them, so that's the 5th one. And it's first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarong Par Village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it's strange from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, you know, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had a face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death in like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department, because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works, so we input the information quicker and you don't have to do multiple copies in order to share to the different wards.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness Belize, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities, strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we're able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time, we are ensuring better care for NCDs through integration in primary health care.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa,
lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance nan cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun nan centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes souterraines comme ça a vraiment aidé parents yo, aider ti moun yo pour capable joindre vaccin dans localité côté que yo vivent là.
Parler des maladies évitables à la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gen moins que 15 ans.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the Hearts Initiative.
At the core of the Hearts Initiative is the Hearts Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of Hearts has introduced a standardized approach to the way we manage high blood pressure patients.
The Hearts protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the Hearts program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The Hearts Protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concerns that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice, and we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical
Good afternoon. Yeah, good afternoon. I'm trying to get everybody's attention, but we're still, it seems like we're still a little bit in lunch mode, no? But anyway, thank you very much. I hope you had a sumptuous lunch and you're ready to resume. If anybody wants to nod off during the next session, we'll wake you up. So, before we begin, before we proceed with the agenda items for this afternoon, I'd like to invite the Director to officially launch the country annual reports for the Pan American Health Organization. And to accompany the Director in the presentation, I invite Piedad Huerta, the head of the country sub-regional coordination office of the Pan American Sanitary Bureau, to join us at the head table, and she's here. So I now yield the floor to Dr. Barbosa.
Thank you, Mr. President. It's my pleasure to take this opportunity to invite all of you to go to the QR code that is in this little card that you have in front of you. So this is a eco-friendly initiative from PAHO, because in this QR code you can find not all of them, but you can find 16 country annual report, and they promised me that by the end of this month we will have all of them available. This is, I think that's very important, because it's a way to present it to all member states, to partners, to stakeholders, what we are doing at country level in a standardized way. So for every country, we have the same template, but of course, bringing what we are doing at the country level to advance the regional priorities and also the national priorities, and also to acknowledge the partners that are supporting the country to advance the health agenda. So let me switch to Spanish. Gostaria de agradecer.
I would like to express my gratitude for the joint work done by each one of the country offices, the CSC office, as well as the publications office. All of them work together in order to come up with these reports. Now it is easier for everyone to become acquainted with these reports. Anyone who wants to have more detailed information about the work that is done by PAHO in each one of the countries. So here you have from our minister, our distinguished president from Guyana, showing what we're doing in Guyana with the highlights and the main achievements that the country had throughout the year. And here you can see how we show a summary and the progress made with the priorities that we have within the organization: strengthening of primary health care, the initiative for the disease elimination, the other initiative in order to reduce mortality, non-communicable prevented diseases or preventable diseases, the issue of digital transformation in health, the increasing use of regional revolving funds in order to expand access, and also to provide support to the production of health technologies in the region of the Americas, and the Zero Maternal Deaths Initiative. So I would like to express my gratitude to each and every one of you. If you can, please familiarize yourselves. Please use this as information material, accountability for member states, so that you can learn a bit more about what is being done by the organization on site in each one of the countries with our effort in order to beef up national capacities and to be able to have each one of the countries in the region showing their progress made in the health agenda that could benefit their population. So thank you very much, Mr. President, and thank you to all the countries.
Thank you very much, Dr. Barbosa, and I'm sure the colleagues here would be looking at the report and seeing the great work that PAHO has been doing in the different countries. I'll now like to move on and we'd like to go to item 4.1, proposed strategic plan of the Pan American Health Organization 2026 to 2031. I'd like to bring document CE 176-12 and the addendum 1 and propose strategic plan of the Pan American Health Organization 2026 to 2031 to the attention of the committee. The working group met yesterday and continue meeting today to discuss this item. I would like now to yield the floor to the chair of the working group to provide a summary of those deliberations. So, Madam Chair.
Voilà. Thank you, Mr. President. I'll just like to start by thanking all of our colleagues, member states who participated in both meetings. I think everyone will agree that we had very constructive and very positive engagement on the way forward on the strategic plan. What we present today to the full executive committee is, instead of a resolution, is a decision point for which we have agreement from the working group on the language of this decision point. With a special thanks, of course, to the Secretariat for their support in pulling this together, and our colleagues of the United States for providing language in flexibility in that decision point. So we're very happy to be presenting that decision point formally here. We also agreed on next steps, which I believe we have to share with you. We are proposing 2 intercessionals in the month of July, of course acknowledging these are very busy times, both professionally and personally for many people. But I think it's a demonstration of how very committed this group was to agree to 2 intercessional sessions. Do we have them? Or I have them here if it's easier. We'd just like to formally share the dates with the group today. Voila, thank you so much. So we agreed to written comments received. So there was acknowledgement that we very much want to focus on the areas of concern, that these 2 sessions should be limited in that scope. So any further written comments, and again, thank you specifically to our U.S. colleagues who have committed to sharing a bit more detail on their perspectives by July 18th for an intercessional meeting on the 23rd. Giving the Secretariat some time, very quick time, thank you again, to turn around back to member states for a second session on the 31st. You'll note there the recommended participants. This is as per usual intercessional processes. We also agreed, due to the importance and priority that we all have to the strategic plan and its success, that the consultation meeting that was scheduled for July 22nd, if I'm not mistaken, will be canceled, and the Secretariat will look at other ways to engage. But this, we agreed, would permit us all to really focus on the work ahead on the strategic plan. And finally, legal very kindly provided options and scenarios of and tools that member states could avail themselves of later on in the process as we approach directing council on other ways of navigating the success of the strategic plan. Of course, acknowledging that our priority is to reach consensus. So I'll stop there, Mr. President. Thank you.
So item 4.1, proposed strategic plan of the Pan American. Well, thank you again, Madam Chair. After listening to the summary, I would like to bring to the attention of the committee the text agreed upon by the working group for the consideration of the committee and possible adoption of the following decision. So item 4.1, proposed strategic plan of the Pan American Health Organization 2026 to 2031. The Executive Committee reviewed document CE 176/12 and its corresponding proposed resolution. The Executive Committee welcomed the constructive consultation process involving member states in developing the strategic plan. However, consensus on particular aspects of the plan could not be reached, and a working group was formed which met twice to discuss the path forward with a view to reaching consensus and finalizing the plan for adoption at the 62nd Directing Council. The Executive Committee requests Pan American Sanitary Bureau to facilitate the member states' intersessional consultation process on the Strategic Plan 2026 to 2031 between the Executive Committee and the Directing Council. So we just heard that, right? To address remaining concerns raised by the member states during the Executive Committee meeting. This decision, along with the deliberations held among member states on this item, will be reflected in the final report of this session of the Executive Committee. So this is the decision point that was just explained by Canada. So if we have do we have agreement on this decision? And if we do, then I declare the decision adopted. Thanks. We now go to item 4.6, policy for expanding equitable access to high-cost and high-priced health technologies. I would like to bring documents CE 176/17 and PR2, policy for expanding equitable access to high-cost and high-priced health technologies to the attention of the committee. The amended resolution is available in the resolution tracking system. As there are no other new amendments beyond those presented yesterday, it is not necessary for the rapporteur to read the proposed changes again. I understand that member states had informal conversations about proposed amendments. I would now like to yield the floor to the plenary for a discussion. The United States.
Thanks very much, Mr. President, and thank you, colleagues, for the additional time to consider the resolution. Unfortunately, my delegation does not have additional edits or flexibility at this time on the language in this resolution. That said, we are prepared to adopt the resolution as amended with the proposed changes that we were presented earlier this week, if that's acceptable to colleagues. So I'll leave it in this room's hands. Thank you.
Okay, we have a proposal on the floor for the resolution with the amendments from yesterday. Brazil.
Thank you very much, Mr.
Thank you very much, Brazil. We'd like to say thanks for the work done, the debate held, and the dialogue that we engaged in between yesterday and today with all of the delegations who are interested in taking part, and the U.S. And we are also grateful to our colleague who spoke just before me. Unfortunately, given how important the assessments are that were subject to these amendments, also the subject of discussions in other fora at the World Health Organization or within the context of the technology transfer talks in the preparation of COP30 and other fora, we would not be able to go along with the proposed amendments as it currently stands. We think that there was good will on all parts involved to garner consensus, but given the short time given for us to engage in the necessary consultations at the ministerial level regarding these proposed amendments, we are not in a position currently to accept this with the amendments as proposed.
Thank you very much, Brazil. I think we can, having listened to the two views, we can record it as a decision point as well. So item 4.6, policy for expanding equitable access to high-cost and high-price health technologies. The Executive Committee reviewed document CE 176-17 and its corresponding proposed resolution, and while the discussion was constructive, consensus could not be reached. The Executive Committee thus requests the Pan American Sanitary Bureau to continue the consultation process with member states during the period between this session of the Executive Committee and the forthcoming meeting of the Directing Council. This decision, along with deliberations held among member states on this item, will be reflected now in the final report of the session of the Executive Committee. Are we agreed on this? Can we agree on this? Thank you. Agreed. Okay, we now go to item 6.2, Human Resource Management in the Pan American Sanitary Bureau. I would like to bring document CE 176-24 to the attention of the committee and invite Dr. Barilas, Director of the Department of Human Resources Management of the Pan American Sanitary Bureau to come to the head table. I'll now like to yield the floor to the President of the Subcommittee on Program Budget and Administration to report on this item.
Muchas gracias. Thank you very much, Mr. President. Human Resources Management in the Pan American Sanitary Bureau. The subcommittee received an update in March on the most important initiatives undertaken in the sphere of human resources during 2024, including the implementation of the Bureau's revised human resources strategy, known as the People Strategy 2.0. Updates were also provided on efforts to achieve gender parity in the Bureau's staff and on steps taken to reduce the time required to complete the competitive selection process for fixed-term staff. In the subcommittee's discussion on the report, delegates expressed appreciation to the Bureau staff for their dedication and commitment, and to the Bureau for its continued transparent reporting of human resources information. The subcommittee welcomed the progress made in enhancing efficiency, including the reduction in staff recruitment period. The progress made in strengthening the staffing of PAHO country offices was also applauded. The successes achieved in recruiting a broader pool of interns, as were the advances made toward gender parity, although it was noted that continued efforts are required to increase the representation of women in senior level positions. Thank you very much, Mr. President. With this, I conclude my report on this item.
Thank you very much. I now yield the floor to Dr. Barilas to present this item.
Muchísimas gracias, señor. Thank you very much, Mr. President, distinguished director, distinguished members of the Executive Committee. This document C176/24 summarizes human resources management in the Pan American Sanitary Bureau in 2024, and it presents workforce trends and statistics for the period from January 1st to December 15, 2024, unless otherwise specified. In 2024, the Bureau successfully managed the human resources for the delivery of an effective technical cooperation. Next, please. Aligned with the strategic plan 2025, the human resource management was done in keeping with the People Strategy 2.0 and within the framework of PAHO Forward 2.0, which focused on strengthening human resources management and to bring about innovation at the same time that it further strengthens the commitment of the staff with efficiency, transparency, and accountability. It is within this context that we continue monitoring and reporting on our key indicators for the selection processes and gender parity. The average duration of selection processes for set-term positions was reduced from 183 to 158, a dramatic reduction of 25 days. And I wanted to mention that in July, we'll implement the new recruitment module of our PMIS system, and we hope to obtain greater efficiencies. We also completed the selection of 115 processes in order to fill fixed positions, and most of them in the international professional category. The office continued to develop initiatives in order to increase the efficiency using the capacities of our information systems and offer the staff access to the virtual platforms that have a vast and relevant learning offer within a sustainable context. The personnel advisor continued to provide support in individual and group participations, and the Ombudsman Office carried out activities within the initiative of the Respectful Work Environment. Amongst these, the series of online seminars with items related to psychological assistance, intercultural interactions, and mediation. In a nutshell, our human resource management promotes an institutional change in a respectful work environment and with the approach of strengthening our country offices.
Now, within the context of two initiatives, PAHO Forward 2.0 and its second pillar aimed at the visibility of PAHO in the country-centered focus and the initiative of the World Health Organization on the foreseeable basic presence in countries. The Bureau received additional funds to bolster country offices. This financing was used to create 39 new positions and to finance two functions that already existed in key countries. Of the 39 different positions created, 36 were filled, for three of them, the selection was paused given a lack of financing by WHO. This slide shows the distribution of the 36 filled positions in 24 countries of the region. And we're very pleased to be able to say that the Bureau reports that our region was the first one to complete the selection process under this initiative. In addition to the 36 positions, 17 professional international recruitment positions were filled in the country offices, totaling 53. As regards the administration of justice of the Bureau, in this next slide, what you see are 9 cases of alleged irregularities in which Bureau staff were implied. These irregularities were confirmed after the due process in the investigation was carried out, and the administrative disciplinary actions were taken. This table shows the 4 cases of harassment, in which some of which involve sexual harassment. In some of the cases of harassment, a disciplinary measure of a salary reduction was applied. In the other case, the investigation concluded after the retirement of that staff. The findings will be kept in the personal file of the individual. In both cases of sexual harassment and harassment, the staff members involved were let go. The last case that you see on this table is a case of confidential information having been shown on the platform or exhibited, and so the person involved received an administrative letter. Now, on this slide, you see a table in which we see the 4 cases involving contingent workers. These are individuals who have different types of contracts. They are not employees per se of the UN or PAHO. The first case, the non-disclosure of relevant information regarding personal history. That contract was immediately terminated, and that person will not be ever hired again by the Bureau. In cases such as this, it's justified to modify the rule that we presented this morning. That is, the omission of information that, had it been presented at the time of recruitment, would have kept that person's hiring from going forward. In the first case of sexual harassment on the table, the assignment was immediately terminated and the individual returned to the job agency with a notice of findings to the employer. That person had concluded the assignment in the Bureau when the investigation, by the time the investigation was over. The 2 people involved in sexual harassment will not be rehired by the Bureau. In the case of harassment in the workplace, the health ministry employee involved was attached to the office. Now, this agreement of secondment was canceled, and the Ministry of Health was notified of findings of harassment. Now, the Bureau is carrying out sustained activities to strengthen its administrative justice system, not just speeding up the investigation and subsequent phases, but also establishing performance indicators in the offices involved in the administration of justice process. Next, please. This annex shows the statistical data year by year on staff members as of December 15, 2024, or other dates indicated, covering the number of people broken down by the type of contract, sex, placement, and so forth, and other information, as well as trends over the last 6 years. Regarding the staffing of the office, we can see that by December 15th, 2024, the workforce was comprised of 2,323 people. Of this total, 864, which account for 37% of the total, were fixed-term or temporary staff members, and 1,459, 63%, had other types of contracts known as contingent workers, who are the ones I just referred to a moment back. This chart shows trends in the number of staff members with fixed-term contracts or temporary contracts and contractors or consultants from 2019 to 2024. The blue line, which represents the national consultants and the international ones, clearly shows a marked rise during the pandemic and a drop-off of 13% compared to 2023, whereas the number of individuals with fixed-term contracts shown by green rose by 3.6% from 2023 on. The number of consultants fluctuated not only in according to the changing nature of the technical cooperation offer, but also as a function of the number of fixed-term persons in the office. In 2024, the Bureau increased the number of staff members, especially in country offices, which led to a drop of consultants. The number of individuals with a temporary professional contract, shown in orange, had a drop-off slightly compared to 2023. In this chart, we see the trends in the number of staff members with fixed-term appointments in the categories of professional, general services, and national professional posts between 2019 and 2024. you can observe here that regarding 2023, the total number of fixed-term professional posts in purple or violet underwent a 7.7% rise, and as regards 2019, there was a 21% or a 4.6% rise, that is, rose by 21. This reflects the efforts that the Bureau has put forward to fill critical positions to strengthen the country offices. The number of general services positions in blue dropped off by 14.2% since 2019, and in the national professional positions in orange here maintained relatively stable. As regards the distribution of personnel by sex, by 15 December 2024, as you can see on the chart, of the total of 2,323, 1,420, 61%, were women, and 903, 39%, were men. Lastly, I'd like to share this chart with you because it shows a trend trend by gender between 2019 and 2024. In blue, we see that 58% of the positions of country representatives are positions held by women. P4 and P5 level positions held by women, shown in violet, have held stable over 47 over the last 3 years. I would also like to say, or 47%. Now, those positions in orange here, held by women, have risen over the last 3 years. That's P6, D1, D2. Now, an effort has been made to promote the appointment of women in higher positions at the same time that it has made sure that all of the candidates chosen are suitable and excellent, because it's always based on, or recruitment is always based on, merit of the candidates. And so this concludes my presentation. I stand by for any question or comment you may have. Thank you.
Thank you very much. Thank you very much. The Executive Committee is invited to take note of this report and provide any comments that it deems pertinent. And I would like to open the floor to the plenary for a discussion on the document presented. We go to the United States.
Thank you, Mr. Chair, and thank you for the presentation. The United States acknowledges this report and the activities carried out in 2024 to continue advancing PAHO's People Strategy 2.0. We know the progress made on key objectives last year, especially the efficiencies gained through enhancements in PAHO's management information system and its continued reductions in recruitment periods. The United States also notes that the WHO Core Predictable Country Presence Initiative will allow PAHO to create 39 new positions and finance 2 existing roles in key countries. As we clarified at the Subcommittee on Program, Budget, and Administration, the United States remains firm in its expectation that these positions will be used exclusively to carry out PAHO-specific activities and not those of the World Health Organization. The table provided in paragraph 26, that we discussed briefly here, outlines the 9 confirmed cases of wrongdoing and related administrative or disciplinary actions taken, which is an alarming number. We are concerned about the persistent occurrence of sexual harassment, though PAHO is taking action to dismiss aggressors in all such cases in line with its zero-tolerance policy. My delegation urges PAHO to strengthen its sexual harassment prevention measures for all categories of PAHO personnel. Separately, as we discussed this morning, the report from the Office of the Internal Audit mentions an incident in which the senior official for one country office overrode internal controls and caused the inappropriate approval of, quote, thousands of financial decisions over the period of several years. We are deeply concerned by that incident. Could the Secretary clarify why that incident does not appear in paragraph 26 of the Human Resources Management Report? If it remains under investigation, we would like an update on those proceedings as early as possible, please. As PAHO continues advancing its Gender Parity Action Plan, the United States also uses this opportunity to reiterate the administration's position that all hiring decisions at PAHO be firstly and fully merit-based, as the Human Resources Director said, and with the most qualified and effective personnel. In this instance, the United States understands gender parity to mean increasing women's representation in the workplace. Finally, as PAHO develops its new people strategy for 2025 to 2030, the United States wishes to be clear that we only support merit-based hiring and cannot support talent acquisition activities that promote diversity and inclusion, as that might put PAHO's valuable resources at risk of failing to meet merit-based hiring decisions. Thank you.
Thank you very much. We go to Chile.
Thank you, Mr. Chairman. We appreciate the exercise transparency represented by this document. Human capital is the most important asset that any organization has, and so we celebrate the progress made in the framework of this strategy for Personnel 2.0. We also appreciate the efforts made to modernize talent management, to promote internal mobility, to foster ongoing learning, and to adapt HR policies to a hybrid labor environment, and that's always changing. We celebrate all those activities carried out for mental health and to promote a safe and respectful working place. A psychosocial support is as important as salary adjustments raised under prior points. We also are thankful for the information presented in the annex, the shared initiatives or services, and that decision to be evidence-based and rational. And so it's very important for us to keep the established standard for the employees of this organization and in carrying out the shared service contracts, especially respect for criteria of diversity and the promotion of safe and respectful environments to be consistent in treatment. Now, as far as distribution by sex, we note a variety in recruitment, but we do recognize effort made to achieve this at the higher levels, the managerial levels. We also note a difference among the nationalities in the hiring of professional staff, and we would be grateful if we could be provided with greater detail of the figures offered, taking into account the recommendations made by the Internal Audit Office regarding this matter of compliance with the criterion of diversity. We commend the organizational development of PAHO in favor of its personnel. We take note of the report and we support its adoption. Thank you.
Thank you very much. We go to Brazil.
Thank you, Mr. President. Muito obrigado.
Thank you, Brazil. Thanks, Dr. Varias, for presenting this report on the HR management of the Pan American Health Organization, the Bureau. And so we do think that people are the greatest asset of this organization. We would like to thank all of the staff members in all the different categories of PAHO for the very important work that they carry out at the headquarters as well as country offices where they work. This is work that sometimes calls for facing risk and personal sacrifices to meet the basic health needs of our populations. Brazil is very pleased to observe that the implementation of the Personnel 2.2 strategy has made considerable strides. We appreciate the efforts to ensure that we stick to the highest standards of gender parity at all levels of the organization. We also recognize the progress made in the participation of women in high-level positions. Beyond that, we also appreciate the greater transparency and in the competitive selection processes for fixed-term positions and the time necessary to hire new talent, and we encourage seeking out furthermore the efficiency and the recruitment process. Also, there should be greater, or we appreciate the internship opportunities that have been created by the management. This new internship policy is a good way of drawing from a more diverse group of talent from different countries of the region. We hope that with time, this opportunity of internships can ultimately lead to a greater geographic diversity of the consultants and of the professionals of the organization. Brazil appreciates the measures taken to address the possible irregularities committed by personnel, especially in the cases mentioned about sexual harassment. We commend PAHO for addressing those regrettable cases, and it's important that we protect the personal data of everyone involved in these cases. Thank you.
Thank you very much. We go to Colombia.
Thank you, Mr. President. We're grateful for the presentation of this report, and we also join in the general praise that it has received regarding human talent management. Now, in line with what Julie said, I do think it would be important for us to receive further detail about the generational aspect, the participation of ethnic peoples, persons with disabilities, and also geographic representation or global representation for personnel. We are also concerned about the fact that comparatively this might be a low, even though it might be a low number of overall sexual harassment cases, but it's still worrisome, and preventive measures should be strengthened. We commend PAHO. We do agree with implementation of the gender policy at all levels, including the fixed-term positions, but it's important to say that merit has to figure, get top billing, that we not just be filling quotas, but that whoever the candidates are actually have the merit, and so anyone, the striving for gender parity should not be at the expense of merit. Now, in the recruitment process, we do think that for the national offices, it's too much, the time period necessary is too long, and sometimes for candidates it's a 4 or 5 month delay, and that really doesn't meet the needs and contingencies that country offices are faced with. Thank you.
To Argentina.
Thank you, Mr. President. Argentina takes note of the report, and we commend and celebrate the key role played by the personnel of the office and their commitment to carry out the initiatives to meet the emerging challenges of public health and to improve health throughout the region of the Americas. In keeping with the strategic plan of the Pan American Health Organization 2020-2025, we support the Personnel Strategy 2.2 based on optimizing the function and innovation of recruitment. We are pleased to see the implementation of a comprehensive plan for mental health personnel. We are proud to see that a percentage of professionals who are hired abroad for fixed-term positions include professionals from Argentina. We continue to support the selection processes as they go forward, and we support all countries or encourage all countries to apply for these positions. Thank you.
We go to El Salvador.
We also thank and praise the report that was just presented. We do think that's important for us to take action on matters of sexual harassment because we are all health personnel, and at the same time, the population of the personnel deserve respect, and especially those working internally need that respect that much more. It's also important to implement a zero-tolerance policy within this institution, as well as is done in most health ministries by way of preventing the problem and not having the institution's image be sullied because of this issue. Now, I would like to ask about projections about future projections based on current scenarios. If we could have a mapping of where more staff might be needed, what type of staff, and in what regions. Thank you.
Thank you very much. We go to Mexico.
Thank you, Mr. President. The Mexican delegation would like to thank the Secretary for submitting that report on the management of human resources. We recognize the work done by the organization to make the labor force more effective and efficient, a key part of technical cooperation offered to member states. We also celebrate, as a part of this strategy, progress made by PAHO by putting together a larger percentage of women or bringing them into the labor force and the importance given to mental health. Lastly, we join the request by Chile and Colombia for more precise and detailed information be given to us of the profiles of the staff working here at the organization. That could be helpful for us. Thank you.
Thank you very much. I now yield the floor to Dr. Barillas to respond.
Thank you, Mr. President.
Several questions address around the same topic, so let me try to compile my answers. Regarding one of the recurrent comments are regarding sexual harassment. I would like to mention and emphasize that the organization has a zero tolerance policy, has been in place for several years now, and it's, I think that the institution of this, of the implementation of this policy has also stimulated staff to report cases. So it's been obviously it's a cultural change in the organization, but you can be assured that there is no case in which a staff reports sexual harassment or what could be sexual harassment that is left without an investigation. This organization takes extremely serious that type of those types of claims. Regarding the efficiencies, thank you for the comments. Yes, in fact, the organization has tried, after the implementation of PMIS in 2014, tried to obtain efficiencies from the system as much as possible. Automation, type of reports that provide information for decision making are now available for the senior management and for managers of the different entities. We have created dashboards, information dashboards for people to have information at the fingertips. So we continue working in the enhancement of the PMIS. Regarding the, I just want to emphasize what I mentioned. Our selection processes are merit-based, and we do recognize that our selection processes have room for improvement. And also, as I mentioned before, with the implementation of the new module of the recruitment of the workday, the PMIS, we expect to have additional efficiencies because there are steps of the process that are going to be completely automated. We are not going to longer to use outside systems to record information, and that obviously is going to yield efficiencies. I think it's important that you will hear after this afternoon or tomorrow the presentation of the efforts that the organization is making in order to create awareness to report sexual harassment and the actions that specific initiative is how is being implemented. That is going to be, I believe, enlightening for this discussion. I'm sure that the standards of hiring in the new shared service initiative will continue to be the same. that we use for our current staff. One of the initiatives that one of the actions that we use or we implemented when we announced the CPCP positions, the core predictable country presence positions, was that we announced in the web pages of each of the countries the job opportunities. And I think that that is extremely important, not only to use the media, the media that we have available, but also to stimulate application from individuals from those countries. And that is part of the strategy 3.0, people strategy 3.0 that we are working on, that we are proposing to enhance the branding of the organization, the distribution of vacancy opportunities. So it's a comprehensive package in order to bring the best possible talent. We take note, of course, of the wish of the member states to have more granular information about the profile of the individuals that we hire. That's something that we take note and we will implement. And I think that addresses the majority of your questions, but of course I am available if I fail to answer your questions. Thank you very much.
Thank you very much. Dr. Barbosa.
Yes, thank you. Thank you, Mr. President. Thank you for, I think that our member states very important comments. I just want to add to the comments made by Lucy Barilla some points. First, about the question that the U.S. delegate raised about our staff is PAHO staff. For this reason that we need to approve the changes in the rules here in our governing bodies because they are not hired by WHO, they are hired by PAHO. So this is one thing. The other thing, I cannot provide now the information about if there is an investigation going on about that case. Why? Because in the justice administration system in PAHO, investigation office in a totally independent way performs the investigation. When concludes the investigation, send the outcome of the investigation to the Human Resource Department. The Human Resource Department makes the decision about the punishment based on the fines. If this person doesn't agree with the punishment, they have the right to present an appeal. This goes to the Board of Appeal, and the Board of Appeal makes a recommendation to the director. So for this reason, I don't want to receive any kind of information to not be biased when an appeal is brought to my decision. But I am assuring you that if this case is not being investigated, I will ask the investigation office to start immediately the investigation, and I will report back to you and other member states about that, because I agree that this is important. Let me, about sexual harassment, I fully agree with all the comments. I think that maybe we should have a different flow of our discussion, because we are discussing the cases and the punishment, and we will discuss the prevention program after. So maybe next time we can present in the right flow the prevention program that we have in PAHO, that I think that will be presented, will be shared with you, and is making important strides. But it also is important to know that in our organization, we need to prevent and to invest a lot in prevention, but we also need to be ready, if one case is detected, to act immediately and to protect the victim, to protect against any kind of retaliation, to proceed the investigation, and to to promote the proper measure against the perpetrator. In recent years, we had people dismissed from this organization, people with high-level positions. We had the PWRs, we had people with high-level positions that we found that there was a substantiated allegation for sexual harassment, and the punishment was dismissal. But I fully agree that we need to really to work together how we can improve this. About the CPCP, the predictable country presence, just to remember the member states, this was an initiative that was launched by WTO when the member states approved that increase of 20% 3 years ago. So there was the member states, I think that, and I again thank our member states for their strong advocacy, that they, when you approved, you said, okay, we are approving, but part of this increase should be directed through the regional office to strengthen country presence. So we performed an analysis for this reason that the figure, that map that Lucy presented. We identified where were the countries that we had that you had less capacity than it was supposed to have, because we were missing some crucial areas like public health emergencies, like elimination of communicable diseases. So we use these funds. These funds coming through the regional office, but these people, they are PAHO's staff too. They're not WHO staff, just to clarify. And we had this selection process. We are very proud, and this was a very important achievement that Lucy had a very important role with the CSC office, the country offices, the technical department. First, PAHO, we made the decision to have 100% of the positions for technical positions. We didn't use any of these funds to establish administrative positions at the country level. So these people are working on non-communicable diseases, communicable diseases, immunization, health systems and services, public health emergencies, and other technical important aspects. And we were the first region to complete the process. Now we have 36, as was presented. We have only 3 positions that are not filled because we are waiting to have a better scenario about the funds that we will have to complete this year and for next biennium. Let me switch to Spanish. Sobre el tema de la diversidad.
In connection with geographic diversity, we do attempt to have greater geographic diversity, but we cannot have quotas. Unfortunately, we cannot have a situation in which one country that has less staff has to go through a selective process. That is only taken into account, but it is only by merit. So what we're doing is set up some initiatives, and I also wish to commend Lucy for her leadership in attempting to have more opportunities so that people from countries that are underrepresented here will become acquainted with PAHO and will have the possibility of approaching the organization, getting closer to the organization, understand the international sort of work that we do, and be able to show up and apply for selection processes under better conditions. So in the past, these processes of internship, these internships at PAHO, we only received practically some masters in public health from George Washington University, from other universities, Georgetown University, and other universities close by. Now, since we have a small financial support, but we do have that support, that enables some people from South America, Central America, or the Caribbean to be able to have their internship spent here at PAHO, become acquainted with the organization, and being in a better position. Now, after many, many years, we are ready to conclude another process that will be important, which is volunteers. Volunteers in keeping with the United Nations rules that is offered to professional young people who want to have some job as a volunteer in PAHO or in a given country so that they can become acquainted and familiarize themselves with the organization, know how we work in the organization, and be able to apply for that. So we cannot set up quotas, but we do take into account some actions that ought to be implemented for countries, for those countries that are underrepresented to be in a better position to participate with the candidates from these underrepresented countries to be in a better position to apply for these selective processes. I would also like to thank Chile for bringing up mental health. We established how this was done. It was an important initiative taken by our dear Director Emeritus Carissa Etienne. This was done during the pandemic to have an advisor, a counselor, aside from letting people know what our staff can have access to in terms of mental health, just like any other person. But we now have one person that is more specialized on matters of stress related to the workplace and to the work environment. That person has been extremely valuable with a significant interaction with the offices, with the country offices, even in extreme situations that we had, such as the loss of fellow workers, which is always dramatic, losing a relative, the son, someone related to a member of the staff, which leads to a lot of trauma for the people working for PAHO as well as their families. So it seems to me that this is an important action to be considered. And last but not least, I would like to say that I always had the feeling or the impression that there's always something better to do, distinguished President and dear members of the Executive Committee, that there's something better in the policy we have for retirement, because people retire very young from this organization. So our dear Lucy Barillas is retiring. This is the last meeting in which she participates, and I would like to express my profound gratitude to Lucy because from the very first moment of my mandate, I launched a challenge to all departments, all facilitators, all those that are key for technical cooperation. So we shouldn't have any doubt in our mind that the work done in human resources, in IT, in procurement, they all play a very important role. The financial department, planning department, they all play a very important role for technical cooperation. And I told them all those who were able to show key performance indicators. Human resources, one of the first ones in presenting this, and this enabled us to open up things and to see where the bottlenecks were in this election process. Because where we don't have any indicators, everybody starts blaming the others. So the technical department said, no, it takes a lot of time because human resources goes through the red tape. It takes them a long time to do it. And when we opened up all the pieces with the times, half of the process was human resources, and the other 50% was in the hand of the technical departments. And that enabled us not to identify who was guilty, but to identify where we found room for improvement. And that is being done, and that is why the hiring times have already been reduced in 2 years, but they will be even more reduced. But Lucy, with her sensitivity, she helped us a lot in issues such as the recognition program of the seniority of our consultants, actions that without adding additional expenses to PAHO, they provide better satisfaction and better commitment and engagement of the person with the organization itself, because they started receiving a more important recognition of the work they do. So I want to ask each and every one of you to let's give a big round of applause for our dear Lucy Barillas.
Muchísimas gracias.
Thank you very much. I never dreamt having such a farewell. I'm really grateful. It has been a beautiful stay in this organization, but you as member states have made it possible for us to have that motivation to come to work every day. We want to continue delivering what you deserve, and these meetings are extremely useful, so please continue to participate the way you do. Please give us your comments, and also your criticism. It's important, so thank you very much. And thank you, Dr. Barbosa and EXM for this opportunity. Thank you.
Thank you very much, Dr. Barilas, for your service to PAHO, and we wish you a happy retirement. I would now like to inform the committee that the discussions would be reflected in the final report. We now go to Okay. We now go to item 3.2, PAHO Award for Health Services Management and Leadership 2025. I'd like to bring document CE 176-5 and Addendum 1 to the attention of the committee. Following the procedures for the PAHO Award for Health Services Management and Leadership, the award committee met on the 23rd and the 24th of June 2025 and assessed the relative merits of the candidates with regards to the following. The award is conferred on a candidate who has made a significant contribution in his or her country and or throughout the region of the Americas to improve the development of health systems, the organization, management, and administration of health services, the development of programs, projects, or initiatives that have demonstrated impact on population coverage and access to health services, the expansion of health services to meet the needs of the population, in particular those in situation with greatest vulnerability, the development of quality programs and patient safety programs at the national or institutional level, the organization and management of primary health care services at a community level, the development of integrated networks of health services, including hospital services, or the production of knowledge and research to achieve change in health services delivery. The award is conferred in recognition of the work completed in the preceding 10 years. I now invite the representative of the award committee, Dr. Bonilla of El Salvador, to report on this item.
Thank you, Mr. President. Premio OPS a la gestión.
PAHO Award for Health Services Management and Leadership 2025. Report by the jury to give the PAHO Award for Health Services Management and Leadership 2025. The jury, in order to assign this PAHO Award for Health Services Management and Leadership 2025, was made up by the delegates of Chile, El Salvador, and Guyana. The award committee met on the 23rd and 24th of June 2025 during the 176th session of the Executive Committee and examined the information on the candidates nominated by member states. Namely, the candidates of the award are Esteban de Jesus Aguilar Arias from Costa Rica, Silvia Natalia González Villalobos from Costa Rica, Frances Joana Fuenmayor Oramas from Ecuador, Felicita Clotilde Vázquez de León from Guatemala, Roy Fitzgerald Flores Alvarado from Guatemala, Carla Marina Paredes Reyes from Honduras, Irad Milton Potter, British Virgin Islands, Petrona Davis, British Virgin Islands, Juan Algen Rivera do Marco from Mexico, Teresa Shama Levy from Mexico as well, Yelkis Gil Mojica from Panama, Ángel José Ortellado Maidana from Paraguay, and Julie Esther Caballero Peralta from Peru. The award committee recommended that the PAHO Award for Health Services Management and Leadership 2025 be granted to Dr. Julie Esther Caballero Peralta of Peru. The award committee recognizes the merits of the 13 candidates, and in particular those of Dr. Julie Esther Caballero Peralta for her leadership in the expansion and strengthening of mental health services in Peru, for her ability to identify the mental health needs of the population, for her participation in regional studies, and for her significant contribution to the development of policies, regulatory frameworks, and programs and technical guidelines promoting coverage and access to health services to meet the needs of the population, particularly those in conditions of vulnerability. Dr. Caballero Peralta has been key in the implementation of the mental health law in Peru, particularly in the establishment of more than 290 community mental health centers, mobile care teams, and integrated services. She has led the various initiatives on emerging issues, including the risks associated with the use of new drugs such as fentanyl. Her work has strengthened community mental health services and contributed to reducing its associated stigma and improving access to health throughout the country. Along with recognizing Dr. Caballero Peralta's work, the award committee hopes that this award will give visibility to her efforts and help promote mental health as a priority in the region of the Americas. The committee recommends that the Executive Committee adopt a resolution along the following lines. Proposed resolution. PAHO Award for Health Services Management and Leadership at 2025, the 176th session of the Executive Committee. Having PP1, having examined the report of the Award Committee of the PAHO Award for Health Services and Leadership 2025, document CE 176/5, Rev 1, Add 1, PP2, bearing in mind the provisions of the procedures for conferring the PAHO Award for Health Services and Leadership, previously known as the PAHO Award for Administration, as approved by the 56th Directing Council in 2018. Resolves to congratulate the candidates for the PAHO Award for Health Services Management and Leadership 2025 for their professionalism and outstanding work on behalf of their countries and the region of the Americas. On the recommendation of the Award Committee to confer the PAHO Award for Health Services Management and Leadership 2025 to Dr. Julie Esther Caballero Peralta for her leadership in the expansion and strengthening of mental health services in Peru, for her ability to identify the mental health needs of the population, for her participation in regional studies, and for her significant contribution to the development of policies, regulatory frameworks, and programs and technical guidelines promoting coverage and access to health services to meet the needs of the population, particularly those in conditions of vulnerability. Dr. Caballero Peralta has been key in the implementation of the mental health law in Peru, particularly in the establishment of more than 290 community mental health centers, mobile care teams, and integrated services. She has led the various initiatives on emerging issues, including the risks associated with the use of new drugs such as fentanyl. Her work has strengthened community mental health services and contributed to reducing its associated stigma and improving access to health throughout the country. To transmit the report of the Award Committee of the PAHO Award for Health Services Management and Leadership 2025, document CE 176/5, Rev 1, Add 1, to the 62nd Directing Council. Thank you very much, Mr. President.
Thank you very much. I now yield the floor for any discussion. Since the resolution has already been read by the representative of the award committee, if there are no objections, I declare the resolution adopted. And you see, every time we adopt a resolution, we can take a break. So you now have a coffee break. Thank you. We come back in
a quarter past or 20 past 4. 20 past 4.
we come back at 20 minutes past 4.
El cáncer infantil afecta a miles de familias en el mundo cada año, generando angustia y sufrimiento. En la región de las Américas, los gobiernos, la OPS y sus socios se han unido en la iniciativa Cure All para afrontar este desafío y devolver la esperanza.
Desde el año 2019, la Organización Panamericana de la Salud, en colaboración con el St. Jude Children's Research Hospital, trabaja incansablemente para mejorar la detección oportuna del cáncer en niños, niñas y adolescentes. En Latinoamérica y Caribe estamos logrando que más países prioricen el cáncer infantil y lo incluyan en políticas públicas que contemplen actividades para promover el diagnóstico oportuno. En los últimos 5 años, se ha incrementado por lo menos en 3 veces el número de países que cuentan con una guía nacional de detección precoz y sistemas de referencia. Ya estamos viendo los primeros resultados y se está logrando que más niños puedan llegar temprano a su diagnóstico, que más niños puedan tener estadios precoces de enfermedad y que amplíen la posibilidad de curarse.
En el Perú, hemos logrado reducir el 50% del tiempo diagnóstico en un lapso de 5 años. Principalmente desde la Iniciativa Mundial de Cáncer Infantil. El tiempo en el que los profesionales de la salud, médicos y enfermeras, demoraban para hacer el diagnóstico en niños desde la sospecha de cáncer se ha reducido de manera significativa. Actualmente, los niños y adolescentes llegan más rápido a los establecimientos de salud. Este logro es un trabajo conjunto desde el Ministerio de Salud a través de políticas públicas que impulsan la detección temprana de cáncer infantil, asimismo el fortalecimiento de las capacidades de los profesionales de la salud, la sensibilización de la comunidad para poder realizar un diagnóstico oportuno y, por supuesto, la participación de la sociedad civil organizada.
Hemos logrado disminuir en un 50% los casos de estadios avanzados de cáncer en los niños. Esto significa que más familias reciben un diagnóstico temprano y más niños tienen una oportunidad de vida, educando y sensibilizando al personal de salud y a la población.
La Organización Panamericana de la Salud pone a disposición de los países diversos recursos técnicos, como cursos virtuales, talleres y guías interactivas para fortalecer la capacitación de los profesionales de la salud, así como materiales para campañas de comunicación dirigidas a los padres y a la comunidad en general.
A través de Cure All Américas, también se está apoyando a los gobiernos en el monitoreo sostenible y uniforme de sus progresos, así como en la implementación de políticas de salud que fortalecen el acceso al diagnóstico temprano, tratamiento y cobertura financiera. Todo con un objetivo, un diagnóstico temprano que salve vidas y mejore el futuro de nuestras familias y comunidades.
Cada intervención en salud pública, cada acción coordinada y cada esfuerzo compartido son pasos hacia un futuro donde hay más niños que puedan superar el cáncer.
Un diagnóstico temprano salva vidas.
En 2019, los Estados miembros de la Organización Panamericana de la Salud, OPS, aprobaron la iniciativa para la eliminación de 30 enfermedades infecciosas en la región para el año 2030. En el marco de esta iniciativa, en 2023, se conformó una alianza con el gobierno de Canadá para un proyecto de eliminación del tracoma como problema de salud pública para el año 2028. Venezuela es uno de los 10 países que participa en esta iniciativa.
Tracoma es la primera causa de ceguera producto de infecciones, lo produce una bacteria y estamos ahorita aplicando la encuesta para ver de prevalencia, para ver si es un problema de salud pública para el Estado.
Durante 2 semanas, un equipo de evaluaciones rápidas de tracoma del Ministerio del Poder Popular para la Salud abordó 30 poblaciones indígenas en busca de tracoma, una enfermedad que afecta sobre todo a poblaciones en situaciones de mayor vulnerabilidad. La idea es estimar la prevalencia de esta enfermedad en el país. y determinar si constituye un problema de salud pública.
Andamos un equipo de salud desplegado diagnosticando la enfermedad tracoma. Esta es una enfermedad que afecta el ojo, que posteriormente la persona queda ciega. Y como parte de prevención, le estamos orientando a las personas a tener una buena higiene personal, como el lavado de manos, la limpieza facial. También contamos con tratamientos si en el caso de que los pacientes lleguen a salir positivos a estas enfermedades.
La OPS acompañó y prestó apoyo logístico para el traslado de estos trabajadores sanitarios del ministerio hacia estas comunidades, 22 de acceso terrestre y 8 de acceso fluvial, aprovechando además para ofrecer distintos servicios de salud a las mismas.
On November 14th, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
En el Pacífico colombiano, las comunidades indígenas y afrodescendientes enfrentan grandes dificultades: el conflicto armado, la pobreza y el aislamiento. A través de un esfuerzo conjunto de las Naciones Unidas, diversas iniciativas están resolviendo estas emergencias, fortaleciendo la resiliencia comunitaria, creando nuevas oportunidades en medio de esta adversidad. Esta alianza de Naciones Unidas permitió a estas comunidades afectadas por el conflicto diversas estrategias complementarias: temas de seguridad para la población con ACNUR, escuelas seguras para niños, niñas y adolescentes con UNICEF, fortalecimiento de la salud sexual y reproductiva y violencia basada en género con UNFPA. Además, se promovió la sustitución de cultivos de coca por proyectos productivos como criaderos de pollos, lecciones de pesca, huertas caseras y medicinales, acciones realizadas por la FAO. La Organización Panamericana de la Salud logró dar acceso a salud a estas poblaciones de los departamentos de Nariño, Valle de Cauca y Chocó. Se lograron avanzar hasta 24 brigadas de salud y más de 8.200 atenciones en una atención integral de medicina general, ginecobstetricia, odontología o apoyo psicosocial, con un enfoque étnico-cultural. Esto acompañado con dotación de medicamentos y diferentes pruebas de diagnóstico rápidas para una mejor resolución de las temáticas.
Este trabajo que ha venido desarrollando la Organización Panamericana de la Salud ha permitido hacer unas transformaciones de fondo en cómo mejorar el modelo de salud, en infraestructura, en capacitaciones, en dotaciones, para que la comunidad tenga una salud digna, oportuna, con seguridad del paciente.
Pues de solo entrar, pues uno sentía la enfermedad más grave.
por el calor, el aspecto, y ahora es un cambio extremo. Uno entra y siente que hay más frescura, más tranquilidad, el calor poco azota, ahora estamos mejor.
Se atendieron numerosos casos críticos de malaria, desnutrición aguda, ideación suicida. Además, se realizaron encuentros de parteras, médicos tradicionales y sabedores, que en un espacio de diálogo de saberes con médicos y enfermeras occidentales permitió el intercambio de conocimientos con el fin de salvar vidas y evitar muertes maternas. Además, nos reunimos con la institucionalidad local para identificar sus fortalezas, retos y desafíos.
Al tener una comunidad capacitada en primeros auxilios, en comunicación del riesgo, en salud mental, primeros auxilios psicológicos, en las emergencias, vamos a disminuir el impacto que una emergencia pueda tener en la comunidad, porque ellos van a saber cómo actuar en un momento adecuado, un protocolo adecuado, un procedimiento adecuado frente a las emergencias que ocurren en nuestro departamento.
A lo largo de esta trayectoria hemos aprendido cómo hacer un torniquete y, sobre todo en un accidente, mantener la calma, asegurar la escena.
Hemos realizado taller de primer respondiente comunitario, donde ellos lo que hacen es cómo dar esa primera ayuda comunitaria cuando se presenta una emergencia.
Adicionalmente, se estableció el sistema de alerta temprana en estas comunidades. Se trabajó mucho con esta estrategia nacional de la vigilancia de base comunitaria.
Por eso dentro del proyecto SERF también incluimos el componente de comunicación del riesgo para que estos gestores comunitarios, para que estos primeros respondientes también puedan hacer uso de las comunicaciones en toda su labor de salvar vidas, de darle a la gente capacidades para que tenga un buen vivir.
Depois de décadas de esforços integrados e multissetoriais, a filariose linfática deixou de ser um problema de saúde pública no Brasil. O certificado de eliminação da doença foi entregue pelo diretor da OPAS e do Escritório Regional da OMS para as Américas, Jarbas Barbosa, à ministra da Saúde, Nízia Trindade. A cerimônia de entrega ocorreu no marco da reunião do Conselho Diretor da OPAS, nos Estados Unidos, que contou com a presença de autoridades de saúde de todos os países das Américas. A filariose linfática, mais conhecida como elefantíase, é uma doença parasitária transmitida por mosquitos. Ela afeta o sistema linfático e pode causar inchaços graves, especialmente nos membros inferiores e nos genitais, causando bastante dor e podendo resultar em deficiências permanentes. Para combater essa doença, o Ministério da Saúde do Brasil lançou em 1997 o Plano Nacional para a Eliminação da Filariose. A partir daí, várias medidas foram implementadas, como a distribuição em massa de medicamentos antiparasitários, controle de vetores e monitoramento constante nas áreas mais afetadas. Esses esforços se concentraram nas áreas onde a filariose era endêmica e resultaram 10 anos depois no fim da transmissão da doença. Desde 2017, não há mais casos confirmados de filariose no Brasil. A eliminação da doença é resultado do trabalho conjunto de trabalhadores de saúde, pesquisadores e gestores, bem como da criação de um sistema de saúde universal, com ações de vigilância bem estruturadas, uma rede de laboratórios públicos especializados e o lançamento do programa Brasil Saudável, que é uma ação multissetorial alinhada com a iniciativa regional da OPAS para a eliminação de doenças até 2030. Com essa certificação, o Brasil demonstra forte compromisso com a proteção da saúde, em especial das populações mais vulnerabilizadas.
Entonces, para nosotros es importante no poder haber llegado acá. Esta visita responde a un proyecto que estamos ejecutando desde el punto de vista de la salud ocular. Estamos acompañando a todo el equipo evaluador que se va a encargar de hacer este trabajo para ver si tenemos alguna patología que tenga que ver con tracoma ocular.
Estamos en la comunidad de Las Flores.
Acabamos de tener una reunión con los comunarios.
Hemos venido a conversar, ¿no?, con las autoridades aquí del lugar
para organizar el pesquisaje que se va a realizar para el tracoma.
Vivir en Puerto Las Flores bien nomás, bonito nomás estar aquí del aire, recibimos, respiramos, ¿no? En Puerto Las Flores no existe la electricidad.
Han levantado ya hace más de un año un tanque, han puesto agua, han hecho pozos, pero el agua no es buena.
Cuando estamos mal de los ojos nos afecta, ¿no?
No solo en Las Flores, ¿no?, sino en distintas comunidades. Hay deficiencia, ¿no?, en el tema de lo que es salud y de educación más que todo, ¿no?
Nunca me hablaron del tracoma, no sabía de esta enfermedad.
Nunca había escuchado del tracoma.
El tracoma es una enfermedad infecciosa que afecta principalmente a los párpados, posteriormente a la córnea y puede dejar invalidado a un paciente produciéndole una ceguera permanente e irreversible. Se contagia de forma directa, es decir, de persona a persona.
En especial los niñitos, digamos, se tocan y pueden estar dando la mano a otro niño y así se puede contagiar.
Cuando ya tienen triquiasis ya se van sacando las pestañas, sino depilando, le estorba ya.
Esta enfermedad se ve principalmente en zonas con poca o ninguna sistema sanitario.
Donde no haya agua segura.
Con dificultad en sistemas de alcantarillado.
Dentro del registro que nosotros manejamos como Ministerio de Salud, no tenemos incidencia, ¿no?, a nivel nacional, ¿no? Sin embargo, tenemos países vecinos en los cuales sí ha sido un problema de salud pública. Es por ello que estamos ejecutando este proyecto, que es una evaluación rápida para tracoma ocular en comunidades vulnerables, ¿no? Una vez termine este proyecto, nosotros vamos a tener la capacidad de poder determinar si tenemos o no y si realmente el tracoma ocular para nosotros es un problema en salud pública.
Venimos a visitarlo. Estamos viniendo casa por casa a revisar una enfermedad que nosotros estamos buscando, que se llama tracoma. Con su permiso lo vamos a hacer el examen y a todo el miembro de la familia.
Sí, pasen nomás.
Muchas gracias. Va a mirar hacia abajo, mira hacia abajo. Mira hacia arriba. No, su ojito no sé. Ahora mira hacia abajo. No parpadea ya, si no voy a hacer.
La detección del tracoma es importante, puesto que si nosotros lo detectamos a tiempo, vamos a garantizar la salud y la estabilidad ocular del paciente. Haciendo una detección, haciendo las campañas de prevención y promoción, evitamos la proliferación de esta enfermedad que como resultado final lleva a la ceguera. Entonces, si nosotros actuamos temprano, prevenimos a un paciente ciego en el futuro.
Doy la bienvenida a todo el equipo médicos. Esta es nuestra comunidad de la Nación Yuki. Bienvenidos.
Para nosotros es por primera vez que han venido a ver los ojos de nosotros. Los comunarios hemos venido de las tres comunidades, Viarilloa, la comunidad Pachino y la comunidad de Villarecuate, donde estamos en este momento.
La brigada que viene es de mucha ayuda para nosotros porque, bueno, en Villarecuate la gente tiene muchos problemas sobre el ojo.
Es la primera vez que me revisan mis ojos.
Esta es la primera vez que me revisan ojos aquí en comunidad.
Nunca había escuchado esa enfermedad tracoma.
Nunca había escuchado de que se pueda contagiar la enfermedad tracoma así con la mano sucia.
En calidad de cacique mayor, yo le he dicho a toda la población de que tenemos que hacernos ver nuestros ojos a los médicos que han venido.
Venimos trabajando ya anteriormente en el Gran Chaco, en Santa Cruz, en el municipio de Camiri. Esta versión ya hemos visitado 3 comunidades aquí del trópico. En esta actividad también hemos diagnosticado otras patologías, además de tracoma. Y bueno, como Ministerio de Salud estamos programando ya actividades también para poder atender esta otra patología, como son las cataratas y terrigio, que son de mayor relevancia en la población adulta o mayor. Vamos a llegar como Ministerio de Salud con cirugías de cataratas y terrigio de manera gratuita para la población que se haya encontrado con esta patología. Estaremos visitando el departamento de Pando, las comunidades indígenas, posteriormente el departamento de La Paz, el norte de La Paz específicamente, porque son las comunidades indígenas que estamos priorizando para poder ampliar la cobertura en la búsqueda de la patología denominada tracoma.
Esta enfermedad puede tratarse con una higiene adecuada. No se trata solamente de venir y curar, se trata de venir y enseñarles cómo cuidarse. Eso es más importante que pediría.
Good afternoon. Good afternoon. All right, so let's get on our way. Let's get started. So we have 2 remaining items for today. And since you have been behaving well the whole day, I guess this wouldn't take very long. So item 6.3, update on preventing and responding to sexual misconduct in PAHO. I would like to bring document CE 176/25 to the attention of the committee and invite Ms. Alicia Jaimes, the Senior Advisor of Ethics Office of the Pan American Sanitary Bureau, to come to the head table and present the report. Over to you.
Thank you, Mr. President. Distinguished members of the Executive Committee, colleagues, and partners, I am the Senior Advisor in PAHO on the prevention and response to sexual misconduct, and I have the privilege to provide an update on our work to prevent and respond to sexual exploitation, abuse, and harassment, also referred to as sexual misconduct, or PRESEA for its acronym. Over the past year, we have built a stronger foundation for this work. A dedicated Presea team now operates with a regional lens, supported by trained focal points in every country office and center. These focal points are local champions raising awareness, conducting risk assessments, and connecting people to support services. In May 2024, we brought the focal points network together in Cartagena, Colombia, to strengthen capacity and reinforce our shared commitment to integrity and trust. And in February 2025, we issued clear terms of reference for this critical role. We believe that a risk management approach is key to preventing sexual misconduct from happening in the first place and promotes accountable leadership at all levels of the organization. To this end, we have adapted the WHO Sexual Misconduct Risk Assessment tool and embedded it into our enterprise risk management cycle. Every country office and center now proactively identifies risks and takes mitigation steps, from raising awareness among personnel and partners to ensuring reporting mechanisms are accessible and simple to use. Improving knowledge and awareness is a cornerstone of our approach. As of March 2025, 95% of personnel had completed the UN training course on preventing sexual exploitation and abuse. Our goal is 100% compliance. We continue to undertake in-person and virtual trainings across the region. Country focal points have led their own sessions, extending training to community partners, suppliers, and local stakeholders. We're happy to see that these efforts have led to increased reporting of sexual harassment and other wrongdoing. The feedback we continue to receive from the country offices that have undergone our training affirms a powerful truth. We are investing in building trust and confidence in our justice systems. Every positive feedback and every new allegation reported reflects the transformative impact of our efforts. We are creating a safer environment within PAHO where people feel heard, supported, and equipped to do what's right. To make it easier to report concerns, PAHO Integrity Helpline was redesigned in 2024 to make it more user-friendly. A new QR code was introduced along with outreach materials that encourage reporting and clarify the process. These improvements are helping to bridge the gap between concern and action, an essential part of building trust in our systems. In parallel, we made meaningful progress on the development of a comprehensive policy on sexual misconduct. Over the past year, we have identified key gaps in the current incident management system and designed a roadmap for a more integrated and survivor-centered approach. This serves as the foundation for a new policy to be developed through a broad consultative process that will start in July 2025, an important step towards systematizing our zero-tolerance commitment across all levels of the organization. As we move forward, we know that systems alone are not enough. Changing organizational culture is our next major focus. We're collecting data through multiple channels, including a workplace culture survey, the annual UN Sexual Exploitation and Abuse Survey, and the 2025 Ethical Climate Survey, to shape a forward-looking action plan. Despite the encouraging progress, we know underreporting remains a challenge. The UN annual SCA survey revealed, for example, that while 16 individuals in PAHO reported experiencing sexual harassment during the previous 12 months, only one of the survey respondents filed a formal complaint. Fear of retaliation and inaction remain real barriers. We must continue building a culture of trust and safety, where speaking up is protected and supported. Looking ahead, our priorities are focused and ambitious. First, we aim to finalize and roll out the comprehensive sexual misconduct policy. Second, we seek to integrate the Presea risk assessment into every part of our emergency and community-facing work. And thirdly, and most importantly, we aim to transform our workplace culture to ensure that everyone at PAHO not only knows sexual misconduct is unacceptable, but feels confident they will be heard, supported, and safe. We know this work is not just about policy, it's about people. It's about creating a PAHO where integrity is not just expected, but lived, and where justice, dignity, and safety are the standard, not the exception. I thank Member States, our Director, and the PAHO leadership team for the continued support as we advanced in this essential work. Thank you.
Thank you very much. The Executive Committee is now invited to take note of the report and to provide any comments it deems pertinent. I'll now open the floor to the plenary for a discussion. Canada, you have the floor.
Thank you, Mr. President. Canada welcomes this report on preventing and responding to sexual exploitation and abuse in PAHO. We commend the Secretariat and all PAHO staff and personnel for their ongoing commitment to preventing and responding to sexual exploitation and abuse and sexual harassment. Canada applauds the organization's ongoing steps toward implementing organizational changes to address sexual misconduct. Transparency, accountability, and victim survivor-centered measures will be critical for sustained change. More work is needed as the United Nations SEA survey results revealed that in 2024, 16 PAHO respondents reported having experienced sexual harassment at work, while only one person reported on it, and that 26 PAHO personnel reported knowing about a suspected case of SEA, and half noting that they did not report it. Efforts must continue to address this issue, including strengthening awareness-raising efforts, the integration of effective training, and encouraging reporting. In this regard, we are encouraged by the organization's efforts to make it easier to report allegations of misconduct, including via the redesigned Integrity Helpline. Canada expects that all allegations be fully and immediately investigated and ensure that individuals affected by sexual misconduct have access to the physical and psychosocial support they need. Canada encourages PAHO's ongoing collaboration with WHO and the entire UN system. Canada remains committed to working together with other member states to institutionalize PRSEAH and to leverage collective engagement to have a coherent and lasting impact grounded in respect for human rights, gender equality, and the responsibility to do no harm. Thank you.
Thank you very much. Chile?
We concur with PAHO in their determination to prevent and respond effectively to all cases of sexual harassment, abuse, and exploitation, and to not accept sexual misconduct. We appreciate the creation of special units and the creation of focal points and contact points for the victims and the constant education of staff to ensure safe working conditions for all. Once again, we express the need to ensure compliance of the standards for protection created and applied for the organization and in any other contract where they have an interest. The reputation of PAHO and the achievements should not tolerate any disparate type of effect through outsourcing of services. We welcome progress in developing a new integral policy on the prevention and response to sexual misconduct by determining the main deficiency in the integral management of cases and the creation of roadmap, and hope to see the results of the consultation process that is going to begin in July of this year. Thank you very much.
Thank you. The United States?
Thank you, Chair, and thank you to the briefer. The United States acknowledges PAHO's continued attention to strengthening both its sexual misconduct prevention and response efforts. We know dedicating advisors and focal points to raise awareness of and support response to sexual misconduct claims, as well as in revising terms and conditions for goods and services contracts that emphasize the organization's zero tolerance for SEA. We also note the efforts to improve the capacity of personnel to address SEA, accessibility of the Integrity Hotline, and the launch of the Misconduct Allegations Public Dashboard. Notwithstanding this progress, the United States agrees with the report's conclusions that more work is still required so that people feel comfortable reporting any allegations. PAHO needs to increase its efforts to create trust in the system and take steps to support and protect those who come forward. My delegation also requests more information on how PAHO is assessing the capacity of its implementing partners to prevent and respond to sexual misconduct, as noted in paragraph 13 of the report. Could the Secretariat please advise what mechanisms are already in place to ensure its implementing partners are fully held accountable for preventing, reporting and addressing any misconduct. Zero tolerance must remain both the response and the key internal message to staff in all categories organization-wide. The report notes that 4 individuals were placed on an internal do not hire list, yet only 2 were added to the United Nations ClearCheck database, while the other 2 are being reviewed by management as of the end of 2014. Could PAHO please provide any updates, and if the other 2 individuals have since been added to the ClearCheck database, as it remains important to respond swiftly and utilize all available mechanisms to ensure that perpetrators are never again eligible for hiring consideration or contract opportunities. My delegation is also requesting the completion of the new comprehensive policy on the prevention and response to sexual misconduct and urging PAHO to move forward as swiftly as possible. And we wanted to ask when you might anticipate the policy might be finalized. Thank you.
Thank you very much. I now ask Ms. Jimenez to respond.
Thank you. I will take 3 of the questions, and then I think on ClearCheck and the do not hire list, I'll revert to human resources for that. Thank you to all the member states for your comments. On the question on access to services and making sure that all victims have access to services, one of the key efforts that we undertook at all country level, at all the countries last year, was extensive mapping of services for victims of all types of sexual misconduct. So now we have an internal database that has also been shared with sister UN entities, where we led on the process, so that people can have immediate knowledge of what services, support services are available, both internally within the UN system and at the country level. On the question on capacity assessment of implementing partners, in fact, we have done some progress in this area. We have been utilizing the same methodology as other UN agencies have been using, and I'm happy to report that as of last week, we have agreed with UNICC, that manages the UN partner portal, that all PAHO.org email addresses will have access to this as viewers, so that we can also make sure that this information is available at a country level, and they know which partners have undergone such capacity assessments. On the question of the policy process, we have made substantial progress on identifying what were the end-to-end incident management gaps. We're working actively with the different departments within PAHO to make sure that these processes are clear. And the policy to us is a document, right? What matters is when the policy means, action. And we're very clear on how to move expediently and with a survivor-centered approach. So we have made progress towards those protocols, those coordination and communication mechanisms internally, and we expect the drafting of the policy to start in July with those mechanisms almost all clarified. And we hope that by October we will be working with the external advisory group that we had mentioned, I think, last year, that we would establish to receive inputs from different experts on this issue and inputs from different stakeholders as needed to improve our policy. I think I'm going to stop there, and I'm going to pass to HR. Thank you. Apologies. I think our legal department will take the ClearCheck question.
I'll now ask the legal department to maybe answer one of the questions.
Thank you, Mr. Chairperson. In relation to the question by the U.S., the 2 cases that were not added to the ClearCheck database was because they didn't meet the requirements to be added. Specifically, the individuals had not received notice that this was a possibility, and 2, they were non-staff. That's why they were not added in these specific circumstances. Thank you.
Thank you. Dr. Barbosa.
Thank you, Mr. President. I want to thank the comments from Canada, Chile, and the United States. I think that's really important, the discussion about this topic. My my belief is that the first step to have an effective prevention and response to sexual misconduct in the organization is to recognize that we are starting the process. When you see the data that our presenter, Ms. Aletea Jimenez, shared with us from the survey, we clearly see that in the past we didn't have cases, not because they were not happening, but because people were not aware that they should come out, they should report, they should present the allegation. And even now, many people, they still have a fear of retaliation. So I think that it's very important to combine these two pillars that need to work together. First, to strengthen our capacity for prevention, awareness campaigns with the whole staff, but at the same time to a clear process and a clear message that every time that we have an allegation, the allegation will be fully investigated, the victim will be protected, and the perpetrator, after the investigation process, will receive the disciplinary measure that corresponds to this case. So I think that this is a work in progress. We are in the first steps, but our objective is that PAHO can achieve a very high standard among the international organizations, combining these two pillars. And the Aletea Jimenez is now not only one person that works with another advisor that we have in Venezuela, because it was identified also as a vulnerable country that could be more vulnerable to situations like that, but also a network that goes across the whole organization. So every country office has a focal point, and the idea is to strengthen, and that all the staff in this organization, they are listening from their leaders, their executive committee, the directors, from myself, when I have the staff dialogue, the clear message that we have a zero tolerance policy, and we are adopting concrete measures to address all these allegations, and at the same time to increase the awareness and to increase the capacity that every entity in the organization has to implement actions, concrete actions to prevent sexual misconduct in our organization. Thank you, Mr. President.
Thank you, Dr. Barbosa. We go back to the United States.
Thank you very much to the chair for the opportunity to take the floor a second time. I wanted to thank the legal department for the explanation of and the response to that question. My delegation would still be interested to know if, in the framework of a zero tolerance policy, I understand the answer was they were non-staff and they had not been informed that that was a possible sanction. I understand, notwithstanding, I understand a zero tolerance policy to mean zero tolerance. And so I would like to see in the future that all staff of every category, all implementing partners, all contractors and suppliers are informed of the zero tolerance policy, and that is one of the sanctions. That is the utility of ClearCheck. It is an important resource so that we no longer operate in the dark, where if somebody is found culpable of something in one instance, they can just seek employment or contract opportunities elsewhere. So we would be very grateful to see that happen going forward. Thank you.
Let's give the legal counsel an opportunity maybe to respond to you.
Thank you, Mr. Chairperson. Thank you, United States, for the opportunity to clarify this. So the zero tolerance approach is in relation to addressing all allegations of sexual misconduct. And this was done, and the organization takes decisive actions when any allegation is established. After these actions, there is an additional action that the organization can take, which is to register the name of the person with the UN database called ClearCheck. This is the aspect that was not done in relation to those two cases only. So it's just not to allow this opportunity to clarify that this does not mean that the organization did not take decisive actions in relation to these other non-staff members. they were separate. Their engagement with the organization ceased at the moment that the allegation was established. It's just that they were not put on this UN database. Thank you.
Thank you. I hope that clarified the issue. You wanted to? Guatemala?
Gracias, señor.
Thank you, Mr. President. The Guatemalan delegation is grateful for the report presented on the preventing and responding to sexual misconduct. We recognize the commitment assumed and the leadership of the organization when managing this situation by early identification and encouragement of awareness, as well as the transformative effect promoted by this effort. People therefore feel heard and supported. This initiative is a change in paradigm, generating trust and based on a system of zero tolerance, ensuring protection of human rights and support to victims. Guatemala takes note of the report and requests support for having this type of strategy implemented nationally. And furthermore, we'd like to accompany the policy development effort that is underway and that is being promoted. Thank you.
Simonez?
Voy a cambiar al español.
Let me switch to Spanish. I thank the representative of Guatemala for her recognition and for the importance they also attach within that country to this topic. Indeed, we believe that the work conducted thus far in the area of prevention is what actually will change the paradigm. In earlier presentations, we spoke about the work in the area of response. But to work now on prevention and to ensure that ethical behavior and misconduct are not the norm, and we want to truly give greater focus to the culture that we need to work on within the work environment, not only to establish trust within the institution, but also to change behaviors. And thank you very much for requesting support. We make ourselves available to you, obviously, for any kind of support you need in this topic. We will have discussions with other countries and member states who have expressed interest in our work, in learning, in sharing. And as I said, we make ourselves fully available to you. There is something that I omitted earlier to complement what was said by my colleague from legal. We are reviewing all contracts at PAHO to ensure that there is a clear clause about the zero tolerance. This must figure in all types of contract. We start with the first one, contractors, but we have made progress also in making it systematic in all other contracts. We hope to finalize that process in the next few weeks. Thank you very much.
Thank you. I now give the floor to Dr. Barbosa.
No, thank you. I just want to thank the comments from Guatemala and from the U.S., the additional comment. Just to clarify, the zero tolerance policy is not only for our staff. It's for agency, for staff that are seconded to PAHO by the Ministries of Health. For this reason, that when the Human Resources we presented two tables. One is related to our staff. The other one is related to workers from agencies or seconded from Ministry of Health. And they were dismissed when they are hired through an agency, or we returning them to the Ministries of Health, notifying them about the misconduct that they had. But we cannot include the names of people that are not employees of the UN system, cannot be included in the UN clear check system. For this reason that they are not included, but I fully agree with you that our policy it's not only for our own staff, but for outsourced companies, vendors, all the people that work for PAHO and with PAHO needs to accomplish with the same policy. This is a very important topic. I thank you.
Thank you very much. I would now like to inform the committee that the discussions would be reflected in the final report. We go now to item 6.4, statement by the representative of PAHO WHO Staff Association. I'll now like to bring document CE 176-26 to the attention of the committee and invite Ms. Pilar Ramon, General Secretary of the PAHO WHO Staff Association, to give the presentation.
Buenas tardes y muchas
Good afternoon, and thank you very much, Mr. President, for the introduction. Mr. Director, members of the head table, member states, observers and colleagues, we'd like to address you from the Staff Association, as we do every year, on behalf of the over 860 staff members that comprise it. First, to thank member states for their interest in knowing and monitoring the working conditions of staff and the relations between staff and executive management. This interest is very important because it makes sure that these conditions are fair, secure, and encouraging for development, reflecting the value and complexity of staff performance, adjusted always to the provisions of international civil service. It is a privilege to work for the Pan American Sanitary Bureau, in other words, for you, ultimately. It is a privilege obtained after being selected through competitive basis that are merit-based and focused on competency. These introduce international perspectives to PAHO's mission. We want to reaffirm our commitment that is unbreakable with the mandates of the Bureau and to move forward the agenda of the health agenda in the Americas. There are a couple of topics that we want to bring to your attention. They were selected after consultation with representatives of staff at headquarters, at country office, and Pan American centers. The topics are: one, institutional transformation, and second, respectful workplace and internal justice system. These topics are core on the agenda of the Staff Association, and they are interrelated because both have a direct impact on the environment and work conditions for staff members in general. The first, the organizational transformation and PAHO Forward. We recognize the importance of the PAHO Forward initiative to drive efficiency, transparency, and accountability. Institutional transformation is crucial to optimize resources of the Bureau and better serve the countries in a cost-effective manner. One of these initiatives within PAHO Forward is the shared services presented by Mr. Chambliss this morning. In this regard, let us point out that the Association has heard expressions of concern by staff at the starting up of these shared services. Although the Staff Association recognized the objective of rationalizing operations and achieve greater efficiency in expenses, we want to take cautious actions when sometimes the service quality can be affected and when we may impact the ability to respond to the context locally. We would like a transparent dialogue, an inclusive dialogue with staff and interested parties continue. It is essential to clearly communicate the functions that are impacted by these shared services, the responsibilities, the execution terms, insofar as this information may be available. The lack of timely communication has already contributed to staff anxiety and declining morale. To mitigate this, the Staff Association advocates for regular proactive updates which reduce uncertainty and foster trust. Furthermore, in addition to implementing the measures mentioned this morning, when talking about the shared services, all of these measures will have a good impact to mitigate the impact on staff. The second topic that we want to bring to your attention is the importance of respect in the workplace and internal justice. These are foundations for preventing conflict and therefore creating a respectful workplace, psychologically safe and of trust, to ensure responsibility when complying with the organization. The Staff Association commends the organization's efforts to promote a respectful workplace through the correct policies. But it's necessary to do more to integrate these values, for that it is necessary to reinforce the Ombudsman and Staff Councillors' action as first responders in conflict prevention and resolution, and two, to provide training to all staff when it comes to emotional intelligence, unconscious bias, change management, and inclusive leadership. Lastly, we want to recognize the review by the management of the internal justice in order to improve efficiency, transparency, and equity. In this context, we know that the integrity and conflict management system is being restructured, and the Staff Association is part of the system. This restructuring is being guided by some updated terms of reference so that the system will have clearly defined mandates, streamlined procedures, and strong accountability mechanisms. As the director mentioned yesterday, it's extremely important for all staff to be informed of available mechanisms to resolve conflicts or disputes, mechanisms that may be both formal and informal. The Staff Association provides collaboration to support and extend these initiatives from management. Furthermore, we decisively support the review of the Code of Ethical Principles and Conduct to reflect current reality, in particular expectations around professional conduct in digital spaces such as social media. In conclusion, the Staff Association will collaborate with management to ensure that matters having to do with conflict and are adjusted to the values of the organization, protect the staff's well-being, and defend the integrity of PAHO's mission. Thank you very much for your attention, and I will happily respond to your comments and interventions.
Thank you very much. The Executive Committee is invited to take note of this report and provide any comments it deems pertinent. The floor is now open. Canada.
Thank you, Mr. President. Canada thanks the Staff Association for their comprehensive statement. Canada recognizes the importance of the PAHO Forward initiative in fostering a culture of efficiency, transparency, and accountability to enhance the effectiveness of PAHO across all levels. Where opportunity presents, the integration of the Respectful Workplace Initiative with the PAHO Forward framework can complement and enhance organizational transformation efforts. Further, as noted by the Staff Association, inclusivity and clear communication is key to a successful transformation. Canada believes psychologically safe environments are important and would like to see clarity from the Staff Association on approaches to embedding psychological safety into the organizational culture. Canada recognizes that the internal justice framework is currently undergoing revision. Issues raised by the Staff Association must be addressed through continued and constructive dialogue for the internal justice system to function effectively going forward. The upcoming strategic plan of the Pan American Health Organization 2026-2031 will be instrumental in guiding these efforts to collaboratively address emerging health challenges and advance equity, sustainability, and health for all across the region. Thank you.
Thank you. Anyone else? If there are none, I go to Ms. Ramon to respond to Canada.
Thank you, Canada. Thank you for the comment, for the question. The term psychological security or safety is relatively new, and basically it is important that it's be part of the culture of the organization. The whole idea is to assure good performance in the workplace if people feel safe and confident. Now, there are several strategies to this end. One important one is to involve managers in this type of initiative so as to promote a respectful work environment. And that is why we're talking about the possibility of having specific training that would be available to all staff. And also, it's very important to work with the ombudsperson. One of the guiding principles for the ombudsperson in PAHO is that he work closely with human resources, with the staff association, and we have periodical meetings so as to build up a safe work environment where there is protection for witnesses, for bystanders. So there are several phases involved in assuring this type of security or safety.
Thank you, Mr. President. Gostaria primeiro de agradecer a Pilar, Ramon.
I wanted to thank Pilar, Ramon, and all of the members of the Staff Association. We have Staff Association both here at headquarters and in the region. So the Staff Association always plays a vital role. They are the channel to learn about the problems that our staff is having. Now, the Staff Association has always shown a great deal of commitment with the organization, bringing us suggestions, proposals, and all of that is very important to fine-tune the work that is done here in the organization, especially in things having to do with the staff. So we have a record of taking note, accepting the proposals that come from the Staff Association. They're always constructive. Now, we just heard from the Staff Association mentioning several things. First of all, the proposals, the initiatives to change the organization. When we talk about there being a shared service center, for example, we have had 2 town halls. I don't know how to say that in Spanish, but we had 2 meetings. And in that way, in the decision process, we move ahead step by step. And so in that way, we can dispel uncertainty. Everyone has the question of what is going to happen to my job. And so that always gives rise to some anxiety. And I recognize what was just said by the representative of the Staff Association. Now that decisions are being made, the very next step is going to be to talk to people so they can know in advance what alternatives they have in order to be able to deal with that situation. So this is definitely an important point being made by the Staff Association. Then the other issue has to do with respect in the workplace. That has always been very important to me in my administration. Everyone needs to know that PAHO is not only a high-level organization that has high standards in public health, and to uphold that high standard, and we have been recognized by our member states because of the quality of the work done at PAHO, but we have to preserve day in, day out. We have to work with all of our managers, with all of our leadership to make certain that PAHO will always be a workplace where people feel welcome regardless of any condition. They need to feel respected. They need to feel happy and proud to work in PAHO. So here we're underlining something that's very important, and that is that we're completely aligned with the need to have greater communication regarding the different opportunities that the staff has to address any potential conflict. I don't know. Remember when Investigations made its report, 50% of the complaints that go to investigation are not for the investigation office, actually. the investigation often sends it to the ombudsperson or to ethics or somewhere else. But the truth is we have to reinforce knowledge on the part of the staff. So if they have a personal problem, and that can happen in any workplace, there is a counselor available to them. The ombudsperson is there. The main thing is that this not escalate into harassment or a worse situation where that would lead to an investigation. So this part that is more preventative, more proactive, definitely should be given greater visibility within the organization, so that people won't wait until they have to file a complaint calling for investigation, but in that way, in a transparent, constructive way, they can use the resources we have. In the ethics department, there can be an ethical matter, perhaps. It's a matter of improving the work environment. So I do take that very seriously.
I think they are well aligned with the process where we seek to strengthen and improve the work environment in the organization. Thank you very much, Pilar.
Thank you. I want to inform the committee that the discussions would be reflected in the final report. And I think that brings us pretty much to the end. Deputy Director, you have anything to say to us?
I don't.
Okay. So, having come to the end for today's work, tomorrow we have one resolution that we still have to decide on. That's the one dealing with the non-communicable diseases. And then tomorrow's agenda for work would be items 7.7, 7.8, 7.9, 2.2, 2.3, 8, and 9. And that would bring the session to close. Now, you have been very good over the last 3 days, and I hope this good behavior continue tomorrow. And I wouldn't be here, but the deputy chair, the deputy vice president would be here. So please be on your good behavior for the vice president. Thank you very much. It has been a pleasure working with all of you.